and Dr. G. Nagabhushanam. In the evening session, we have Geolong Lee, followed by Dr. M. Srinivasalu, Dr. Ram Manohar, Dr. T.P. Shachikumar, and Professor Sumanapala Kulmangoda. And in the last session, we have Professor Gopinathan Pillai, Professor Rajashekaran Nair, followed by Sri Janardhanan Menon and Dr. Lorio Fazio. And Dr. G. Nagabhushanam. In the evening session, begin the sessions Geolong Lee, followed by Dr. M. Srinivasalu, Dr. Ram Manohar, Dr. T.P. Shachikumar, and Professor Sumanapala Kulmangoda. And in the last session, we have Professor Gopinathan Pillai, Professor Rajashekaran Nair, followed by Sri Janardhanan Menon. In the first session, we have Dr. Vaidya M. Prasad and Dr. G. Nagabhushanam, followed by Dr. Rajashekaran. Session, begin the sessions Geolong Lee, followed by Dr. M. Srinivasalu, Dr. Ram Manohar, Dr. T.P. Shachikumar, and Professor Sumanapala Kulmangoda. And in the last session,
या कुंडेनु तुषार हार धवला या शुभ्रवस्तावृता या वीणावर दंड मंडित करा या श्वेत पद्मासना या ब्रह्माच्युत शंकरा प्रभृतिभिः देवै सदा वन्दिता सा मां पातु सरस्वती भगवती निःशेषजाड्यापहा शुक्लां ब्रह्म विचार सार परमा आद्यां जगद्व्यापिनीं वीणा पुस्तकधारिणीम् अभयदां जाड्यान्धकारापहम् हस्ते स्वाटिकमल्लिकां विदधतीं पद्मासने संस्थितां वन्दे तं परमेश्वरीं भगवतीं बुद्धिप्रदां शारदाम्
Professor and Head of Department of Shalaki Tantra in Ashtangam Ayurvedam Chikitsalayam and Vidyapeetham, Kuchanadi, Kerala, to present the topic Deepana and Pajanam, a conceptual analysis. We welcome you, sir.
Prasad, sir, you are welcome, sir.
Thank you very much.
Department of Shalaki Tantra in Ashtangam Ayurvedam Chikitsalayam.
And first of all, let me thank the
organizers
of this
and
beautiful, wonderful program,
to present the topic Deepana and Pajanam,
Vaidya
a conceptual analysis.
for
We welcome you, sir.
inviting me for this presentation.
And Vidyapeetham, Kuchanadi, Kerala, to present the topic Deepana and Pajanam, a conceptual analysis.
Salutations are
We welcome you, sir.
To my Guru,
Prasad, sir, you are welcome, sir.
Raghavan Puripadu.
Department of Shalaki Tantra in Ashtangam
Sri
Ayurvedam
Raghavaya
Chikitsalayam.
Gurave, and first of all, Valsalya Nidhaye Namaha.
Thank
Thank
in Ashtangam Ayurvedam
the
Chikitsalayam
Anugrahindosu,
and Vidyapeetham,
beautiful
Kuchanadi,
Prabha
Kerala, to
Levalesata,
present the topic
especially
Deepana and Pajanam,
Chaturmukha
a conceptual
Samarambham
analysis.
for
We welcome you, sir.
Adhikadacharya Madhyamam, this Asmadacharya Paryandam Vande Guru Paramparam. So,
And
let me begin
Kerala, to present the topic Deepana and Pajanam,
my
a
presentation.
conceptual
And
analysis.
salutations. Of course, this is a pure conceptual presentation. Deepanam and Pajanam, a conceptual analysis. this Deepanam and Pajanam are two interesting terms in Ayurveda. We use them very often in our lectures as well as in our clinical practice, no doubt at all. But when we come to the theoretical understanding of these terms, many times there are some debates, discussions, misunderstandings. And so I thought I will present a very pure conceptual note on these two sosapnyas or technical terms. And being a very conceptual paper, definitely I request a keen listening of what I'm presenting, because in the conceptual presentation, the problem is once you get distracted from one point, we may not be able to re-enter. So I request that sort of a attention from all the listeners. Whenever we discuss Deepanam and Pajanam, obviously these lines are the most important thing that we quote, we understand. Pajennamam vannikritcha Deepanam tad yadhamisi. Pajatyamam na vannim ja kuryadyat tadhi pajanam naga kesaravad vidyad. Chitro Deepana Pajana. Of course, these three lines are quite beautiful, self-explanatory, and that is sufficient. So actually it is from these lines that I start. For starting this Deepanam and Pajanam, the initial understanding is that both these topics are connected to, or we meet these terms in the premises of Agni. So first of all, I will rush through what is Agni. My presentation is basically to a beginner, a learner, or a first year student, or a seeker. So excuse me for being over down to the earth explanation. Agni.
Prasad, you unmute. You are not audible.
Prasad sir. Prasad sir, please unmute. Prasad sir.
Yes. Am I audible now?
Yes sir. Yes sir. Yes sir.
Okay, I do not know what went wrong. I did not mute me. Anyway.
Okay sir. Carry on sir, please.
Fine. I hope I am audible.
Yes sir. Yes sir. Audible.
Okay. So whenever we talk about Agni, we are talking about the Tikshna Ushna Gunas, or the Agneyada of the Pittam, and the resulting absence of Dravata of the Pittam, and a support from the Samana Vayu. These are the fine principles what we discuss whenever we discuss about Agni. And Agni, Pitta with the status of its Tikshna, Ushna or Agneya component and Dravatva are removed. Capacity of the Samana Vayu to promote Pitta, the strength of Grahani, and involvement of Kledaka Kapha. These are the points where we will start understanding the concept of Deepana Pajana or Pajana Deepana one after the other. Then Agni works on the Ahara. This Ahara needs some sort of preparation. That is why we put Kledaka Kapha in it. Without the Kledana by the Kapha, the dampening or the moistening by the Kapha, as we see in our kitchen, the grains will be fried and then charred along with the utensils when cooked without water, ahara and the ashaya will be scorched. And the importance of grahani is that it is something like a very special utensil. Again, we can make a comparison with the cooking utensils in our kitchen. It forms a barrier between the fire and the grain, but it conducts sufficient heat, and its heat is decisive in the total outcome of the process of cooking. So all these aspects are significant in the case of grahani as well. It holds the ahara properly and promptly in the place to complete the pachana, and it counts. Grahani and Pachakapitta are closely connected. The strength of Agni is directly proportional to the strength of Grahani. So now these four factors we have to consider. Now, see, when we talk about the Agni, we have to understand certain things. It is Agni Bhuta Pradhana in terms of Panchabhuta, with Jala as the supporting principle. It is not Agni alone. It is Agni Pradhana with Jala as the supporting principle. In Pachakapitta, it is this Jala principle which is kept recessive or dormant. Then there are certain possibilities where this Agni can go wrong, can be fatigued. Number one, when the Jala dominates and the balancing mechanism goes wrong, Agni is fatigued. The Tikshna Ushna gunas of the Pitta run deficient, Agni is fatigued. Samanavayu does not give sufficient support, Agni is fatigued. The Kabha part, Kledaka part is dominant, Agni again will be fatigued. So that is the Agni in the Koshta. This Agni is there in the Dhatu as well, because Dhatus are in the mode of continuous Parinamam, and all Parinamam needs Agni. So we have representations of Jadhara Agni in all these premises of Parinamam. They are called Dhatugni. They process the Ahara Sara or Rasa, which is the extract formed from the Jadhara Agni in Koshta, and makes the Dhatus. It should be borne in mind that Dhatu Agni reflects the status of Jadhara Agni. All features that we saw earlier are going to be affected by the status of Dhatu Agni as well, whatever we have seen earlier as the four. So whenever there is incomplete or no Pachana, Amam is formed. This is from where we start. Wherever there is incomplete Pachana or no Pachana happening, Amam is formed. It can be either in Koshta or in Dhatu. So that should be there in our mind when we address the issue. Amam in the Koshta is a dangerous stuff, because it is going to be taken into the system through the Sara and then through the Rasa Dhatu. All the remaining Dhatus formed from this Sa-ama Rasa is going to be morbid. And the first-hand formation of Amam in the Dhatus also is a possibility. And it is going to be quite nasty, quite malicious as far as its effects are concerned. Doshas are associated with Amam, and then they are called Sa-amam, Samam, and they go out of track from their normal nature and behave as dictated by the Amam. Then, if we speak about this Amam in terms of Bhutas, Amam is generally Bhumi, Jala, Agni predominant. Agni is there, but in a morbid form. It is Bhumi, Jala, Agni form. Interestingly, varying the individual degree of these three. So it can be Bhumi, Jala predominant. Amam can be Bhumi, Jala predominant when we call it as associated with Kabha, which is Shida Snigdha. It can be Bhumi, Agni, Kabha Vitta, Ushna Snigdha predominant. Then it can be Jala Agni Pitta Kabha or Bhumi Jala Agni Sannipada. So here the first one is Shida Snigdha, all the rest are Ushna Snigdha in nature. Please understand. And Amam is a result of weak or fatigued Agni, and in any system it forms a deep crisis. It needs to be changed or transformed from its status. Then only we can come out of this crisis. It is a result of a status where the load of the task has exceeded the capacity of Jadharagni, or sometimes the Jadharagni is masked by somebody else. So we cannot expect Agni to help us to come out of this crisis. We cannot expect Agni to help. So the helping component Agni is in the clutches of the Jala. There is no meaning in pushing it further. There is no meaning in pushing the Agni further. Then what we can do? What we can do is modify the task. Modify the task. This is where we go for Pajanam. This is where we go for Pajanam. Then what are the tasks assigned? What are the purpose of doing this job? Number one, focus on the Amam, drain or dry the Jala part from it sometimes, disintegrate the Bhumi part or the Prithvi part, release the Agni part. These three are the tasks. Drain or dry the Jala part, disintegrate the Bhumi part, release the Agni part from the Ama. Any intervention we plan should not hinder with the transformation of the material, of the stuff. That is more important. Bhumi and Jala being against this concept will not help. In terms of Bhutas, Bhumi and Jala are not going to help. So let us see how we can sort it out. These are the 6 rasas. Madhura, Bhumi Jala, Amla, Bhumi Agni, Lavana, Jala Agni, Tikta, Akasha Vayu, Kadu, Vayu Agni, Kashaya, Bhumi Vayu. So practically we have only 2 choices from this list. That is Tikta or Kadu. Other rasas are not going to be beneficial in this situation. So we will see what this Tikta and Kadu elements are going to do here. Tikta is Vayu Akasha, Shida Ruksha, Lakhu, Shoshana. Here Kadu, it is Vayu Agni, Ushna Ruksha, Lakhu, Shoshana. Tikta for Ushna Vidagdha Amam, whereas Kadu is for Shida Snigdha Amam. Tikta dries the stuff by wind and disintegrates it, making ready to move. Whereas Kadu dries the stuff by heat and disintegrates it, making ready to move. So these 2 situations are very, very important. Understanding the rasas by which we understand the dravya, then take out or pick up the 2 Tikta and Kadu and understand them properly. So this is very important. Tiktam has an additional advantage because when there is Shida Snigdha Amam, and in that Shida Snigdha Amam, if the Jala component is dominating, we may not be able to go for, ideally this is a situation where we are supposed to use Kadu. But if the Jala component is dominant, we may not be able to apply the kadu in the first hand, because that may further worsen cause the vilayana of the jala, and then also in that situation also we may start with Shida Shoshanam Tiktam. So even among Tikta and Kadu, Tikta has got an upper hand. This is to be borne in our mind. So Amam is a dangerous stuff. In terms of Bhumi and Jala or Bhutas, we will understand it in this way. Amam is a dangerous stuff where there is stuck or jammed, clogged or immovable Bhumi and Jala. Bhumi and Jala are the basic components of Sharira, of Rasadhadu. But they are stuck, jammed, clogged or immovable, which denies getting processed or transformed by Agni, which is weak, and creating a very deep crisis in the system. If the Agni was strong, this could not have happened. But once Amam sets in, Agni falls prey to it. There are many situations we can quote from the text. Agni is in the custody of Amam. It needs help. It needs time to recuperate. One should not push the Agni further to perform. If done so, it may pass away. It needs time to recuperate. It needs help. One should not push the Agni further, because it may get perished completely. So it is here that we need Pajanam. It is here where we need Pajanam. So that way, Pajanam is that intervention, need not be a drug. Let me repeat, it need not be a drug, any intervention which works on Amam, modifies it without pushing or stretching Agni to perform in spite of its fatigue. Without pushing or stretching Agni to perform in spite of its fatigue. That is more important. So the way in which the Amam is to be modified, that we can decide, that the Vaidya can decide. We have gone through multiple options earlier. From the Buddha perspective, Vayu and Akasha are the most important participants here, appropriately assisted by Agni. Vayu and Akasha, appropriately assisted by Agni, are going to be the useful principles here. Once, this is like the Pajanam or Pajanam, what we are trying to bring about. Once Amam is modified, we can focus about the next thing. Pajanam is achieved. Now the doshas are niramam. Now the focus can be switched to Agni. And then there can be specific approaches based on the specific samprapti. This is what we call as Deepanam. Amam is modified and doshas are niramam. Now we can enhance the Agni. So we should know what all factors could be there to make the Agni weak, which we have gone through once earlier. But more specifically, it can be Pitta focused when the Tikshna Ushna gunas of the Pitta has gone down. Pitta Tikshna Ushna Kshaya. It can be Kabha focused when there is Sneha Kshaya or Sneha Vruddhi. And the plane of Sneha, Sneha Kshaya, will make the Agni enlightened unnecessarily. But here it is over masking by Sneha. Then Vada Pradilomya. It can be Vada Pradilomya. So it can be Pitta focused, Kabha focused or Vada focused. Sometimes more than one of these factors may work together. And we will have to intervene accordingly. This Sneha Kshaya is a wrong message here. It is not Sneha Kshaya. It is Sneha Avarana. It is Sneha Avarana. So it can be Pitta focused, Kabha focused or Vada focused. Accordingly, we have to understand. And again, the Deepana need not be based on a Dravya. It need not be a Dravya. It can be any intervention. In terms of Gunas, it shall be Snigdha, it shall be Ushna, it shall be Chala, which promotes movement, which shall be Anulomana, and which shall be gradually increasing in terms of Gurutva. Gradually, Uttarottara Gurubhihi, increasing in Gurutva. So this is an ideal situation. This is an ideal situation. So here, you need not use any Dravya. It can be Vihara. This is where the Viharas like Snana, Vyayama, etc. become significant. That is always a point of debate. Why don't you use Snana, which is Deepana in Jara, where Agni is trapped? Why don't you try to ignite the Agni with Snana? That sort of discussions are common. So, in terms of Bhutas, all Bhutas can be properly administered in Deepanam, but in a Uttarottara Guru order, Laghu to Guru order. And the role of Viharas should not be underestimated. So we have gone through Deepanam and Pajanam. After the Deepanam, if required, Shamanam can be done, Rasayanam can be done, and whatever is to be followed up can be continued with. But this is not that easy. There are many things in this total note what I gave, especially in the focus of Pajanam. Many Vikalpas are to be considered. The Amam may be with an Ulklishta dosha, sometimes with maybe Leena dosha, maybe in different Roga Margas, which may be not Alpha but Alpa, which may be Madhya or Prabhuda in its Matra. Sometimes Sa-ama dosha, which may be Swayam Pravritta. All these things are beautifully explained in the Doshovakramaniyam chapter. And every situations can be seen in Jara Chikilsa or Shobha Chikilsa maybe. So all these things cannot be included in this short presentation, but my sole intention was to decipher the terms for better student understanding, just dissecting these terms. Now, I shall try to give one example. See this situation. A steep road in which a man is pulling a cart with a load. And on the mid of the climb, the puller is stuck. He is down with weakness that he could not move even a single step forward. This is a crisis. He can neither quit nor climb. In this situation, this is the situation what we address clinically in whatever things we were explaining. The cart puller here is the Agni and the load is the Ama. Person is no more able to move. He is down, fatigued. In this situation, what will happen if you compel this man to pull again and again with more strength? He may collapse. It is not logical. So there are two options. Option one, you can unload the cart either fully or partially. Give the man some time to rest. Give him a glass of water, fine. Now let him pull the unladen cart through the climb somewhat easily. He may do it comfortably. He may do it comfortably. We may reload the stuff back in one or multiple terms afterwards, once we have completed the climb. This is option number one. Option two, you may give some good time, kalam, to rest to the puller. Then you yourself support him by pushing the load from the back of the cart. You also join. This may ease the load of the puller, and if he has some strength, it may work. So in both cases, what we were doing is Pajanam. In both cases, we were doing Pajanam. The focus obviously was on the puller, the Agni, but the intervention was on the load, the Amam, not on the Agni. Load is to be modified. We modify the situation to make the task easier, effective, and successful. So what we did here is pajanam. It is not about stimulating the puller. It is not about stimulating the puller. He will die. So, but this may be a different situation may be there, which is called deepanam. It is about when the cart is on an even road, load is not overwhelming, but slowly, because multiple reasons. The puller may be a little bit lazy, there may be something else. Then in that situation, you may motivate the puller, offering him a sweet or a drink, fine. Then the target may be reached on time or even earlier. For a very lazy puller on an even road with a minimal load, you may even scold a lazy puller who delays the load for his laziness. That may make him active. This is what we are doing with the Deepanam. So there may be many examples. In the selection of Pajanam, as we saw earlier, Ushna Shoshanam and the Shida Shoshanam are possible. Another example could be drying a wet cloth in sunshine or in the wind. Sometimes you may be forced to dry it in heat, sometimes in wind. Both are effective, but depends on the situation. Sometimes you may be lucky enough to use both sunshine as well as wind. So there can be many situations. If you go through all the contexts where these terms are used, there is specificity. These are few examples. Sarvadeha pravisrudan saman doshanna nirhade linan dhadush anuklishtan bhaladama drasaniva. Then in such doshas, pajanaihi, deepanaihi, snehaistan, swedaischa parishkrudan shodhaye. This is one example. Ulklishtan adha urdham va nacha aman vahadaswayam dhareda ushadhaihi. Then pravrittan pragado doshan upeksheda. You are giving kalam. Then vibadhan pajanaihi taihi pajayed. Then do nirharanam. In Jara Chikitsa, we find many beautiful situations. Langhanam, Svedanam, Kalo, Yavagvastiktagorasaha. So all these things are Pajana procedures. Langhanam, Svedanam, Kalo, Yavagvastik. Doshena bhasmaneva agnau channe annam na vipachyate. Tasmad adosha pajanad jvitidan upavasayet. Upavasam is a ruksha pajanam as well as kala pajanam. It's a ruksha pajanam as well as kala pajanam. Langhanam swedanam kalo yavagvastiktagorasaha. Malanam pajanani syuhu yadhavastham kramenava. Visramam is kala pajanam. Nidra is kala pajanam. Swedanam is ushna pajanam. From medicine's side, pajanamridam, shadangam, tikta pajanam, chundi, kadu pajanam, amrudottaram, pajanam as well as deepanam. So with this concept, that means bhumi and jala struck unprocessed by Agni denies transformation, forming a crisis. Then we intervene on the stuff, not on the Agni, that is Pajana. Once the transformation is successful, we focus on the Agni to enlighten, to ignite, to enhance its functional status. That is Deepan. With this, most probably the Shamanam will be complete. Otherwise, in the next stage, you go for Shamanam. So this is what I've tried is to give a crisp idea about the mechanism behind the words called Pajanam and Deepanam. I do not know how far I was successful. Anyway, I hope at least a few people will be thinking further on it whenever they go through the different Chikitsa status we see. The take-home could be, message could be, Pajanam and Deepanam are not same and not interchangeable words. Both are Agni-based, but the focus will be different. understand the situation properly and select the best option. Upakrama is to be done, not don't rush to chikitsa. Upakrama is a planned, serialized intervention. Whereas chikitsa is just to get into the procedure all of a sudden. They are very similar words. Don't misunderstand that chikitsa is a bad thing or upakrama is superior thing. But what I mean is in upakrama, there is a planning. So that is the most important thing. So with this, I complete my short presentation. I do not know whether I took extra time. If so, sorry for that.
No problem, sir. Thank you very much, sir. Your session was really excellent, and as you in introduction itself, you told that it is for beginners, not only for beginners, for everyone. It is really a guiding principle, sir, because it has a very great role. We know what is Deepana, Pachana, and all of a sudden we could not put load onto the Agni, and what are the consequences that may lead to due to such a misunderstanding. Really, it is a very guiding principle for all of us.
Thank you very much.
Beginners as well as all of us, sir. And you accepted our invitation and came here and presented a very beautiful presentation, sir. On behalf of everyone, we thank you, sir. Thank you very much.
Thank you very much.
Thank you, sir. You have well explained the exact idea about Devana and Pajana apart from digestants and carbonators through classics as well as in a conceptual way. Thank you, sir. To deliver the next talk, we invite Dr. Ashokan, Professor and HOD, Department of Prasuti Tantra and Sri Roga at PIA, Faculty of Ayurveda, Parole University, Vadodara, with the topic Interdisciplinary Approach of Vedanga, Jyotisha and Ayurveda for Public Health. Welcome, sir.
Yeah, I want to add one sentence to it. He is actually living person who practices Jyotisha with Ayurveda. That's why I invited him and he wholeheartedly accepted our invitation. We welcome you, sir. Ashokan, sir. Please go ahead, sir. Ashok, sir, please unmute. Yes.
Namaste to one and all. It's being great pleasure to be a part of this knowledge conclave, and it is indeed a depthful platform for me from Principal Sir, Nagbhushanam Sir, and all other co-organizers of the event and all the participants. I welcome you all to this conference. Indeed, yoga and Ayurveda are integral part, and we can see the integration of yoga and Ayurveda to the Sharirasthana first and second chapter itself, wherein Charaka has elaborately explained what is Yogo Moksha Pravartaka has been quoted by Ayurveda, and it is nothing other than Ashtanga Yoga. But Ayurveda has not elaborated other than that the concept of yoga in the Sanhita Granthas. But the rishis were having in-depth knowledge about the understanding of padarthas, and they have used the yoga vritti and the yoga jnana for upliftment of human being. So it is indeed a good platform for me to speak a few words over the years, which I have learned from my teachers as well as Guruji, who taught me in early my BAMS days. I was interested to learn Jyotisha, and I went to him. Only on Sundays the classes used to be, and we had a very good interaction. And though the interaction period was of very less period of around 3 to 6 hours per day for a week, but we had enough knowledge, and initially itself he has introduced me to Prashna Marga and all. So the ephemeris method and the Sayana Nirayana calculation. So these were very elaborately, fundamentals were quoted or put by my Guruji. And later on, I met many teachers who imparted their knowledge to me in the field of Jyotisha. And Ayurveda and Jyotisha are equally very vast to be learned in a lifespan of a human being of around 100-120 years. So keeping this thing in mind, we need to focusedly study daily by Swadhyaya and Satatadhyayana. If we can do, then we can achieve some Ganga Jala Lava Kanika Pita, just like Acharya Shankara has, Adi Shankaracharya has quoted, Ganga Jala Lava Kanika Pita. So that much only we can achieve. With this background, I would like to appropriate the gods like the Dakshina Murti Swarupa, who is a path cleanser, as well as he is a path shower to all of us in the Jnana Marga, as well as he is Vidya Pradayaka, as well as he is providing all the Vishaje, Gurave. So he is so the prostration to him, the Ayurveda. I am proceeding with my presentation. Is the screen visible?
No, sir. No, sir.
Yeah.
No.
Mine now?
Sir, you open the PPT. Later, you click onto the present
You
now,
click present now.
Okay.
and you can minimize this Google. Yes, now it is.
Yeah. Now hope it is visible.
Yes.
Is it visible now?
Yes, sir.
Yes,
Sir.
sir. It is visible.
Okay. Yeah. So the topic which I chose for this was as my well-wisher and my friend Nagushnam sir has initiated me to speak on Jyotisha and Ayurveda. So I thought of the benefit of Jyotisha and Ayurveda both to the public health, how we can interdisciplinarily do a approach to it. So thinking this thing in mind, the first thing, the Shabda Brahma, because Ayurveda, Jyotisha and Mantra Vibhaga are triangular form or Triguna or triangular mode of action of these in eradicating the Dushkarma and imparting Karma Phala to the human beings is very significant. So keeping these things in mind, I put the Nataraja Murti with the Shabda Brahma, how it evolved from the Nataraja Dhakka. So, I una rk e wong I ouch hayavarat lana nyamangana nama jabanya gadadasha jabagadadasha khapa chatata chatatav kapaya shashasar hala. So just by reciting this itself, the rogas will get subsided if they are of karmaja origin. So coming to the next part, that is, I have quoted the abstract here. Going to the next part of it, the main focus of this abstract is Jyotir Vaidyo Nirantaram. So Jyotir Vaidyo Nirantaram means it takes its own time and it yields results over a period of time. So we need to be, because we learn Ayurveda for 5 years, then go with post-graduation, then doctoral degrees, etc. At the same time, it yields a time. 10 years, 20 years are required. Minimum 8 years are required to learn Jyotisha. Then the contents of this presentation are like this. In this, I would like to go through the concepts of Ayurveda versus Jyotisha that is common, that is Sarvatantra Siddhantas. They include Panchamahabhutas, we know as we are Ayurvedic doctors, Tridosha Siddhanta, Kapta Dhatu, Rasa Pradhanyata, the role of money, that is gemstones, and that of plants. These are commonly found in both the Samhitas or the Brihat Samhita also. Then the Garbhadana Vidhi, Pumsavana, timing of Samskara are mentioned only in Ayurveda. Then collection of raw drugs, their processing period is told in Ayurveda, but how to cultivate and which stellar constellation the cultivation should be commenced and what is the procedure of cultivation is being elaborated in Vriksha Ayurveda as well as in the Jyotir Granthas. Then Santhya Sadhyata Lakshana of Vyadhi is being elaborated in Ayurveda basing on, like we can find that Graheshu Anuguneshu Ekadosha Margaha Namaha Sukhaha Ashtanga Hridaya Nidanasthana Sarvaroga Nidhana, wherein he is mentioning that Sadhya Sadhya Lakshana depends on Graheshu Anuguneshu. So Grahanukulyata is essential or a prerequisite for which disorder? Is it doshaja, karmaja, dosha karmaja? So karmaja vikara as well as dosha karmaja vikara upashamana, we need the use of a graha anukulya, so or graha bala. And we in Jyotish Shastra it is said that the vyadhi purva karma kritam papam vyadhi rupena jayate. Purva karma krita papatva. Papa is parapedanam told by Vedavyasa. So whatever the dushkrita has been done towards other fellow by kaika, vachika or manasika, because even by thinking that he should be beaten, so that is a papa karma. Or thinking wrong about others is manasika papa karma. So kaika, vachika, manasika will be registered in the karma book kept with the relevant persons who is recording all our karma, that is karma sakshi. Then the administration of the drugs. Coming to the next point is administration. And one more thing I would like to say in Sadhya Sadhya Vibhaga is that the karmaja yanti takshayat. Karmaja vyadhi will be eradicated only by the kshaya of the karma dosha. The karma, the kukarma nimitta, that should be borne by the person, and God cannot alleviate it. Though it is said that Suryendu Bhauma Buddha Vakpati Kavya Sauri Tadasa Dasa Charamavadi Dasa Dasa. They are told to be the Dasa of Venkateshwara or Lord Vishnu. Navagrahas are in play with him. They are signal post. They are in play with him. But it is not that karma, gahana, karmano, gati is told by Gita. Gita says that gahana, karmano, gati. So you should know what should be done, what should not be done, how the karma should be done. So, and he is saying the pada that gahana, karmano, gatihi. Then administration of the drug for panchakarma shodhana, maitre, karane, muhurte, swasti vachite. So this is told in Ayurveda granthas. Then netra chikitsa prakarana, visha chikitsa prakarana, duta lakshana prakarana all have contribution, because andha nakshatras are told. And there are nakshatras which are shunya in nature. So there, if the treatment is begun, or in the visha ghati and amrita ghati of nakshatras are told in Jyotishya, if a Vaidya knows the ghati Veda of the nakshatra, then he will not commence the treatment in particular time of the nakshatra pada, because of which the patient may suffer additionally. So the amrita gati is suitable for treatment, visha gati is to be avoided. So visha chikitsa prakarana is said that Kerala is the house of abode of people who were well versed in the Agada Tantra Vijnana, and there were familial tendencies of treatment of visha, and they used to forecast this day this particular fellow will come from this direction with this type of snake bite. So this was their excellence in Ayurvijnana and Jyotisha Vijnana, because a Jyotirvija is also called as Daivajna. It is not a particular caste or group of people. It is Daivajna, the one who knows the Daiva. So the Daivajna, getting up in the morning, he should do all those things by looking at the Panchanga as well as doing the Mahurtika Ajnaya. So we are being told that Mahurtika Ajnaya, we have to maintain the Ajna or the permission from the Mahurtika or the Muhurta Jnana Yukta person. So Duta Lakshana also says about many things about the interdisciplinary approach of Ayurveda as well as Jyotishya in understanding the Sadhya Sadhyatva as well as Arishta Lakshanas. Then Karmaja Vyadhi I have spoken already. Dosha Karmaja Vyadhi as a Papma, the term Daiva is used to indicate the Papma of the previous life, and the Adrishta Hetutve Sati Hetutvam. What is Daiva according to Ayurveda is Adrishta Hetutve Sati Hetutvam. That means whenever the Hetu or the causative factor of a disease cannot be elicited in any way, for example in infertility, male factor, female factor, some other factors, combined factors, then unknown factors. So those unknown factors may be because of karma vikara. So Daiva Vyapashri Chikitsa, Daivam Vyapashritya. So that mode of treatment is exclusive contribution of Ayurveda. So this depends on this Daiva Vyapashri Chikitsa depends on the understanding of Jyotisha Vijnana to select the mani, mantra, aushada, homa, niyama, prayashitta, upavasa, swasthayana, pranipata, gamana. Where he should go. Gamana means tirtha yatra. Which temple he should visit. What he should do the bhajana. What manidharana should be done by him. And what is the Rashmi Bala of each particular Dharita Mani. That is Manikya Mukta Phala Vidrumani. So that is the Navagraha Manis or the gemstones particular to that of 9 planets. Then coming to the Panchamahabhuta Siddhanta, how we can interpret in Ayurveda and Jyotishya is that Rashi, there are 12 Rashis, Meshadi. Rashis are there 12, and Ayurveda says that these 12 Rashis have got, the Jyotirvidya says that it is having Panchabhautikatva in Sarva Jagat. So similarly, Grahas are attributed. It is not that Graha is having Agneya Guna, doesn't means that they are Agni and they are Gola like Agni, they are shining like fire. No, it is not like that. It is Parthiva, means it is full of Prithvi Mahabhuta, then Vayavya, it is filled with the gas. It is not like that. It is the attribution of the quality which represents in our macrocosm, in our body, what these planets depict. For example, the Asti Mahabhuta is dominated by, or the Asti Dhatu is dominated by the Parthivamsha along with some other the Dhatus or Mahabhutas, wherein the Aditya is the dominating planet. So there will be interrelation between the Surya and the Asti Dhatu. At the same time, the Mahabhuta dominance says that he is Agneya. So the Mesha, the Rashis are attributed with Mesha is attributed with Agneya, then Vrishabha is attributed with Parthiva. So this table, if we are able to understand and correlate the composition of Vata, Pitta and Kapha with the Mahabhutas, we will be able to easily correlate between the two concepts of Pancha Mahabhuta Siddhanta in two different knowledge science. Then the role of Jyotisha in Samskaras. So additional contribution of our approach is that for deciding the Muhurta of Putreshti Yajna, which is told in Ayurveda, we need Muhurtikajna. Then Garbhadana and Muhurta for Pumsavana, that is told as Pushye Purushakam Haimam Rajatam Vayasam. So the Pushya Nakshatra is selected. It is quoted as Pushya Nakshatra, doesn't mean that we need to do it only in the Pushya Nakshatra. Pushya Nakshatra is said to be the Shrestha. Then in addition to that, Puyam. So in Malayalam we call it as Puyam. So in addition to that, Taipuyam is also coming, isn't it? Taipuyam is the Puyam Nakshatra which is coming in the Makara Masa, that is in the around in the January second half. So that is very festive season in Tamil Nadu. Then, so the Pumsavana is said to be one of the period which requires the help from the time decision can be made, nakshatra selection can be made basing on the Jyotir Vijnana. Then Simanta Unnayana, Varana Bhanda, then Muhurta for Sutikagara Pravesha. So Brahmana go and the Sutika along with the woman, and it is a place of isolation. So Ayurveda has advocated isolation in those periods itself, not only in pandemic or epidemic period. So, and that area is well equipped. You see, Sutikagara Pravesha and residing there is a well equipped place till the Sutika Kala Nirnaya is told 1.5 months, 45 days. She has to reside there. Then Jatakarma Samskara and Namakarana, selection of name according to the star. Star has got Cha, Chu, Cholo is Ashwini. So like that there is a sequence of naming the Namakshara for Nakshatra Pada, and we know that 27 Nakshatra with the 28th one as the Abhijit, they have 4 Padas each Nakshatra, total 27 into 4 is 108, 9 planets and 12 Rashis, multiplication leads to combination of permutation and combination of 108. That is the reason why we chant every mantra to a minimum limit of 108 times. So to reach each Nakshatra Pada and to eradicate the ill effect of each Nakshatra Pada to our Nakshatra as well as to our Sharira. Then Karna Vedana, Surya Darshana Samskara, Chandra Darshana Samskara also play a vital role. Then concept of disease in Ayurveda is known to us. So I will say that it is Sharirika, Manasika, Doshaja, Karmaja and Dosha Karmaja, and Adhishtana Vedena, Sharira and Manas, and Vyadhi Hetu, Adidaivika, Adibhotika and Adhyatmika. Coming to the other Hetus like Drishta Paradhaja, Purva Paradhaja, and Nija and Agantuja Bheja. Purva Paradhaja is maybe of this life or of the past life. Then Prajna Parada, Parinama and Asatmiyandriyartha Sanyoga are also said to be the Vyadhi Hetu in Ayurveda, whereas the concept of disease, how it is originating, the basic concept was Papa Karma of the previous life. In addition to that, how to know that is 6th Bhava, 8th Bhava and 12th Bhava. What do you mean by Bhava then? There will be a question. So Bhava means there is a Rashi Chakra and the Bhava Chakra in your horoscope. Hope many of us have our computerized horoscope or handwritten horoscope on the Taliola with us at home. So if you go through, there will be a Bhava Chakra. So Bhava Chakra means from the Lagna Udita Bhaga, at the time of birth of a person, how far the Amsha, that is the degree and minute it has moved, and from there the first Bhava will go to the next Rashi to that particular thing. For example, you will say 30 degree is the span of one Rashi in Bhuchakra, Bhachakra. Bhachakra is Akasha Chakra. So we are sitting on the earth and we are looking at the sky. So it goes like this. So if you open up the Bhachakra, we will get a S-shaped, stretched S-shaped Bhachakra to us, wherein adjacent, why only sir 27 stars? There are millions of stars. Why don't you consider that? No, we are not concerned about those stars. Yes, our stars are related to our Bhachakra. So the elliptical orbit of Earth, wherein we come across some of the stellar constellations with the group of nakshatra. For example, Shatatara or Shatabisha is Chatayam in Malayalam. So Shatatara is a group of nakshatra having Shata Nakshatra Samuha. And it is also called as a person who is born in that star will be Shatagni. He can oppose 100 persons at a time. So a good warrior or a good administrator should be born in that star, Shatabisha Nakshatra, so that he can carry out his professional aspect very excellently. So 6th Bhava, 8th Bhava and the 12th Bhava depict the diseases, and the 6th Lord, 8th Lord. What do you mean by Lord? Who is a king? No. It is the Rashis are attributed with some of the lords. For example, the Mesha Rashi is attributed with the Kuja or Kuhu Jataha, that is Bhumi Sutta, that is the Mangala Graha. Similarly, that of the Vrishchika Rashi. So each Rashi is given one Swamya, or this is your house, take away your house and be there. So don't go to others' house and create problems, isn't it? So whenever planets travel in others' house, there may be Mitra planets and Shatru planets. There is actually no Shatru and Mitratva among them. It is for our understanding. We are doing the Aropana of Guna and Dosha on them to understand our physical and mental well-being, right? So when we understand it in that concept, we can understand that there is no Shatru and Mitra. Surya and Shani are Shatru. So they will fight with each other. So that is not the concept. So 6th Lord, 8th Lord and 12th Lord, they are the Lord of their houses. And placement of the 6th house Lord in the horoscope, aspects on the 6th house, strength of the Graha or the Lord of the 6th house, Vimshottari Dasha, that we have Vimshottari Dasha, which travels with everyone's birth time. So, and it's Antar Dasha of 6th, 8th and 12th Lord. Karma is the cause of diseases. 8th house and 12th house, Marakasthana of 2nd and 7th house. So these are some of the points which we need to know, and Ashtakavarga Jnana will help us to know about the time of onset of disease. You are going to get this particular chronic disease in future. So this prediction is basing on Ashtakavarga Jnana and the Bala of the Grahas in those particular Rashis. So how will you correlate ourselves to the Kala Purusha? How can we know that which part of our body is going to be afflicted? Because we have a Jnana that Murdhasya Galaskanda, like that the shloka goes, wherein Varahamihira is saying that head is dominated by the Mesha Rashi, depicted by Mesha Rashi. Then brain, head, face and eyes are components of it. Likewise, the feet, if you see, the feet portion comes to the Meena Rashi, the 12th Rashi, the behind Rashi to it is feet, 12th Rashi. So I have put the number of the Rashi as well as face, second, throat, neck, vocal tract, thyroid gland. Where does the heart come? It comes in the Karkataka Rashi. And stomach and abnormal acidic secretions comes in Kanya Rashi. And generative organs or reproductive organs comes in the Tula Rashi, as well as the upper thigh and the reproductive and sexual organs comes under the Vrishchika Rashi. So the position of abnormal planets in these places at the time of birth and in relation to the Lagna and Chandra Lagna from the horoscope can predict the onset of diseases temporarily or chronic nature. Then Dwadasha Rashi Bhava in relation to the Ayurveda, it says that Tanu Bhava is physical of origin. So if anything is to be afflicted, our Lagna or Tanu Bhava need to be afflicted. Then speech to be afflicted, a person having speech defect, we have to see the second house of the horoscope, as well as the Vakpati. Vakpati is a Buddha as well as the Guru. So Guru as well as the Buddha, both are to be observed in order to know about the speech defects. Then activities, hyperactivity, less activity. Then happiness of the mind, mother, etc. to be seen from the 4th house. Then 5th house is education and the further progeny, further children to be born to the person. Then 6th is the Rogasthana. How to analyze the Rogasthana is the 6th house of the person. Then 7th house is the spouse, or the, if for male it is female and for the female it is male. And then the Ayushya Sthana is the 8th house. First and foremost aim of Ayurveda is longevity in life. So once the horoscope is in the hand of a Vaidya or a Jyotishya, he should first of all see what is the longevity of this person. If he is having longevity, then all the other things can be seen. Then luck, that is the 9th bhava. 10th is the karma, that is the good karma or bad karma. And 11th is the benefit or lavasthana, and 12th is the hospital stay. So if the person is destined to have hospital stay, the Dusgraha, Durgraha or Krura Grahas will be positioned in the 12th house. So this chart depicts almost everything which is needed for integrated approach conceptually. For example, dosha, dhatu, ratna, dhanya, panchamahabhuta, sukshma sharira. So adhare pratamam sahasra kiranam. So first adhara chakra is Surya, then swadhisthana chakra is Chandra, then Manipura chakra is Mangala. That is sukshma sharira is also attributed to the Navagraha, and the imbalance in the Sukshma Sharira which can be maintained through the Yoga Patha is also attributable to the Navagraha. That is a Nadi Marmasthana is attributed to the Rahu and Ketu, and Shani is positioned in the Sahasradala. So this is the importance, because he is a Vairagya Karaka. He is a Karma Karaka and he is the Vairagya Karaka. So this is two important attributes of Shani, whom we call as Shani. He is to be called as Shanescharaha, the one who moves slowly. Shanehi, the one who moves slowly in the orbit. So this is the concept of Ayurveda as well as that of the Jyotishya. Then we have Dhanyas, Godhuma, Shilaye, Shali, Godhuma, we say. Godhuma and Shali are Chandra and Surya, right? So Mudga, Budga. So they are Saumya Grahas or Shubha Grahas, Naisargika Shubha, and Tatkalika Ashubha. So that may be there. So, and Masha and Kulatha are said to be of Rahu and Ketu. Tila is attributed as the Dhanya for Shani, and Shweta Rajama, that is the type of Dhanya, is attributed to the Shukra. So Chanaka is attributed to the Guru. So these Navagraha Dhanyas are of significance in maintenance of the health. For example, how it is? For example, we know Guru is a Medasvi. So Medo Dhatu, you can see in the chart that Guru is having dominance of Medo Dhatu. So the one which acts on the Medurata or the Medo Dhatu is Snehamsha. So Ghrita is the Agriya for Medo Dhatu. So the Gritapana or use of drugs in the form of Grita is indicated in Guru Graha Janita Dosha Vikara Shamana. So similarly, Mantraputa, that Grita should be Mantraputa, either the relevant mantras, which is selected according to the upasana sthana of that particular horoscope. We can select the upasana murti, and that mantra should be meditated on that particular grita, and that grita should be given to the patient for avoiding the related problems of Guru Graha Janita Vikara. Similarly, that of Shukra and Shukra Vikara, then Keshadi or Maladi Vikara of Shani, see, we can use. And Rahu Ketu is known for black magic, or the Rahu Ketu is not known for black magic, they don't do. We assume that whenever there is an effect of Abhishapa, Abhichara, Abhishanga Divikara, Abhichara Divikara, we come across such condition, we give Churnadi Prayoga, which is indicated for those grahas. Then coming to the next, plants, we know. Plants are very important for us in Dravya Guna Vijnana as well as for Chikitsa. So, Arka, Palasha, Khadira, Apamarga, Ashwatha, Udumbara, Shami, Durva and Kusha, these are the plants which are important for the Navagrahas, and the Samit or the Kashta of these plants or the trees are used for the purpose of the Havana, that is offering in the fire along with the ghee for specifying the particular dushti of or the ill effects of those plants, those planets. And the fumes of these are said to be healthy in nature. When inhaled, can prevent viral load in the environment. And they are also attributed with the Triguna, which has got Manoroga Chikitsa Adhikara Upayoga. Then so in total, Kala Nirnayata, Dravya Grahana, Sadhya Sadhyatva, Chikitsa Upakrama, and Karma Vipaka Nirnaya. So we use Jyotisha in Ayurveda. So in treatment as well, for example, in Amavata, why I put there is Ayuta Sankhyato Gayatri Japaha. Ayuta Sankhya is 1 laksha. So 1 lakh Gayatri Japa to be achieved in 108 days or 3-month period was the Parihara which is given in Karma Vipaka Vibhaga as well as in the Veerasimhavaloka for the curation of Amavata. So this was found beneficial when I told simply to a knowledgeable person, that person tried it on a person and he told me that it is found true. So where did you get this cross reference? So this was, as a child, I told him that this is told so. Then he tried it and told it is true. Where did you get this? And he was a person who knew how to do it. At that time, I was a student. I didn't know how to do it. He taught me how to do it. Then astrology in Masanamasika Garbha Vriddhi, we have this concept in Jyotisha wherein first month, second month, third month, fourth month, month-wise development of the Garbha and the Pradhana Graha which influences the growth and development of the fetus in the intrauterine life. So this is a preventive health care through Jyotirvidya and Ayurveda. So it is a preventive health care wherein the congenital anomalies or abnormalities to the fetus, injury to the fetus, or birth defects in the fetus can be avoided to some extent by knowing about the Garbhadana Vidhi as well as the planetary predominance in each month. What is the interrelation between the festivals and Jyotisha and Ayurveda? For example, how will you decide the timing is based on Jyotisha. For example, Vishuvat Kala Nirnaya. So what is Vishuvat? We call it as Vishu in Kerala, right? April 14th, now it falls on April 14th or 15th. Earlier days it was in March, millions of years, or the centuries back it was in March. Now later on it will go to May also. So Vishuvat Kala Nirnaya, we use Nimbakadala Bhakshanam. So Nimbakadala Bhakshana along with Sharkara is Krimigna, it is Madhura, Tikta and Rakshogna in nature. So that is an interrelation between Ayurveda and Jyotisha. Then Makara Sankranti Vishuvat, Tila Guda Bhojana, which purifies the blood, Vatashamaka and Rasayana for that particular Sankramaka period. That is the movement of the sun. Karkataka Amavasya, we give Pitratarpana. Along with that, use of Saptaparna, bark juice, which is said to be Krimigna, Vishagna, Tvagrogahara and immunological aspects. Then Uttarayana and Dakshinayana Punyakala is told. Wherever the word Punyakala is used, it is not Punyakala. It is a sacred period where we have to take more care. So Rutukala Sandhi, Rutu Sandhi, Rutucharya, Dehabala assessment is told in Ayurveda. Abhyanga Snana and Deepavali is told in November, and Yama Dvitiya, lighting lamps, is also told. Abhyanga is a Vatahara, Jarahara, Shramahara, etc. And in that particular season, it is indicated in a year. So Ayurveda told to be done every day. Then food preparations in festivals and their seasonal importance and Rasadosha relation should be analyzed. Then Veerasimhavaloka is a grantha written by Veerasimha, wherein he is mentioning about various disorders which are pertaining to various systems of our body, just like Ayurveda grantha, and he has incorporated the Jyotir Vidya Chikitsa or the Parihara Krama through the Mantra Vibhaga, as well as the causative factors from the grahas which are responsible for the manifestation of those particular disorders. So but the explanation in the first column I have enumerated Pradaradi Vikara of gynecological origin, then the various even up to Rasayana Vijnana, Shandatva, Snehadikaras, Vedadikara, Vamana Virechana Adhikaras, and Mishraka Adhikara is also being told in the Grantha. So Veerasimhavaloka has exclusively and explicitly elaborated the concept of Jyotishya as well as Ayurveda, wherein he is mentioning that Vrishchika Shukra Graha produces Yoni Dosha, Vivaha Ashtamasthana Sthita Bhuma Graha produces Pradara Roga, widow woman breaking the Brahmacharya leads to Yoni Dosha, Falagrata Prayoga in Graha Roga Chikitsa, Masa Vichara and Masanumasika Garbha Parivruddhi, Stanya theft of milk in the previous life is the cause, Muda Garbha, abnormal position of Shani and Chandra in the Lagna in the Garbhadana Kala is the cause. Then for the time of delivery and for the nature of delivery, is it cephalic presentation or podalic presentation, they used the Grahagati and they said that Shirshodaya Rashi. For example, Nara Rashi, that is the Tula Rashi, then the Kumbha Rashi. So these are Nara Rashis. So whenever there is a Nara Rashi Udaya, how a human being will be facing through head. So it will be Shirshodaya, the child will be born by head. So that is Shirshodaya Rashi. Whereas there are Prishtodaya Rashi, like Simha Rashi, it is a Prishtodaya Rashi. So animal origin, Vrishabha Rashi, it is a Prishtodaya Rashi. So Vrishchika Rashi, it is a Prishtodaya Rashi. So whenever there is a Prishtodaya Rashi, the child will be born with a podalic or breech presentation. There are Ubayodaya Rashi, only one Ubayodaya Rashi is told, that is Meena Rashi, so that will lead to compound presentation. Obstetrician will be in trouble if there is Ubayodaya Rashi. Then, Vivaha Kala, if 7th house is occupied by Buddha, then it is said to be cause the Vandhyatva. Then, similarly, combinations are being given, which is cause for Kakavandhya, Anapatya, Garbhavi, etc. Then, Drekana and Sharira Angavayava. Can I take time?
Ashok sir, we are running out of time. Other
Sure. So, Drekana is also one of the thing. Then Bhava Sharira Jnana is one of the thing. Then cause of health. I will wind up in 2 minutes.
Okay, sir. Okay, sir.
Okay, thank you. So, Lagnadipati Bala, Shubha and Balayukta Chandra, good position of Atmakaraka Graha, Purvakrita Sukarma, Aditya Namaskara. So, use of doing Namaskara to the Surya is said to be beneficial for each and everyone early in the morning or in the late evening. 12 steps 12 times or 6 times at least in a day is beneficial for Arogyam Bhaskaradichet. So, this is one of the clinical studies which we will discuss later sometime. So, case studies, then discussion and conclusion. Vaidya should be trained in Panchanga Jnana, predictive medical astrology, analysis of 6th, 12th and 8th house, and integration of fundamentals of Ayurveda and astrology. Prevailing healthcare system can be improved. Then cultivation of medicinal plants, reproduction and family healthcare programs, psychotherapy, recitation of particular mantra in therapies of Ayurveda show its role in psychotherapy as told by Kiratamurthy sir yesterday. He has elaborated it. Then Daivapashra Chikitsa augments the process of medical care both at physical and psychospiritual level. So we have the scope of predictive, prognostic and therapeutic strata for the benefit of human kinds. So not only humans, but all the living and non-living creatures of this planet. Thank you. Dhanyosmi.
Thank you, sir. Thank you very much. And really, we need actually adhikaris to study Ayurveda, but we are entering into Ayurveda just by having entrance examinations, where we are lacking neither Veda knowledge nor the Vedanga knowledge. Okay, sir. Thank you. It is really enlightening. It is a deep subject which needs years of penance to understand it. Thank you very much.
So, Dr. Ashwin, do you think that the Ayurveda doctors should learn astrology so that they can scale up the effectiveness of treatment system? Do you think so?
Ayurveda doctors should first of all videya paramadaraha to Ayurveda. Once they have adhigata tantrartaha, they can learn other sciences also. Adhigata tantrartaha, they should learn Ayurveda first to its point. They should dedicatedly learn Ayurveda. They should go to the patients. They should see the patients, do the service, and learn from the experience of the teachers, understand Ayurveda as Ayurveda. Then Adhigata Tantra Jnanaha, additionally they can learn Jyotirshya basics, fundamentals of Jyotirshya, and they can use it for medical practice. And they should not make the person panic, saying that your Shani is in 12th, your Shani is in 8th. Don't panic. This knowledge is not for making people panic. This is for specifying their agony and worry.
Fine. Thank you. Thank you. Let me welcome Dr. Rajiv Bhatt. So, Dr. Rajiv Bhatt is a clinician, chest physician and allergist, and an expert in public health and hospital healthcare management, having done MD, diploma in hospital administration, diploma in tuberculosis and chest diseases after doing his MBBS. Dr. Rajiv Bhatt has 25 years of experience as doctor in different top hospitals in Delhi. He has also worked as health consultant for 10 years for different international NGOs like WHO, Polio Surveillance Project India, Plan International, MacArthur Foundation, and national NGOs such as CAS to Plan, NAS Foundation, and Pathfinder. He was a writer cum editor for different medical publications, journals, and e-journals. He has been participating regularly on in training projects in different subjects related to public health, public hospital management, respiratory diseases, etc. Dr. Rajiv Bhatt is presently working as a freelance consultant, healthcare, quality and operations, providing affordable holistic healthcare solutions to different healthcare institutions in Delhi and NCR. So let me welcome Rajiv Bhatt to make his presentation. Thank you, Rajiv Bhatt.
Good morning, everybody. Thank you, Professor Gopi, for a nice introduction. Am I audible to all of you? Hello?
Yes,
sir. Audible.
You are
Please
audible.
go ahead. Audible.
So I will share my PowerPoint presentation. So, respected participants, good morning to all of you. And a warm greeting to all of you. The theme of the webinar is Ayurveda and Yoga, the role in addressing the emerging healthcare challenges. Before I start my paper, I feel my bounden duty to record my sincere sense of appreciation to the organizer, Santhigiri Ayurveda Medical College, Palakkad, and Santhigiri Research Foundation, the research division of Santhigiri Ashram, mainly Professor K. Gopinathan Pillai, and all the co-host organizations supporting the conference like Indian Council of Philosophical Research, Delhi, Veda Research University, and Nagananda International Institute of Buddhist Studies from Sri Lanka. Health has been a matter of paramount importance for mankind ever since antiquity. The trends and transitions on the same have several benchmarks, which stands out as speaking monumental milestone. In future, one of the important aspects under the said rubric will definitely pertains to Ayush, and mainly Ayurveda and Yoga. As we are seeing, these two branches are gaining popularity world over. In this context, I would like to share my perspective through my paper titled Management of COVID-19 Disease Through Integrated Approach. Being an allopathy doctor and a chest physician, I have been actively involved in management of COVID patients since the beginning of this pandemic of COVID-19 disease. We all know the WHO definition of health. Health is a state of physical, mental, social, and spiritual well-being. But this has more focus on health of an individual rather than community. And this focus needs to be changed post-COVID pandemic. Also, this has more focus on all health of an individual rather than hygiene of an individual, and also hygiene of a community. And this also needs to be changed post-COVID pandemic. As we are seeing, the hygiene has got more importance in present scenario. If we see the spectrum of health, it is very vast. Health is not absence of disease. The spectrum of health is very vast. From the one end, there is positive health, then better health, to freedom from sickness or not diseased, to unrecognized sickness or unwell, to mild sickness, to severe sickness, and ultimately death. The focus also varies from individual to family. Health of the individual not only affects the individual himself or herself, but also affects his or her family. This has further implication at community level or state level or national level to further global level, and ultimately to at the level of universe or cosmos. This we visualize during COVID-19 pandemic. We all have seen that COVID-19 has started as few cases at a small animal market at Wuhan, gradually spreading to Wuhan city, then to entire world. This disease has spread globally in a very short span of time and witnessed a high morbidity and mortality. The approach was to identify patient, isolate the patient, and treat them if possible. But this failed to contain the disease due to asymptomatic or carrier phase of disease, when the patients were transmitting the disease to family members and community before being diagnosed as patient. So as a next step, containment of the household and then whole area was started. But even this failed, and most of the country witnessed or are now witnessing community transmission. We failed because our approach was routine. This routine approach has a vicious circle as shown in the diagram. We have symptoms of disease, then we take medicine, try to treat the symptoms of disease and restore health, to again fall sick with disease and we lose health. Again medicine will be taken and then health will be restored temporarily. But it may sometimes end in death of an individual. This is not the right understanding of health. In this way, health becomes a handmaid of medicine. This is not the proper way of looking at the situation. We need to break this vicious cycle. This needs urgent attention when the duration of circle is very short, as in case of COVID-19 disease. Thus, the only effective way to control the disease is to prevent further transmission and not the treatment of the individual, as the earlier approach of treating individual has failed and has led to more mortality. Thus, the approach should have ways for promotion of health and prevention of disease, followed by proper diagnosis and cure. India was able to control the spread of disease initially due to more focus on prevention of disease by way of restricting travel and quarantine. It was followed by one-day Janta curfew and further lockdown in phases. Please note that unlike in other countries where psychological issues emerged because of lockdown, in India, even after a prolonged lockdown, there were no psychological issues because of unique nature of close-knit Indian family system. And in India, we were able to do a continuous lockdown from 25th March for 68 days in 4 phases of 21 days, 19 days, 14 days, and 14 days. And again, these lockdown were followed by unlock in phased manner from 1st June. So the first unlock was from 1st June to 30th June. Second was from 1st July to 31st July. And now we are in unlock 3 from 1st August, which will be till 31st of August 2020. This slowed the progression of disease and gave stakeholders time to prepare for impending pandemic. This was essential as we were not having a good public health infrastructure. There are different reasons for not having good public health infrastructure. One reason being poor budget allocation on public health, and other over dependency on private healthcare and modern system of medicine. This lockdown and unlock slowed the progression of disease and gave health authorities time for health education, health research, and promotion of health. Now, I would like to emphasize here as how the integrated approach was used to manage COVID-19. The system of integrative medicine is based on the view that optimum health of individual and society can be obtained only when all aspects of individual and social dimensions and determinants are taken into account in a symbiotic manner. We all know there are different social dimensions of health as shown in the picture. They are social, physical, mental, cultural, spiritual, psychological or emotional, educational or vocational, epidemiological, and environmental. Similarly, there are different determinants of health, which sometimes focuses on individual or society, sometimes on families, sometimes on communities. Different healthcare sectors and health-related sectors also influence the health. If you see the diagram, they can be divided into public and private sectors, and all these sectors were integrated in the management of COVID-19 disease in India. Whether it was public sector or private sector or non-governmental sectors, everybody contributed to the maximum. If we talk about the medical aspects, elective cases in all the healthcare systems, they had stopped elective cases and the focus was only on COVID-19 management. Teleconsultation was introduced and a special legislation was passed to legalize teleconsultation. Triaging was done and three-care level system was initiated. The first one was COVID Care Center, where the patients were not requiring any medical attentions. They were just quarantined and monitored for any development of any sign and symptoms of any disease so that they can be taken care of. And they were quarantined so that they don't spread the disease to other healthy individuals. The second level was COVID Healthcare Center, where they were having minor symptoms and they were taken care of by routine symptomatic treatment. Then the third level was COVID hospital, where the patients were moderate to severe and they were given sometimes intensive care or technical medical support was required. For other medical problems, the hospitals they were differentiated, and non-COVID hospitals were identified at different district level, where the non-COVID problems were taken care of, because we cannot stop all non-COVID cases should also be taken care by. So they cannot wait for COVID to stop, or so the non-COVID hospitals were identified, and mainly these hospitals were giving support for physiological conditions like pregnancy and other diseases which require urgent attention, medical attentions. Direction of Ayush Ministry was very important, and Ayush Ministry gave time to time do's and don'ts about the COVID-19 disease, and especially they gave certain prescription to ensure that people follow them for promotion of health and prevention of COVID. These included traditional Ayurvedic medicines, natural herbal remedies, Siddha medicines, and homeopathy medicine. Role of yoga was also promoted, mainly to keep one fit, as gyms and parks were closed. Also, emphasis was on yoga exercise like pranayam and alom vilom, etc., to improve lung function. Agriculture sectors was involved so that there is no stoppage of essential supply of fruits and vegetables, and these fruits and vegetables were reaching consumer at those steps. Public works, sanitation and water department were working in tandem to ensure proper disposal of waste and availability of clean water to everyone. They were also sanitizing roads and containment zones through spray of sodium hypochlorite solution. Educational institutes also changed in this era of COVID-19, and they didn't stop. They were working and they were disseminating social awareness about disease and promotion of health. Online classes started, and they ensured that there is continuous education, and the education is not hindered, and without compromising the safety of vulnerable age group. They were not exposed to the COVID-19 pandemic. Similarly, the work from home started, and this ensured that jobs are retained and there is a financial support to family. International and national organizations, they were giving financial and technical support for different type of research activities like development of newer drugs and vaccines for COVID-19. NGOs and other religious organizations ensured that food and medical support to underprivileged sections and society is there. And they opened their store and organized langars and also distributed raw material for those families who can cook at their home. Self and community care were also promoted. So the important measures that were taken for COVID-19 management in India was mainly SMS. S means social or physical distancing. Mask, especially when the person is coughing and sneezing in the family, or whenever he steps out of his home. The continuous use of mask. Then sanitization. Sanitation, the main focus was on hand hygiene, using either hand wash or using soap and water, or if the soap water is not available, then use of sanitizer. If you see, this revived our age-old traditions like greeting from a distance using namaste, and now the world is following this way of greeting. Not bringing footwear inside home, because bringing footwear inside means inviting fomites inside the home and then infecting the family members. Even when they are not going outside, the virus is coming inside. Washing hand, foot and face before entering homes. and separate guest room at the entrance of home, and separate utensils for guests and mainly outsiders. So these revived these age-old traditions of Indian culture. Further, for health promotion, the focus was put on hygiene. If you see, earlier the people were like, normally health and hygiene go hand in hand. If the health is not good, the health hygiene will be compromised. Similarly, if the hygiene of a person is not good, he will definitely invite bad health. So the focus was on hygiene, like hand hygiene, respiratory hygiene, body hygiene, food hygiene, servant hygiene. Like now the people have started taking care of food items. Whenever they are bringing food items raw or packed, they were kept outside in a bucket. If they are not, if they can wash the food was first washed and then brought inside the home, kept in the fridge. So all these steps were taken, and every frequent hand wash was promoted. Whenever they are coming out from the home, the thorough body wash, like whenever any person is coming from outside, they were first asked to take bath and then interact with other family members. There were different environmental issues which nature has taken care of by itself. Because of the lockdown, there were no vehicles on the road, so the air got purified, and because there were no factories which were operating, the waters, the rivers, they cleaned themselves. And now the Ganga and Yamuna rivers, they were flowing with clean and unpolluted water. And even after spending so much money on Ganga and Yamuna project, we were not able to achieve results which we could achieve in these phases of lockdown and unlock. Similarly, the focus was on nutrition, balance and nutritional diet. The Ayush Ministry was promoting through audio-visual aids, and also because the restaurants and mainly the fast food joints, so everybody was getting healthy homemade food full of vitamins and supplements. And because everybody was home, they were eating together. A bonding was also there in the family. There was improvement in the lifestyle because everybody was at home. They were not supposed to go outside, so they went to sleep on time, and there was optimum sleep. There was avoidance of alcohol, smoking and drugs, initially mainly because the shops were closed, and then it helped them in quitting these bad habits. Then mild to moderate exercise at home, because the gym and parks were closed. So these mild to moderate regular exercise at homes like yoga and pranayam were promoted, and these also help in better health of an individual. Now, I would like to share, because I am actively involved in the COVID-19 patients, treatment of COVID-19 patient, I would like to share one of my prescription given to a COVID patient. So even the allopathy doctors have changed, and they have integrated good things of other pathies in the prescription of COVID-19 disease. If you see, this is one of the prescription, and if you see the top rectangle, specific treatment, the specific treatment was not much. It consists of only few points or few medicines. But the main part of the prescription was second rectangle and the third rectangle. It was full of different types of vitamins and minerals with focus on zinc, vitamin C, vitamin D, and the main focus was on nutrition and lifestyle. The improvement of the monitoring, home monitoring, not dependence on any medical worker. So home monitoring, Then the new focus was on diet, liquid, fruits, vegetable, juices, and then changes in the lifestyle. So this is normally should be the prescription for all diseases, where the specific treatment should also followed by the nutrition and lifestyle and exercise changes in the exercise, so that the disease is not only temporarily cured, but we should be able to promote the health and we prevent the further occurrence of the or episodes of the disease. Their different home remedies were also included. These were taken from the Ayurveda, yoga, and homeopathy. If you see, even the homeopathic medicine, arsenical album was promoted. Ashwagandha, the role of different immunobooster like ashwagandha, giloy, different Indian spices like hadi, clove, they were promoted by Ministry of Ayush, and the people followed them, and these were really very effective. And because of these integrated approach sometimes was not even prescribed, but the people, they were following, because these do's and don'ts and about this mainly what to take from our kitchen was promoted by different social medias like Telegram and WhatsApp. So the people were at home and they were using these pathies, and these pathies did had a positive impact on the promotion of health and prevention of COVID-19 disease. Thus, I would like to conclude here with this concluding paragraph. There is a need to understand the conception of health and healthcare afresh. It is much easy to invite disease, but it is very difficult to invite health. Prevention is better than cure, so it is needed that we prevent the possible occurrence of disease. Thus, much more attention is to be paid to health promotion and disease prevention than to cure. By making certain lifestyle changes and avoiding risk factors, one can greatly reduce the risk of disease and premature mortality. Promotion of health, specific protection, and prevention of disease should be the primary clinical approach. The lifestyle changes required are not difficult to achieve, and even relatively small do's and don'ts can have a significant effort over the years. All different systems should integrate from basic level of promotion of health, prevention of disease, and if disease occurs, then in treatment of disease till it cures completely. A doctor can only be a guide. All it requires is judicious decision and proper care. Ultimately, of course, only the individual human is responsible for this, as he or she has to make the necessary adjustment to hygienic requirement, nutritious diet, and conducive lifestyle to achieve health.
Thank you. Thank you so much.
One who has health has hope, and one who has hope has everything. I would like to end my presentation with this prayer, which normally I write at the end of my prescription also. Om Sarve Bhavantu Sukhina, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu, Ma Kashiddu Bhag Bhavet. Om Shanti, Shanti, Shanti.
Well, thank you, Dr. Raju. But thank you, Dr. Raju. But being a doctor actively involved in the management of the present pandemic, your presentation has enlightened the participants as to how to manage, how to approach the present horrifying pandemic. It was highly enlightening. Thank you, Dr. Raju. But thank you.
Thank you, sir, for giving me opportunity to speak. Thank you.
Thank you, sir. You have illuminated us with the current need of integrated medicine in our present scenario of COVID. Let this be the start of a new change in our thoughts towards the relevance of integration of different systems of medicine, especially in situations like this. Next, we welcome Dr. Arati P.S., former Principal and Professor, HOD, Department of Panchakarma, Santhigiri Ayurveda Medical College, Palakkad, Kerala, for the topic, Rasayana Chikitsa, Scope in the Emerging Healthcare Challenges. Welcome, ma'am.
Thank you. Am I audible, sir?
Yes,
sir, am I audible?
You are audible. You are audible, madam.
Okay. Sadguru Sharanam. Om Dhanvantri Namaha. Let me first thank the organizers for having given me an opportunity to present in front of this august audience. Rasana Chikitsa in the existing scenario to face the present and future challenges. This is the topic of my presentation today. Can I share the screen? Whether the screen is available, sir? Can everyone see the screen?
No, madam.
No,
It is not
no,
yet.
not yet.
Just a minute.
Vivek, please help her.
Net issue, huh? Login check. There is a small technical issue. We will be back in a minute. There is a small network connectivity problem. We are back.
ഇവിടെ ചെയ്യാൻ പറയും മെയിൽ ഉണ്ടോ?
Namaskaram, everyone. भट्टे सर नमस्कार। भट्टे सर को नमस्कार। मैं नेपाल से गोविंद बोल रहा हूँ। साउंड नहीं आ रहा है।
Can we pass on to the next speaker?
हाँ?
Can we pass on to the next speaker?
Sir, yes, I think Dr. Krishna Nambudri is available. He can start, and we'll have Arati Madam's presentation after that one. Krishna Nambudri, sir? Yes, sir. Welcome, sir. Welcome. Share cheyanda. Please, Krishna Nambudri, sir.
I think
Yeah, Krishna Nambudri, sir can.
Yeah.
Sir, let Krishna Nambudri, sir, continue, sir. Krishna Nambudri, sir,
So,
please.
sir, my time is 11:30, right?
Yes, sir.
Half
No
past 11.
problem.
No,
You
we
are
would
kind
like
to
to.
open in 11 to 11:30, but no problem. You can have half an hour from now, sir. No problem.
Of course, my mic is not available now, but
Oh,
my mic.
I hope Dr. Aradhi's presentation is ready. I feel that like Dr.
Within
Aradhi's
15 minutes, my mic will be available.
Okay, sir. Now you are audible, sir. If you want to continue, you can continue.
I'm more comfortable with mic.
Okay, sir. Then one minute. Dr. Arthi will be continuing.
Please,
Madam.
Yes.
Arthi
Madam,
madam.
she continues better.
Yes, sir. Yes, sir. She will be continuing now.
Yeah.
Am I audible, sir, now?
Yes, madam. Audible. And you just to see whether your screen is being shared.
Can everyone see the slides?
No. It is
No.
not yet shared. Yes, now it is coming. Yes, madam. Yes, madam. Please continue.
Sorry for the inconvenience. Let me first thank the organizers for having given me an opportunity to present in front of this august audience. Rasana Chikitsa, its scope in the emerging healthcare challenges. That is the topic of my presentation today. These are the various contents that I am going to present. Let me straight away enter into the topic. There are a few important issues in front of us. Contagious disease was actually a bygone phenomenon until the last decade, and the era was mainly of non-communicable diseases. So it was a crude shock that epidemic striking the society once again, and similar situations may appear in the coming years also. And on the other hand, we are facing a lot of challenges like unprecedented changes are happening in the life of people, change of job, change of living space, change of environment, priorities, stress, earnings, everything. These all are very potential stress factors which can affect both the mind and body together. And we need to focus on how we will be prepared to face these challenges and to manage them. And on the other hand, there are other issues like we need to take care of certain group of people because these are very vulnerable. Our elderly population, it is known that they are getting suffered a lot. Persons having NCDs are more prone to get kind of contagious diseases, and persons with the low immunity, they are also very vulnerable. So what is the way ahead? Now the focus is largely on providing medicine when a person is diseased. Is it not high time that we go the Ayurveda way? Ayurveda gives equal importance both for the Swasthya Samrakshana and Vikara Prashmana. A person by different modalities like Dinacharya, etc., can preserve and promote his health. And this health imparts good immunity, as we all know. Immunity in Ayurveda is known as Vyadhikshamatva. It is the capacity to prevent the occurrence of a disease and to oppose the strength or severity of a disease. It depends upon Ojas, another important concept of, or any very unique concept of Ayurveda. It represents the very vital energy depending upon the Sara or the essence of all the dhatus. And we see that people around us, they respond to diseases in different manner. Some are gifted, they have very high immunity since birth, and this is called as Sahaja or natural immunity. And sometimes the immunity will get fluctuated in some people depending upon the kala or the age which they are passing through. Acharyas have advised to enhance a person's immunity by proper diet regimen and proper modalities like Rasayana Chikitsa. Let us now see what is Rasayana Chikitsa. Various definitions give a very comprehensive idea of what is Rasayana Chikitsa is all about. It is the therapy which enables the body to get best form of rasadi dhatus or excellence of tissues. And this is achieved by facilitating proper ayana or transportation of rasadi dhatu. In the second definition, rasadi dhatu, it represents actual the asthaya dhatus, the tissue nutrients under transformation. The next definitions actually highlight the ultimate goal of Rasayana Tantra. It helps in slowing down the aging process. It enhances the lifespan, intellect, stamina, and curing diseases. In short, Rasayana Tantra is Jara Vyadi Vidvamsi. The prayoga or the usage, Jara Vidvamsi or a destruction of old age, needs a little bit explanation. It was enjoyed by our earlier seers. Now let us take only what is relevant to the current era. It's actually enjoying a gracious old age free from disorders and also preventing the premature old age. That is what is expected. And here's I try to give a mode of action of Rasayana Dravyas. Rasayana Dravyas aimed at correcting various components of the metabolism, digestion, and tissue nourishment. It starts from the Agni. Agni is of paramount importance. It is told that Shante Agnau Mriyate Yukte Chiram Jivati Anamayaha. The life and death depends upon how a person's Agni is functioning. And once the Agni is corrected, Agni is not only at the coastal level, even Dhatu Agni also should perform properly. Srotasas should transport the nutrients properly, which ensures both the micronutrition as well as the tissue perforation. And this in turn ensures proper dhatu poshana, which results in an optimal level of ojas and immunity. And a person with good immunity can resist the diseases. There are twofold benefits. One is to prevent the occurrence of the disease. If at all he gets diseased, he can withstand the onslaught of the disease in a better way, and also the recurrence can be prevented. Rasayana Chikitsa, if used properly in appropriate stages, can cure the diseases also. And how Rasayana Chikitsa can help us to attain a healthy old age and how it can help to slow down the aging process. Let us quickly see the factors which are responsible for Sharira Vritti. We see Sharira has got two functions. One is anabolism and catabolism. So it is called as both Kaya as well as Sharira. So there are four factors which are contributing for the Sharira Vriddhi. Kala, that's the time factor. Swabhava or the natural phenomena. Ahara Saushtava, wholesome food. Avighata, absence of harmful factors. The same factors, when reversed, can lead to Sharira Kshaya or reduction, seen on the other side. It is evident that we cannot touch the first two factors. They are out of our reach. But we can focus on the last two factors. Providing wholesome food ensures normalcy of Tridosha Dhatu Mala, which is very essential for good immunity, whereas faulty diet causes a lot of imbalance. Absence of harmful factors is also very much essential. Harmful factors here, we can understand, it varies from a small stress factor to a major disease. We know that if a person getting affected with the diseases very frequently, he is prone to get accelerated dhatukshay in his body, which will ensure a premature aging. A proper Rasayana Chikitsa will ensure good immunity, which will give that protection to the body so that we can resist the premature aging, and this person can enjoy a free, healthy, disease-free life even when he becomes old naturally. And it is evident now that Rasayana Chikitsa is mainly aimed at providing long-term benefits. So the next question is, what is the ideal time for Rasayana Prayoga? I personally believe that person of any age can take Rasayanas. But the ideal time, as our Ayurveda Acharyas suggest, is early phase of the life, that is up to 16 years, and the middle age extending up to 60 years. Please note that age enters into a stage of parihani or a deterioration after 40, and it will continue up to 60. So the reason behind advising to take Rasayana in the early phase and middle age must be that we need to provide right nutrients in the appropriate time. See how much care we take for constructing a building. We provide right kind of materials at the foundation laying stage and even afterwards, so that the building stands strong, ready to face any type of adverse climatic conditions. Then why can't we take similar responsibility to protect our body also? Let us come to see how the Rasana Chikitsa is being practiced everywhere. Ayurveda Vaidyas do practice Rasana Chikitsa both for Swastha Samrakshana and as well as for Roga Nashana since years. I'm sure that most of our audience are familiar with many of the Rasana Dravyas and Rasana formulations. Amalaki, Ashwagandha, Pitpali, Brahma Rasayana, Chavanaprasha, all these are very popular Rasana Prayogas. What is important to note is that Rasana Chikitsa is one of the Ashtanga Ayurveda based upon very strong fundamental concepts. And there is a clear methodology for adoption too, which is very important. As shown here, Ayurveda Vaidya will examine the person or the patient to assess the Prakriti, to assess the Agni Bala, to assess the status of dosha and dhatus. Only then he will go for selecting an appropriate rasana formulation. Preparation of the person is also again very important. Deepana Pachana to be administered and Shodhana to be done in order to keep the doshas in their normal position. Lot of thought processes involved in fixing the dosage, anupana, and planning the patyahara vihara. The result or the benefits of Rasayana Chikitsa doesn't merely depend upon a Rasayana Dravya, but rather it depends upon all these various stages involved in the Rasayana administration. And the Vaidya will have two options. One is Kuti Praveshika type, which is known as indoor method, and the Vatatipika, that is outdoor method. Indoor method is tougher one. It is a supreme one and has got lot of benefits. And outdoor method is very practical and is commonly practiced. And coming to the Rasana Dravyas, there is a wide range of Rasana Dravyas available in our classics. It appears that these Rasana Dravyas do not have a common Rasapanchakas. They have different combinations of therapeutic properties. That is why their action also varies accordingly. Some are Agneya, that means they have Ushnavirya and having predominance of Katu, Tiktarasa, Katu Vipaka. Pipali, Bhalla, Taka, Lachuna are examples. These Dravyas mainly act upon the Agni, they enhance the Agni, they improve the micronourishment and tissue perfusion, and as a result, they facilitate proper Dhatu Poshana. Whereas some Dravyas are Saumya, having Shitavirya and predominance of Madhura Rasa, Guru, Snigdha Guna, Amalaki, Bala, Shatavari, these are the examples. These Dravyas directly enhance the quality of Rasa and Dhatu Poshana. It's also important to subject some of the Rasana Dravyas to various samskaras or processes for modifying and enhancing their action. And formulations are plenty, having both Agneya Dravyas and Somya Dravyas. Chavanaprasha is such an example, having very judicial blending of both Agneya Dravyas and Somya Dravyas has got multiple therapeutic effects. And Ayurveda Vaidya will also choose Rasayana formulations depending upon the purpose. These types are given by Acharya Sushruta. Rasayana Prayoga for enhancement of memory, intellect, etc. is known as Kamya Rasayana. Administration of Rasayana for the curative purpose is known as Naimitika Rasayana. And I invite your attention to the third one, Ajasrika Rasayana, that is regular use of milk and ghee. Rasayana need not be always only in the therapy form. It can be a part of our dinacharya also. It can be part of our daily diet regimen also. So regular use of milk and ghee will give the benefits of Rasayana for some people. I don't tell that everyone can have this. It will suit some people only. Here are a few examples for Kami Rasayana. Shankapushpi, Mandukaparni are best Medhya Rasayanas, and Brahma Rasayana, Chaunaprasha are best for Vayasthapana. And these all are the examples for Naimitika Rasayana, Pitpali, Agastya Hritaki, Shilajatu, Tuvaraka, Lashana Rasayana, good for some kinds of Vatavyadis. Coming to the pharmacodynamics of Rasana Dravyas, lot of studies have been conducted to assess the action of our Rasana Dravyas. I'm giving very few examples here. Amalak is known to have antioxidant action and immunomodulatory action. Ashwagandha, Guduchi, and Pipali are known to have adaptogenic action. Neuroprotective action of Medhya Rasayana has been proved. A combination of Guduchi, Ashwagandha, Tulasi, and Amalaki found to potentiate both the cellular and humoral components of immunity. A lot of works have been conducted. And I again repeat that the overall benefit of Rasayana Chikitsa doesn't merely depend upon this single Rasayana Dravya. The outcome depends upon a lot of the factors involved in the administration method and the person. Now, again, I am showing the earlier two slides, our major issues, because this is where I started. We have got two sets of disease and we have certain groups of people. And now we need to discuss how Rasayana Chikitsa can be adopted to address these two issues. Both preventive and curative aspect need to be discussed. Coming to the prevention, the protocol is same, whether it is a communicable disease we are aiming or whether it is a non-communicable disease. Ayurveda classics give a very detailed regimens like daily regimen, seasonal regimen, diet regimen, non-suppression of physical urges, and good conduct. I have mentioned Rasayana Chikitsa at the last, not because it is of least importance. It is because the person who can follow the first five he can enjoy a very good health and he will have a very good immunity. Rasayana Chikitsa is not actually mandatory for him. For him, Rasayana Chikitsa will be an add-on therapy and it will give additional benefits. And I need to mention about Acharyas and good conduct I already mentioned. Acharyas have suggested the benefit of good regimen and a good righteous life on several occasions, and even in the context of Rasayana that has been highlighted. Acharya Rasayana will impart highest level of Satvika Bhava to a person, which itself is a potential method of giving Rasayana benefits. That is, he can enjoy a very good health and can enjoy a very good immunity. Again, here, Rasayana Chikitsa will give additional benefits to such persons. I am giving a few simple Rasayana prayogas for outdoor method, Vatatipika method, juice of Emblica officinalis with honey or sugar candy, ghee, powder of Haritaki churna with jaggery or honey or dry ginger, powder of vacha with milk or ghee or ginjal oil. The fourth one is a very interesting yoga suggested by Acharya Vagbhata, cold water, milk, honey, ghee. This can be taken either alone or in combination of 2 or 3 or all together early morning. It is said to promote longevity. Coming to the curative aspect, a big question, can Rasayana Prayoga is beneficial in infections? It is only when it is used in the Nirama Avastha. Here, Rasayana Prayoga will enhance nourishment. It will be useful to increase the stamina of these people, and it will help to reduce the upadravas or complications, and it will help to prevent the recurrence. And Rasayana Prayoga for uncommunicable disease, it is being practiced since years. And there are a lot of diseases, and the Chikitsa protocol will be according to the disease. It is a common protocol to avoid the cause, to give the Shodhana procedures wherever in a mandatory, to go for Shamana therapy and then Rasayana therapy. Here, Rasayana therapy will be used either for Shamana or the pacification of the symptoms, and also for improving the immunity so that the recurrence can be prevented. Any Shastra, it is for the benefit of the mankind. So the concepts of Shastra should be implemented appropriately. So bring Ayurveda in the mainstream public health system and incorporate Rasayana Chikitsa in healthcare programs at all levels, now or never. There should be conscious and concrete efforts from all stakeholders, starting from the individual to the government. Individual is the receiver and government is the provider. We all will serve as the components in between. Individual should understand what is the requirement of his body and mind, and he should understand why Ayurveda regimen is important. And government should formulate necessary programs, policies, strategies, plans in order to implement it effectively. Ayurveda preventive medicine should be projected as national health program. Ayurveda immunity clinics are required to monitor and implement various programs like awareness program for public education and training to the healthcare professionals. Also, let us not forget that the health of our future generation depends upon how good we inculcate good habits in our children. So let us care for our children. Rasayana Chikitsa will help them to acquire long-term immunity. Also, we need to address specific issues of children and students like enhancing concentration, memory, preventing conditions due to overuse of digital media. There are so many other issues also. And care for aged persons is also of utmost importance. Rasana Chikitsa will be a very good supportive therapy for them. And also we need to resolve issues or to maintain conditions like musculoskeletal diseases, neurological diseases, and so many other conditions. Let me conclude. Prevention is better than cure. We all know. And Rasana Chikitsa will be beneficial to prevent diseases, both communicable and non-communicable. Let us Rasayana Prayoga will be a part of our daily regimen also. Acharya Rasayana is also a potential method to enhance immunity. Let us follow a good, righteous life. Effective implementation of Ayurveda in the mainstream public health system is the need of our National Health Program for Immunity through Ayurveda. This is a need of top priority. We are hearing a lot about preparedness nowadays. We need to be prepared to anticipate and respond effectively to the impact of current and future situations. Let us be prepared through Ayurveda and Rasayana. Loka Samasta Sukhino Bhavantu. Thank you very much.
Thank you, ma'am, for your
Thank you.
wonderful session.
Thank you, madam. She is also former principal of Santhigiri Ayurveda Medical College, and she is also one of the coordinator of this great event. And timely she concluded her session, and very beautiful and informative session, and need of the hour also, because everyone we are here and there always talking about Rasayana Chikitsa and immunity boosters, and really her presentation will give us insight how it will work and what is the scope of Ayurveda in these hard situations. Thank you very much, madam. Thank you.
Thank you. Thank you.
Thank you, Dr. Aradi, for your illuminating presentation. Thank you.
Thank you, sir.
To present the next lecture, we call upon Dr. Krishna Nambudiri, Head of Nagarjuna Hospital, Kaladi, about Agni, a catalyst to boost immunity in Ayurveda. We welcome you, sir.
Am I audible? Hello?
Yes, sir. You are
Yes, sir. Yes, sir.
Okay, thank you. Shangham Chakram Jalukam Dadhatam Amritakumbham Jadorбhiश्चतुर्भि Sukshma Swachhadi Hridyam Shugabari Vilasan Maulimam Bhojanetram Kalambhodojjwalankam Kaditana Vilasacharupidambaradhyam Vande Dhanyundarim Tam Nikhila Gadavana Praudhadavagnililam Tarunambuda Sundara Tadatvam Nanu Dhanyundariruddhidomburase Amritam Karasevahankarabhyam Akhilartim Haramarutalayesham Chaturmukha Samarambham Vagbhadacharya Madhyamam Asmadacharya Paryandam Vande Guru Parambaram Ragadirogan Sadatanu Sheshakaya Prasadana Sheshan Autsukya Moharadidan Jaghana Yovu Vaidyaya Namostu Tasmai Vamshi Vibhushidakarana Ravindanabhat Pidambarat Arunabimba Phaladharostat Purnendu Sundaramukhat Ravindanetrat Krishnat Param Kimapi Tattvam Aham Najane Krishnat Param Paramatattvam Aham Najane. Namaste. Suprabhadam. Sashtanga Pranamam to Gurus and Parivarajakas. Respected Dr. Professor K. Gobinathan sir, respected Dr. Professor G. Nagbhushanam sir, respected previous speaker, Dr. Adati madam, and all other dignitaries, doctors, friends, good morning to all. Indeed, a great pleasure and grateful to be with you all. Let me express my gratitude and thanks to organizers, especially Santhigiri Ayurveda Medical College and Research Foundation and Indian Council of Philosophical Research. Special thanks to Dr. Professor Srikala M. Nair, Head Philosophy Department, Sri Shankara Ayurveda, Sri Shankara University of Kaladi, and of course, Govinathan sir, motivating me for this webinar. Let me come to my subject, Agni, a catalyst to boost immunity in Ayurveda. Tasmad Agnim Sada Rakshet. Charaka says, Tasmad Agnim Sada Rakshet. There are many scientific concepts in Ayurveda which need detailed scrutiny and assess their extent of meaning, philosophical understanding, practical implication, and utility in the field of Shastra, with special reference to our Sahajabala, Vyadhi Kshamatva, Ojas, of course, immunity. The concept of Agni is one such kind, and this is a humble attempt on that. The role Agni in living body, especially in human body, is very much discussed in all Ayurvedic classical textbooks and other Vedic and non-Vedic scriptures. All kinds of metabolic disorders and other infectious diseases and immunity deficiency are caused by vitiation, imbalance, or derangement of Agni. So, Agni is the main catalyst to boost immunity and is responsible to keep swasthya, to prevent from all afflictions and ailments, all badhas. Human body is considered as a replica of the universe. Whatever is available outside, they are all represented in the human body as well. The Agni outside is directly linked up with the biological Agni inside the human body. Acharya Charaka says, Yavando Bhava Visheshaha, Yavando hi loke murtimando Bhava Visheshaha, Tavandaha Purishe, Yavandaha Purishe Ta Tavando loke iti. So, the term Agni derived from the Sanskrit root word Agi. The term Ni has been merged in the root word because the source of Agni is sun. Sun is responsible for our life in this universe. We get prana because of sunlight, photosynthesis. Everybody knows. That is the reason Bhagavatam says, Surya Atma Drigishwara. From the Vedic period onwards, there were many discussions happened on this subject, role of Agni in our existence of life even. That is the reason. Rigveda, the oldest written transcript, starts with description and praising of the gunas and karmas of Agni. That is why in Rigveda we can see Agni Mile Purohitam, Yajnasya Deva Mattujam, Hodaram Ratnadhatamam. Including Upanishads, thousands of Vedic scriptures are also discussed on Agni. There are nearly 34 synonyms of Agni mentioned in Amarkosha and Shabdakalpatrama. Hope, am I audible? Hello?
Yes, sir. You are audible, sir.
I'm audible?
You are audible, sir.
Hello, I'm audible?
Yes, sir, audible.
You are audible, sir.
You are audible. You are audible, Dr. Nambudiri.
You are audible, sir.
Dr. Nambudiri. Dr. Krishnan Nambudiri, can you hear us? You have left, I think.
Sir, there is a technical issue. He will be back soon, sir. I think there is a network issue.
No, because he muted his mic. He has muted his mic. Yeah. Dr. Nambudiri. Dr. Nambudiri. Unmute your mic. Unmute your mic. Unmute your mic, please. Unmute your mic. Yeah. We are audible. We are audible. Okay. Okay.
Hello,
Yes, sir. Please carry on, sir.
I'm audible?
Yes, sir. Audible and visible, both. Yes, sir. Please.
Okay. So, Shabda Rasanas are also explained on Agni and contributed to the Ayurveda. The darshanas which have conviction in the eternity of Vedas and the existence of Vedas are called Shad Darshanas or Astika Darshanas. Nyaya, Vaisheshika, Sankhya, Purva Mimamsa, Uttara Mimamsa are the 6 yoga, of course, are 6 Shad Darshanas. The Shad Darshanas which are not conviction that Vedas are ultimate knowledge system are called Nastika Darshanas, of course, Chavaka, Bauddha, Jaina, Panjarashtra, and Saurashtra, etc. Among Shad-darshanas, especially Sankhya, Nyaya, and Vaisheshika, are dealing with the fundamental principles of Ayurveda. It is impossible to explain or understand the Agni described in Ayurveda without a good background of ancient philosophical works. Agni, as conceived as the Sankhya system of philosophy, is explained through Parinamavada, the theory of evolution of universe. In this theory, provides a rational explanation of evolution, Rupadanmatra. In Rajas, Agni is represented as the power or the force or motion or radiation, heat, electricity, and magnetism. Above are in subtle form of this concept and potential in the Rajoguna of Mula Prakriti. According to Darshanas, Agni is divided into 3 categories, namely Bhauma, Divya, Audarya. Bhauma Agni or the physical fire, Divya Agni or the celestial fire like lightning, rays of sun, etc. Audarya Agni is abdominal fire which is responsible for Dahana, Pachana, digestion as well as metabolism. Combination of Agni with a material object results in various types of transformation. The process of transformation is controlled completely by Agni. The entire process owner is Agni. So we are what we eat. So the whatever we eat become metabolized. There is a rational explanation about the various types of changes and material objects undergo when they come into contact with Agni, a physical fire. The concept in macro level is very much relevant in all micro level subjects in living being like plants, animals, and human beings. The different types of Agni in various plants, animals, and human decides various functions as well. Strength, health, longevity, and even vital breath are dependent on condition of the Agni. The matter and energy are separable only up to certain level, beyond which they are only interchangeable and, of course, inseparable from each other. Acharya Charaka has mentioned that the Agni which is present in the universe is present inside the human body in the form of Pitta. So Agni can be defined as Vidya of Pitta, which says Samavaya Sambandha with it, inseparable existence. The term Pitta is derived from the root Tap. If we go to Nirukti, Tap having various meanings. It means to heat or to burn. In Niruktam, it is explaining in Niruktam Tap, Santape, etc. The term is having 3 meanings. Aishwarya is responsible to make one achieve the 8 kinds of benefits. Ashtaishwarya Siddhis, Anima, Garima, Murta, Garima, Lekhima, Praptir Indriya, Prakasyam, Paradishtesha, Shakti, Paranam, Ipsida. These are the Ashtaishwarya Siddhis. And another meaning is Tap Dahe, act of burning of the food consumed. And Santape, that means generation of heat. Pitta in human body acts as carrier of Agni, which does its functions. All functions of Pitta connected to Ojas, Bela, Varna, Prakriti, Parinamam, Bubhuksha, Chinda, etc. Pahaka, Pachana, Dahana, Bhinna Sanghata, Tapana, Parinamana, Paravrti, Prakashana, Ranchana, Varnaka, Prabhakara, etc. the other functions of Agni. They above all the functions of Agni in macro level as well as in micro level. Life always and gradually undergoes various processes. Those processes is having 6 different stages or phases. They are called Janmadi Shadbhava Vikaras. In Srimad Bhagavatam, Saptama Skandham, Janmadi Shadbhava Vikaras are explained. And they are Asti, Vardhate, Avatishtate, Vibrinamate, Apakshiyate, and Nasyate. So creation, development, sustain, transformation, degeneration, and destruction. So these are the Janmadi Shadbhava Vikaras. The role of Agni in all above 6 functions, 6 stages, are discussed in Ayurveda with doshas, saptadhatus are having role in all these 6 stages. As mentioned before, there are many synonyms of Agni among which Vaishwanara is more relevant here. Vaishwanara means omnipresent or present everywhere. This means that Agni is present in each and every part of universe. Atma is an entity which is present everywhere in the universe. This is comparable to the energy in this universe. In Shukratava Samyoga, Vaishwanara get into the Pinda and fetus and formed Garbha. And Bhagavad Gita, it is said that I, Lord Krishna, is present in every part of this universe as Vaishwanara and functions as the prana of living being by existing in their Sharira. So, Paramatma can be considered as Agni itself. Aham Vaishwanaro Bhutva, Praninam Deham Ashrita, Pranapana Samayuktam Pajamyannam Chaturvitham. So, I am that fire of digestion in the bodies of all living entities, and I join with the prana of life to digest the 4 kinds of foodstuff. Sukhatava Samyoga, also already I mentioned. So this Aishwarya is get into our
Not audible. Not audible.
Maybe some connectivity issues, sir. We'll wait.
Yeah.
Here in Kerala, it is raining, sir. That may be the problem.
Yeah. So
he came back, it seems.
Came back here?
Yeah.
Audible.
Yes.
Audible. Please continue.
Up to where, from where I should start?
Vishwanara.
Sughartha. Sughartha Sarva Bhutanam.
Yeah.
So the main purpose of our life is to get sukha. Okay? Hello?
Yeah, you are audible.
Yes, sir.
Okay. So Sukhartha Sarva Bhutanam Mata Sarva Apravartaya. Sukhanchana Vina Dharma. Tasmal Dharma Paro Bhave. So Sukha is a peaceful state of our life, or Shanti state of our life. We get this Sukha only through Dharma. Dharma can be performed through only Satsanga, without Dambha or ego. That is why Vagpada specifically said, Bhaktya Kalyana Mitrani Seveta. Without Dambha, we should practice or follow Satsanga. Bhakti means here Adambha. When we connected with Satsanga and Mahapurusha Seva, the Agni which is present in Guru or Sajjana transformed to our system to achieve Purusharthas, Dharmartha Kama Moksha. Agni is inevitable factor in this. Agni is Pratyaksha Devata and Dharma Murti. Vedas are having Shanti Mantra in the beginning. All Upanishads also beginning with Shanti Mantra is very powerful. Agni to take our complete system to calm down. Mantra leads to Shanti. Peaceful state of mind give wonderful balance in our whole glands, especially hypothalamus, pituitary, and adrenal glands. When they are in Shanti, will not produce any excess chemicals or toxins and functions normally and lead to perfect immune system. If this triad is not in balance or calm, they are in stress, produce unwanted toxins and create imbalance in Agni, which will produce immunity deficiency. If we keep our mind in natural temperaments and calm and cool, Agni functions normally. For this, best tool is meditation. All yoga sadhanas, especially in the context dhyana, Raja Yoga, is best to balance Agni and to boost immune system. In our day-to-day life, deep sleep is like meditation, and body, especially pitta organs, get relaxed. That is the reason night sleep is very important factor to improve immunity. Nidra decides our strength and clarity of our thoughts. Ya Devi Sarva Bhuteshu Nidra Rupena Samsthita Namastasye 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 Namo Namah. So sleep is told as unconscious bliss limited. Sleep is unconscious bliss limited, where as meditation is conscious bliss limited. So in blissful state, in higher level of our existence, there is no I, there is no time, there is no place, and there is no space. So I, time, place, and mind absent, vanish in this state. So Nidra is so important to improve immunity. So if you do not sleep in proper time and duration, it will create a lot of problems in Agni and Sahaja Bala. Also, Agni get cleansed during night. If we skip night sleep, Agni becomes weak. And quality sleep assessment is a scale to fix the immunity power. Agni function create the body heat and supply current to inner organs. So as life is pulsating in the body, keeping body temperature is responsibility of the Agni, which is very important for prevention of all diseases. When we die, slowly body become cold because body attain the sixth state of Shadbhava Vikaras. Vyasahatvam means one who is capable of resisting diseases. This is depending on physical, mental, and spiritual equilibrium of a person. Due to unwholesome food, condition of Vatari doshas, and Agni imbalance, reduce immunity and not able to resist diseases. In Ayurveda, there are 23 Agnis are explained. They are as follows: 5 Pitta types, 5 Bhuta Agnis, 7 Dhatu Agnis.
Nambudri sir, you muted. Nambudri sir.
Can you hear me?
Yeah.
Please proceed.
Okay. So in Charaka Samhita explained there are 13 Agnis. That is 1 Andaragni, internal fire, 5 Bhuta Agnis, 7 Dhatu Agnis. But Sushruta explained only 5 Agnis. They are Pachakagni, Janchakagni, Alojagagni, Sadhakagni, and Rajagagni. Agni is not only metabolic principle, but also responsible for any change or transformation, not only in human being, but also all creatures and non-living. With the help of these Agnis, food which we take transformed into Pancha Mahabhutas and in due course into Dhatus. According to modern theory, food transformed into metabolites. So we are what we eat, right? They are carbohydrates, proteins, vitamins, amino acids, and trace elements. These are the 6 metabolites, and of course in fat. So this transformation process is called metabolism. And Agni is responsible for this. Our safe existence is because of this function, and Agni is the catalyst in these processes. Ojas is the supreme state of essence of Rasadi Dhatus. Ojas is nothing but result of good Agni. It is most excellent. Tejas formed from the Sara of Dhatus. Ojas forms the Bela, and it is also called Bela. Sahaja Bela or Vyatikshamatvam or resistance of power is depending on Ojas. Health is a balance of 7 factors. Samadosha, Samatnisha, Samadhatu, Malakriya, Pasannatma, Indriyamana, Swastha Itya Bhidiyate. So this is Prasanna Atma Indriya Mana Swastha Itya Bhidiyate. Equilibrium set of dosha, Agni, Dhatus, Malas and their activities are normal along with proper coordination between soul, senses, sense organs and mind is called Swasthya. Immunity is a biological term and that describes a state of having sufficient biological defenses to avoid infection, diseases or other unwanted biological inversions. In Ayurveda, if we are in Prakriti, the state of Agni will be in perfect state and immunity functions always very good. So in Prakriti state, both specific and non-specific immunity will effectively function, especially in our innate immunity or non-specific immunity is the natural resistance with which a person is born. Prakriti or constitutional balance results in Sahajabala, Vyathikshamatva, Swasthyam and immunity power. Among above 7 factors, Agni is most important factor in which both quality and quantity are important. When Dhatus and Agni are in normal state and Bela is in good, lifespan of a person will be increased. So Ayush is not Niyatam according to Ayurveda. Agni when present in Samavastha will bring all Dhatus to excellent condition and hence produces a condition termed as Prasasta Purusha, the ultimate outcome of Samagni. A Prasasta Purusha is
Sir, any problem? Any problem again?
Maybe some network issues, sir. Let him connect.
Hello.
Yes, sir. Please carry on.
So from where?
I
don't know.
Hello.
It's
Just sir.
Prasasta Purusha?
Yes, sir.
Prasasta Purusha.
You can start from there. You can start from there.
From Prasasta Purusha?
Yes.
Shall I start from Prasasta Purusha?
Yes, sir.
Yes.
Okay. Agni, when present in Samavastha, will bring all dhatus to excellent condition and hence produces a condition termed Prasasta Purusha, the ultimate outcome of Samagni. Am I audible?
Yes, sir. Please carry on.
Okay. So a Prasasta Purusha is defined as samamamsa pramanastu samasamhanano nara didhendriyo vikaranam na balena abhibhuyate kshut pipasa atapasaha shiram vyayama samhata samapakta samajava samamamsa chayomata. So this is the definition of prasasta purusha. Prasasta purusha defined as who can digest his food properly, who has proper growth of mamsa which is equally and well distributed, who has good strength to tolerate the hardships and does not get inflicted by common diseases, who has anatomically and functionally well built sense organs, who can tolerate thirst, hunger, sunlight, cold, and physical activities, who can withstand the signs of old age. Charaka has mentioned that Agni is Moola of our life. He mentioned that Agni is the root cause of Ayu, Varna, and Bala. Nature of Agni, Jadharagni, is assessed by Jarana Shakti, that means power of digestion. Power of digestion means the amount of food digested properly within given time. Agnim Jarana Shaktiya Pariksheta. In all living beings, day by day, quality of Agni is getting reduced. So we must put always an effort to maintain Agni Bala. Then only we can build immune system and prevent diseases. In Sanatana Dharma, we can see many Agnihotras, many types of yajnas, all are explained or symbolic representation of this Agni prevention or keeping of Agni. All our present lifestyle issues reduce Agni. It's a big problem. Example are sleep pattern issues, lack of exercise, improper food habits, stress management problems, etc. So this will tamper Agni and result in immunity deficiency. When Agni gets vitiated, whatever we eat do not digest properly. We get indigestion and forms ama or toxins. It will be stay back in srotasas and result in srodhoratha. Amadosha and srodhoratha are another reason for Agni imbalance and immunity deficiency. It will make disturbance in digestion of food and cell metabolism. Gradually, body does not get nutrients and become weak. Sattva Bala loses, which will reduce our Vyadhikshamatva. Bala is three types: Sahaja Bala, Kalaja Bala, and Yuktikrita. Sahaja means constitutional, our strength, and Kalaja temporal, and Yuktikrita is acquired. All these are closely connected with our strength of Agni. Innate immunity may be correlated with Sahaja Bala, and Kalaja Bala and Yuktikrita Bala may be correlated to acquired immunity. Sahaja Bala, it is an inherent characteristic of an individual present since birth. It means Agni constitution during fertilization continues even after birth. In Garbha is like fire emerged after fertilization. Ashtanghada says, Shuddhe Shuklatave Bhaswakamma Klesa Chodita, Agni Divarani. So this is the reference. And so good Agni of male and female always get into fetus, and it gets nourishment during pregnancy and come out with good Sahaja Bala. Such newborn and children are not getting any disease and always healthy. Both husbands and wives' ahara, vihara, and manovyaparas will influence the production of good quality of Agni, which is transferred into fetus. This Agni in fetus prevent many afflictions, bathas, both macro and micro levels. So both husbands and wife before conceive and mother during pregnancy must go through a protocol through which their Agni can be maintained properly. can improve immunity and prevent many prenatal, postnatal, and newborn diseases. Kala Bala, it is depend on season and age. Loss of strength is observed in Adana Kala and gaining of strength is observed in Visarga Kala. This is directly connected with Agni from sun. Like the same way, middle age is most powerful state of Agni in our life, where any food can digest easily and give maximum nutrition to the body. But there is an equal chance to get degradation for Agni in this period, which is in due course and later part of life create lots of metabolic disorders like hypertension, hypercholesteremia, diabetes, etc. and reduce immunity as well. So we must be very careful on our food and lifestyle also in middle age and invest time and mind and money to keep Agni in good condition to boost immunity. Same situation is observed in middle of our day where we expect powerful Agni. So our main food consumption should only in middle of the day, that means while lunch. Yuktikrita Bala, acquired strength is depend on healthy practices related ahara and vihara. To get Yuktikrita to acquire Bala or immunity, one should follow strict lifestyle management regimen. Person who is desirous of health should adopt the healthy practices related diet, conduct, and activities. These regimens are grouped into three: Dinacharya, Ritucharya, and Satvrta. All Dinacharya protocols, starting from early morning, getting up from the bed, using medicated tooth powder, Vyayama, Abhyanga, etc., are to improve Agni or to maintain Agni. If we follow these advices, we will have good Agni and good immunity power and no disease will attack. Satvrta helps to improve Agni and immunity, in which Ahimsa, not only non-violence but also non-interference, is Ahimsa, is the best among the promoters of Sahaja Bala, longevity and Swasthya. Like Navalakshana Bhakti, 9 stages of or steps of devotion: Shravanam, Kirtanam, Vishnur, Bhajanam, Padasevanam, Archanam, Vandanam, Dasyam, Sakhyam, Atmanivedanam. These are the 9 steps of bhakti. According to Vakpada, there are Ayurvedic 9 steps. Acharya says there are 9 factors in healthy life practices as well. These 9 factors very much connected to our immunity, and those 9 are either improve or correct the Agni. Such individuals are free from diseases. Nityam hitahara sevi samikshagari vishayesha sakta dadasamas satyavarakshamavavan aptova sevi cha bhavatya roga. Following persons are free from diseases: consumption of wholesome food, diet, follow the proper lifestyle, dinacharya, observation of all our body functions like evacuation, sleep, appetite, and wholesome behavior, unattached to or controlled sexual pleasures, one who donates and be free from stress and keep peaceful state of mind, impartial in judgment both in family, workplace, and society, who always says truth, endowed with forbearing nature for forgiveness, and one who devoted to or always connected to Sajjana or Sajjana Samsarga, learned people or Mahapurushas. Purana says Satsanga, Mahapurusha Seva, etc. are very much important to improve immune system. If we need mukti, whether from diseases, if we should follow Aptopadesha and nourish Agni in our higher centers and higher levels, the following person does not fall victim in Tapatraya. Person possessing Sadbuddhi, Satvika, Sattvic and excellent approach, Kaya Vak Mano Shuddhis, cleanliness in physical body, cleanliness all physical activities, speech and mind. It means clarity in all our thoughts, independent thinking and clarity in understanding. A good sadhaka or bhakta who observe spiritual activities and regular yogic practices. All above will have excellent power and quality of Agni to improve quality of Agni. To improve quality of Agni and maintain the health, we should drink only warm water, medicated tea made out of shundi, dry ginger, fresh ginger, cumin, coriander, etc. will help and support our Agni. To choose and prescribe the various herb choices, one could able to assess the level of Agni. Vaidya could assess the power of Agni in patients and find suitable dravya to improve, to correct, to modulate, to balance Agni in the body. Assessment of Agni, Agni Bala, understanding the condition of Agni and taking decision that through which dravya, through which appropriate lifestyle modification and through which diet is an art and a siddhi for Vaidyas. That is why Rigveda says Agni is Purohita. Agni is most important and primary factor. Liver is the kitchen of the body. Liver is major Agni organ in the body. Immunity depends on liver. So liver efficiency can be boosted by various herbs like curry leaves, garlic, ginger, amla, etc. Ghee is the best improve to Agni and improves Sahaja Bala and Ojas. Food must be sattvika. Then we can easily improve our immune system. Turmeric is another important and Agni booster and immunomodulator. It can prevent many major diseases and cure as well. Like that, methi, that is fenugreek, is another Agni booster. All 6 amino acids, essential amino acids, are present in fenugreek. That means in methi. So that fenugreek must include in diet for immunity building protocol. Especially the sprouted 20 fenugreek can be taken every day. Ginger, garlic, curry leaf, turmeric, coriander, cumin, amla, ashwagandha, various spices and various vegetables, fruits must include in food to improve Agni and to get immunity. So even above home remedies are capable of to boost immunity and prevent any pandemic. Proper sleep, especially in night, is very important to maintain our immunity. We could able to sleep at least 10 p.m. from and up to 5 a.m. At least 8 hours of sleep to get quality Agni and to get good immune system. And it could prevent bacterial infection, viral infection, or whatever it may be. All seasonal and local fruits, vegetables, and spices are equally important and good in balancing Agni. All such great Agni and immunity boosting agents freely available in our mother nature. So the only challenge is, do we have eye to see and do we have knowledge to practice the same? Guru is having the above and she could simplify the science into simple logical way and deliver, and we only thing is become a good yojaka. Amandram aksharam nasti, nasti mula manaushatam, ayogya purusho nasti, yojakastatra dullabha. So Vaidya should become a good yojaka. To achieve this, everybody must be, or a practitioner must be knowledgeable with practical wisdom, perseverance, sthirosaham. So always must have a sthirosaham and humbleness and jitnasa. So these are very important to improve the Vaidya qualities. Let me conclude.
Yeah.
One who understands the Ayurveda concept of Agni and adopt and practice regularly in ahara, vihara, and all other activities in day-to-day life will become free from disease and can lead healthy and prosperous life. Thank you.
Thank you, Dr.
Thank you, sir.
Nambudiri, because your wonderful presentation. I understand that you widely travel in Europe, disseminating this knowledge of Ayurveda and organizing courses, training programs like that. And from your presentation, we understand the depth of your understanding on these various dimensions of this Agni and Ayurvedic concepts. We hope that we will have in future more interactions with you. And thank you, Dr. Pudri. Thank you, Dr. So now we would invite Dr. T.P. Shashimar instead of Dr. Dear Karthikeyan. Dear Karthikeyan will join us in the evening session. So at present, Dr. T.P. Shashimar will join us, and we all know that Dr. Shashimar has been with us always. Therefore, he needs no introduction. Even then, he's a space scientist. He's a very renowned educationalist. He's an astrologer. He's an in several areas he has made his personality or his merit notable, and he is widely he organizes classes for students across the world. I can say that across the world. In USA, he organizes. He has been to several times. In all the Gulf countries, he organizes. He organizes Bhagavad Gita class regularly. So in all respects, he has vast knowledge, and we are happy to be with you, Dr. T.P. Shashimar. Welcome. Please make your.
We welcome Dr. T.P.
Namaskaram to all of you.
To
Namaskaram to all of you. I thank all my gurus and giving me the blessings and ability to speak on this topic. By my tradition, basically I'm from an Ayurvedic family, and I'm an MS in psychotherapy, so I'm a practitioner of psychology. I was connecting to most of the presentations what is happening, but by chance when my brother Gopinath ji asked me to make a presentation, I gave a title just like that. Sometimes what comes from your manas is what becomes a way of talking to people. So I will try to connect from my reflections on many of the presentations what has happened. Originally, my presentation is supposed to be from 7 to 7:15. Probably the organizers, especially Gopinath ji, must have thought I am the only person in the sequence who got 15 minutes. The rest of the people got 30 minutes. This little boy, let him have his play for 15 minutes. And now Dr. Karthikeyan, who was CBI director when I was in RAW as a deputy director, we had a lot of interaction. He was absent. Just now Gopinath ji called me and said I should talk. When I gave the topic, building bridge between Ayurveda and yoga, it is not the yoga which is normally known as the asana, which I mean. I was thinking about the whole Vedic system which we have, which defines probably as a problem-solving prescription for most of the people. I'm sure when somebody gets problem, they get into astrology, they get into rituals, they get into gemology, they get into mantra, tantra, yandra, whatnot. So I thought I will make a holistic approach. That is why I thought I should have a bridge between the Ayurveda and yoga. So the bridge will be all these practices which we have in society today. Wonderfully, the topic of the conference is Pratna. The Pratna is not in the form of wisdom or knowledge. It is the wisdom itself. It is not look like pratna or maybe like pratna or seems to be pratna as pure knowledge as it is. When you learn it and practice it for the blissfulness, not for the well-being. Well-being is only for some people look at it is for physical. I understand you don't have to make a bridge which is already there, but we lost it and we made islands between all of them. That is where we need to connect it now. Otherwise, it is already connected, well connected. But the mistake is from the modernization point of view, many people have made their own islands. Otherwise, Ayurveda itself says, Swasthya, Swastha, Rakshaka. What is can be done with all that. So it is not a pratna, it is Ridamba pratna, which is part of the Prakriti. The Ayurveda itself has got yoga inside that. The spirituality is well built inside. That can be understood probably when you look through the Sankhya philosophy. And it's not the same. As an academician, probably you should look at it with the whole sloka by sloka, word by word, where it can be applied, where it has to be studied. So there is an experimental part of it and an experiential part of it. The energy concept in the life force energy, when somebody mentioned about aura, and somebody mentioned about the faith system, somebody mentioned about the energy concept, all that need to be studied very carefully. So when Ayurveda, and if you want to call yoga in the modern technical terms, which I don't agree, as meditation, there are a lot of contribution from the Ayurveda to the meditation. It is part and parcel of the healing of the mind. Unless you have got a swasthavastha, how do you get into meditation? So it's all part of making you to prepare for the samadhi. Dhyanam is possible only when you get into that small swasthyam and silence inside you. That is very, very essential to understand. In a pyramidic structure, you have to migrate from the base health to the pyramid top, which is actually the samadhi. That is possible, as Yoga Vasishta says, Purne Manasi Sampurnam. It is all in the mind. At that level, you should reach. It is not just a faith or not a science. It is not intuition or reasoning. It is not thinking fast or slow. It is as you get into that. And when you talk about lifestyle, Midam Bhuktva Shatam Jatva Patashatam Shanai Vama Bhage Shainasya Bishat Gim Kim Prayojanam. Where do you want a doctor when your lifestyle itself takes care of your health? How much to eat? It is not that Ayurveda says food is medicine, medicine is food, which many people quoted, so I am not quoting that. But it says that how much to eat is also important. How much to eat, how much water to be drink. See, I don't understand most of the people who misinterpret this and then give in the naturopathy treatment, which is also another big branch which has got a good market in the world. When Vyayamam is understood that Vayu and Ayamam is Vyayamam, Sharira Manaso Yoga Paraspara Manuvrajet Adhara Adheya Bhavena. If you don't understand the body and mind in the real sense, what is the purpose of talking about this? I'm not explaining any of the slokas which I'm chanting. I'm just referring quotes because I'm understanding that most of the people here heard this many times. In case if you have a doubt, just text me or look at Dr. TPS YouTube somewhere, type half of the sloka, you will get a full explanation because I don't want to get into details here. So just now, when Nambudiri was talking, he was talking about the Nityam Hidahara Vihara Sevi Samikshagari Visheshwasakta. That Visheshwasakta, most important. Hidaharam. Many people misinterpret this Ashtanga Hridaya sloka. Hidaharam. What is Hidam for me? It is not what is Hidam for me in my tongue. The quarter inch of the tip of the tongue, what says me, Hidam is not what is Hidam. What is Hidam for your well-being is what is determined as the hitaharam. It has to be understood. If you are not, and if you don't get yourself into the real sense of action, what is the purpose of having a good physique and you don't put that into effect in action? What action? Which is useful for anybody else in the world, then only yoga comes. Yoga is you believe that you are one human being who is supposed to live a life for somebody's well-being. All my action should be for somebody else. I have to be into action. It is not karma, which Bhagavad Gita says is my taking care of my daily routine is not a karma. What you do for others in your life. If you don't do anything for anybody else in your life, that cannot be considered as karma. So karma is more important. And that karma doesn't become good, then what will happen in the next janma? That karma will become a disease for you. That is what Ayurveda says. It is not that karma which you do for your selfishness. Ananyas chintayanto mam yejana paryupasade tesham nityabhiyuktanam yogakshemam mahamyaham. Lord Krishna is guaranteeing your Lord Kshemam, Yogakshemam. Only when you don't do your karma for your selfishness, when you do for somebody else. Ananyas chintayanto mam, totally unbounded, detached. That detachment is to be there in practice in your life. Unbounded, not having binding. But we are all binded to our sahaja situation where we have our closest people. Anything which you do, everything you do it thinking that what is that I am going to get back in my life? What is the benefit if I get if Dr. TPS is invited for a talk? If I give him half an hour, what do I get? If I give him 15 minutes, what do I lose? Nothing. It all is computed. It is not based on the merit. That is where we are totally confused with our brain, thinking about I. If you don't lose that detachment from yourself and then do everything for somebody else, ena kena prakarena yasya kasyavi dehena sandosham janayat prajna tadaivam ishvara pujanam. That is what is ishvara puja. Let me do something for somebody else to make somebody else happy, and that time that happiness gives me a swasthavastha in me. I feel so happy. If you don't do that, you are in islands of your practices and leaving the route behind this basic knowledge. We need to construct bridges. That is the bridge I am saying. And we need to see Tantra, Yantra, Mantra, Puja, rituals, Ishtapurtam, Sanatana Dharma, all that connected together for creating a wonderful life which will make us in Swasthavastha. Yesterday somebody was mentioning that Ayurveda means you put a thread and a burden down and the oil is pouring, and that is Ayurveda. I don't know which Sushruta, which Charaka talked about this. They never used such systems. It is all bottled. I remember it is Nambi. Immediately I messaged him. We had a good dialogue. We have to understand. Luckily, he is not Nambi Narayan. He is Narayan and Nambi. So, if you have to understand the sense of treatment, we must understand into the roots. Otherwise, it becomes yoga center come beauty parlor and studio of meditation. It's all show. We all have yoga vibranti. That is why yesterday I was asking Mrs. Chowdhury about the happiness index, the well-being index. Why India is not that? Because we don't go into the root. We are always in the superficial. We don't want to understand things, the real essence to practice in our life. If we don't do that, we are in a vibranti. We want to show. If that is what we are into, we are into disorders. Most of the problems are because of that disorder, because we are not totally dedicated to ourselves. Our passion is not seen. The passion will make you happy. The lifestyle diseases is because we are not understanding the basic lessons which needs to be practiced. Otherwise, India would have been the best country, the best nation where we reach up to the first step of Ashtanga Yoga. Only one person, Mahatma Gandhi, reached the first step of Ashtanga Yoga and the non-violence which he practiced throughout, and that became the great message. Otherwise, yama is good enough. Yama, niyama, asana, pranayama, pratyahara, dharana, dhyana, samadhi. You don't have to reach 8 steps. Reach only 1 step, but practice it 100%. But understand the holistic approach and practice little bit of it. Therefore, if you are into Ayurveda, you are into Shastras of any branches, doesn't matter, you must have a holistic idea and the basic background in most of the subjects which you have. I was very happy in the morning to listen to the astrological part of it. We have in the astrology, sun determines, the position of the sun determines your health. But astrologers should not practice it for prescribing what is to be done and to say that puja is the pradividi for that. The astrology is a basic science. But the predictions and the parihara karma happens to be a false practice. So we should know what is good and what is to be bad. If you are not able to make prescriptions, why do you do a pathology? So an astrologer has to practice astrology. Morning very well said. You have to be an Ayurvedic physician. You have to be a psychotherapist. You have to be somebody who knows the real practice of the solutions. If you know the solutions, no pathologist becomes a pathologist just by learning it. They are into MBBS, learned medical science to the basic level, then specialize in pathology. So that is what is essential. Otherwise, the innocent patients, what do? They do themselves a treatment. When you have a headache, immediately I will find out why I have a headache. Then we have such a social system, probably why India is very unhappy, because our social system is what is the problem with us. When we have a problem, we don't consult the doctors or the masters or the specialists. Immediately we will tell our friends and relatives and tell, I have a headache. And the friend will tell you, yeah, last time when I went and met an Ayurvedic doctor, he changed my oil and then the disease was cured. So let me also try that. So the diagnosis is done by the patient himself with half-hearted knowledge, the half knowledge, nor no knowledge sometimes. Or maybe you meet somebody else who comes as a guest in your house, you will tell me, I have got a headache. Immediately they will say, yeah, last week I started going for yoga practices, everything became perfect. So what do? That person will tell you, you are standing up all the time, your head was on top, that is why you have a headache, put the head down. You know the stupid yoga practice which says, where you have to put your head down and then the whole problem will be solved. I don't know which Patanjali taught this. Patanjali never thought about it. If Patanjali would have taken a second birth, he will commit suicide for doing all these stupid things in his name. And you go and tell that somebody comes and says that your eye is your problem, the ophthalmologist will immediately give you a glass. If it is an ENT specialist, he will tell you the nasal sputum has got a vent inside, the off center is what is creating problem, you have to do a surgery. Astrologer will tell you your Rahu is in a wrong place, you have to do this puja, that puja. I'm sure you are in a problem. It is like the elephant goes to drink water in the pond and the crocodile catches the elephant. That is why I think most of the people who don't understand what is exactly to be done. And what do? Purvajanmakritam papam vyadhirupena jayate. It's all because of your purva karma. See, when you read that purva karma, purva janma kritam papam vyadhirupena jayate. What is that? You have solution in the same mantra at the end somewhere. Kaniya anija papa ani janmandara krita anija tanidani vinashyan vipradakshana pade pade. Take a pradakshina. Why do you do Ayurveda for that? So when you get into something, you must understand it is the time and the space which matters. Your time, your space. It is all where are you taking birth, when are you taking birth. That is why we have the sun in the body structure, moon as Manakaraka, that determines. So understand the solutions has to be not island by island, connect all of them together, understand it. Morning, Dr. Gopi ji asked a question to the Dr. Ashokan from Baroda who made the presentation. it is, I'm 100% sure you must ban all the independent astrology predictors, because they are doing predictions without a prescription. You cannot go and test in your lab saying what is that you want to do. Understand the physical problem, where what is to be done. We have a beautiful, Nambudiri mentioned it very carefully, all the Shanti mantras. Om Dau Shanti, Antariksham Shanti, Prabhvish Shanti, Apash Shanti, Aushadaya Shanti, Manaspataya Shanti, Vishwodevo Shanti, Brahma Shanti, Sarvam Shanti, Shanti Deva Shanti Samaha, Shanti Devi, Om Shanti, Shanti, Shanti. When do you get this peace? The physical, divine, internal, external. Unless you have the system in which where you have everything in Shanti, and internal becomes Shuddha. Pranavana Vyano Dhana Samana Me Shuddhyandam Jyotiraham Viraja Vipatma Bhuya Sangaswaha Vatmana Chachu Swatragana Chipwaredo Buddhya Agriti Sangatma Me Shuddhyandam. If my buddhi is not Shuddhi, he becomes always diseased. He will only think about the bad things. It's all in your buddhi. So if you don't have a satsang, what beautiful way Nambudiri explained it. And you must have that. See, I remember when I was director in Academic Staff College in Calicut University, one chemistry professor came and asked me what research I can do related to Ayurveda. See, we have a lot of medicinal plants. If that medicinal plant is not planted in the right place and use it, it will give you a wrong effect. It is not every plant is to be planted in every garden which you have. In some places, something will grow good. It has got a high energy. And if you don't plant it in the right place, you will have bad energy. If you have a place where Tulsi is not growing, your vastu in that house is not good. How to rectify it? Make a lot of hibiscus plant around. So plant has got a great effect on healing the other plants. Vriksha Ayurvedam clearly explains it. I was lucky to study Vriksha Ayurvedam. If you have to understand Ayurveda, you must understand the plant science also. That plant science is to be understood from the Vriksha Ayurvedam. If the Shuddham is not there, how do you get that if you don't use the right thing at the right place? Amandramaksharam nasti, nasti moolamanaaushadam ayogya purusho nasti, yojagaha tatra durlabaha. Just now Nambudiri mentioned. How do you understand which plant is to be used in what context where, when, which pakam is to be used? You use a banana plant, the banana which you use raw, the effect is different. When the banana is ripe, the effect is different. The raw banana can be used for the propagation, loose motion, it will stop. But you use the ripe banana, it will create loose motion. What a great science is this, yeah? So if you don't understand Vriksha Ayurveda, the pakam, the age, when what is to be used, it cannot be used in the right sense. So Ayurveda, for the body healing system, it is fantastic. Ayurveda, which agrees with the yoga practices, as the manas controlling the body, which is essential to understand together. And that is what I mean by bridge. The Ashtanga Yoga, which has been twisted totally. And today what people are doing, create only diseases. It is not ultimate happiness. Patanjali did not show these Sirshasanam, Sarvanga Yoga and all that. All this has come into practice in 1920s when Mysore Maharaja wanted to show some show. If that is not understood, if you don't understand the history of the system what you are practicing, if you don't go into the root to learn the essence of what you are practicing, I say you are actually twisting the root and then creating only market around for your survival. I am sure that Yogacharya who says everything can be healed by Sarvanga Yoga, when he gets diseases, he goes to allopathy, the antibody. And that is why antibiotic, it is all against biotic, anti against it. They all work against the anti, against the body. And that is what you do. And you call it as Sadvrittha Acharya Rasayana. The Ayurveda prescribes exactly what Ashtanga Yoga prescribes. Sadvrittha Acharya Rasayana. Ayurveda says Ashtanga Yoga says yama, niyama, asana, pranayama, exactly matching. So where is the difference between yoga and Ayurveda? But I don't know why Ayurveda people did not realize the real essence of yoga to get into the Ashtanga Yoga practices, which is inbuilt in Ayurveda. It is not turned into physical exercise. That has to go. The basic knowledge in Ayurveda must be there if you want to be a yoga instructor. All the yoga instructors who are running studios and practices and daily morning massage centers along with Ayurveda, WWF, probably the gymnasium center with yoga, all of them have to be stopped because they don't understand the anatomy of the body. If they, I am sure the new education policy 2020, if India has to get into this real, genuine, pure science of treatment, everyone who practices this must get into the real Ayurveda knowledge. Ayurveda, Veda, Mantra, astrology, Indian Shastra, everything has to be clubbed and give a basic course. If that basic course is not given, I'm so happy when the avian warrior was talking about this education system which is to be changed. Otherwise, as in the keynote address, Krishna Kumarji wanted to have not as an alternate science. It is always an alternate science because we have not made the base clear. Create the base very specific. Otherwise, we are only marketing medicines, marketing only doctors, not marketing the science behind it. If you want to show that market the science behind it, don't sell the medicine which is in the shelf. Ayurveda never did it. Otherwise, today's Ayurveda doctors becomes only Yamaraja Sahodara. Vaidyaraja Namastubhyam, Yamaraja Sahodara. They are all Yamas Sahodara. Only difference, Yama will take the Yama Haratume Pranan. They will take the Pranan away. Vaidyam Dhananija. The doctor will give you a bill also after that. That's only the difference. I think that has to go. Otherwise, what will happen? One Thirumalai Krishnamacharya from Varanasi, when Mysore Raja met him, this Thirumalai Krishnamacharya was showing some circus. And he was brought into Mysore and clubbed with a lot of gymnastics personalities. Mysore Raja made a lot of asanas. And that person became this Iyengar's guru. Therefore, the Vyayama Deepika, which is available in the documented Mysore Palace, it is available. When you read that, you will understand all the 200 asanas were gymnastic asanas. And that is why today people do the Shirshasana. And we call Patanjali and say that Shirshasana was prescribed to Patanjali. Which Patanjali did it? If you don't understand, that is why we want theoretical knowledge. That is where I think the philosophy, the ICPR, the conferences like this has to get into the root. Understand what is there. If you don't get into the root, what will happen? See, it's a beautiful Paramananda, the Yogananda Paramahamsa, whose brother happens to be the Vishu Charan Ghosh. In 1923, he started a physical education college in Calcutta. He was one of the best gymnasian person. And that gymnastics is what is practiced by most of the Yogasana centers. I am sure when you wear a jetty and then do make practices in America in 1970s, beautifully people followed. And from there it again got marketed back in India. It is understandable. If you are a person who understood the basic science and then start a studio, which is a westernized practice, I have no objection into that. But then don't put the name of Patanjali. So if look at the science, it is not, we are not talking about 10,000 years or 1,000 years back. It is only 100 years back science most of the time. Therefore, if you don't get into the even pranayama, pranayamena yuktena sarvaroga samaraha, ayuktabhyasa yogena sarvaroga samudbhavaha. If you don't, the Pratipika says this. If the Yoga Pratipika, if you don't read that and then start using pranayama practices, most of the people become diseased because of bad pranayama practices. Sarvaroga samudbhavaha. Every disease will come to you. The breathing has to be like a Tailadhara breathing. But then somebody becomes a Sri just because they get into the breathing practices being sold for 3,000 rupees per nose. And you add yourself as some big names behind and suffix and prefix, and you keep saying that I am a Adhyatmika, I am a Chaitanya, I am a happy person. That all need to be certified by somebody, not by yourself. Beautifully said. It is your microbiotics and the macrobiotics. You are what you eat. Your practice of food, your practice of asanas, what is the sadhana kramam which you have, that creates you into that sort of a life. It is not body care, it is not manas care, it is a holistic life pattern which is to be practiced. If you don't do that, then we will have all the problems. That probably could be the cause. If you don't understand that and get into this pratna, the Ridambara pratna will not come. So, and what is to be practiced not when you take birth, 50% of our life determined by the birth itself. I'm so happy Dr. Gobiji always keep talking about the birth has to be good. 50% of my ability depends on my birth itself. That's why Bhagyavandam Prasuyatha Mashuram Maja Panditam Shurascha Vidyascha Vinesi Dandimandavaha. If that birth itself is not good, then the next one is your satsang. Your satsang will create you 40%. And 10% is what can be created and trained. And somebody believes that I can make a yogi just by making him practice for 10 years and he becomes a yogi. It is not true. It is not possible. It has to come from the womb itself, the birth itself. If that is what the yoga doesn't start from the life pattern when you become 40 years and from further onwards. It is before your birth itself. That is what the nature says. Look around, for every problem there is a solution given by God. I remember one of the practices when I was giving a lecture in the marketing strategy for insurance company. When somebody asked me in the morning when he was having nice coconut chutney, he was mentioning that this coconut is bad, coconut oil is bad. Why Kerala people don't have this problem? I said Kerala people uses coconut shell as the spoon, and this coconut shell which is mixed inside your curry actually is a solution for the cholesterol. You smash coconut shell and then put in water and drink that water. That was the water given to us in our childhood. We never had any other packaged drinking water. So when you need to have a color inside your water, that coconut shell is smashed and given. That's a beautiful medicine for your purification. So God has given a problem in your coconut. I'm sure the coconut shell gives you a solution. There is a solution for most of the problems which you have. If you don't understand that solution, if you don't have that vision to see the solution, I'm sure we are in dark. We are searching in dark. And therefore, it is essential to look around, understand what is that which prescribed by our life around us. Then we will be able to get into a beautiful life with 100% happiness. It is not the same Charaka Samhita explains what is the beautiful magic of learning and experimenting. Sakshat anubhava drushto na sruto na guru darshitaha lokanam upakaraya etat sarvam pratarshitam. What is science is not Shastram. Shastram is different and science is different. Scientific is different and Shastra Prakriti is different. So Ayurveda has got a Shastram. And that Shastram is not a modern science. You cannot threadwire experiment things. So what is to be done? Sakshat anubhava. You have to experience it. That experience is what is being talked about, a scientific analysis. If you do that Aushadha Prayogam and the health practices, I'm sure I am not quoting any of or chanting any of the mantras because all of them have been told. And what is happening if you don't do exercise, it is bad. If you do over exercise, it is much difficult. Adivyaya mamadakaso jvarashadishchajayade kridaya adhivaro Charaka Samhita. I'm not quoting from anywhere. It is Charaka himself said, don't overdo exercise. So which yoga which you are practicing which is going against Charaka's Ayurveda? The Sutrasthanam which exactly says you should not do over exercise. Is it not an over exercise for people to become upset down and then do all the monkey's job? There is a beautiful YouTube presentation which I have kept in my YouTube presentation. You look at it. It is not a monkey's job, which no Charaka explained, which is not in the Patanjali's explanation. Adivyayamamadakaso jwarashardischa jayate hridayaduparodascha. Even you can get a hridaya, no heart attack because of that. So you have to be very careful in practicing. Don't give the old name of India and then start practicing all that what is not understood perfectly well. You cannot stop these people marketing things if you don't teach them. So a licensed program, I'm sure the new education policy should look at it so that you will Heyam, Dukham, Managatam, the Sukham will come. Otherwise, Dukham will be present.
Respected Shishkumar sir.
Okay, sir. Okay. Okay, Shashimar sir. So you have wonderfully drawn our attention to very pertinent issues which normally people don't go into, because people are always in the periphery. They are all with half-baked knowledge, awareness, information. In the midst of all these day-to-day routine, they never want to go into depth. That is why, because all the Acharya says prior to your talk also, we should go to roots. Unless and otherwise we go to root, we are totally rootless. And all these problems are because of our modern mode of thinking, education, practices, etc., etc. We are thankful to you for bringing into limelight these essentialities to be taken care of in the contemporary life. Thank you, and we would like to invite Dr. Miss Sajida Sharma to make her. She has been waiting for a long time, and I understand that she is with us, and you may know that she is Yogacharya, and she has done a lot of work in this yoga, and she's an IT professional, IT consultant. But she is the founder director of Yoga Sarida, Center for Training and Research in Yoga, New Delhi. So that way, she has motivated large number of people, youths, to this yoga path, and that way she has been doing a lot of service in promoting yoga as a practical way of life. We invite you, Dr. Sarida Sharma. Because of time shortage, we hope that you may try to finish within 15 or 20 minutes maximum. Thank you. Yeah.
Thank you so much. And at the outset, I would like to thank Sir Professor Gopinath Pillaiji for inviting and giving me this opportunity to present my paper in front of esteemed group of professors and scholars from all over the world. I thank Santhigiri organization and ICPR for for organizing such kind of webinar, which is very apt for the given situation, current time. Also, my namaskar to all the distinguished audience present in the webinar. Although Gopinath sir has already introduced me, I am basically a software professional for 28 years. And I came to yoga because of some problem that normally a long serving computer professional get. It's because of my frozen shoulder and spine rigidity. And without taking any medicine, it took 6 months, but I cured myself by doing yoga in a center, Shivananda Center, where not only my physical, ailment, the physical problem disappeared. I started feeling so light, and my response to stress were different. So I just thought what it is like. I got so much interested in the science of yoga. I got certified in Yoga Vidya and did diploma. Then started my teaching. I started as a free yoga teacher in a community center, and then I established my yoga center because I knew I'm going to do this with this kind of training for whole of my life. So mostly my center is in Hatha Yoga and all the components of Hatha Yoga. So because we don't have much time, I will just introduce my paper. It is Yoga for Augmented Immunity Leading to Better Health. Although it's a long paper, but I'll try my best to finish it in time. So if we look at the WHO definition, the health they define is like health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This definition, to an extent, summarizes the philosophy of the Ashtanga Yoga given by says Patanjali in his Yoga Darshan. The Ashtanga Yoga is much more than what WHO could visualize actually for an overall health of the human being, because Ashtanga Yoga includes spiritual health and a different kind of blissfulness, which I don't think WHO could have visualized. And now if we see medically, if we visualize our health in terms of immune system, it is important to understand the immunity and its role in keeping our body healthy. So what is immunity? So first, we have to understand that so many learned people were presenting, or many have presented on immune system. So I will be defining it slightly elaborately to understand what is immune system. The immune system is body's defense against infections and other harmful invaders. A healthy immune system can defeat invading pathogens. Pathogens are bacteria, viruses, fungi, and so on. It is our body's own inbuilt defense mechanism. Crucially, immunity can distinguish between self-cell and the foreign cell. So it kills the foreign cell. If the immunity is in a healthy self, then it will kill only the foreign tissues. In the medical term, immunity is the natural or acquired capacity of body to defend itself against foreign substances such as bacteria, viruses, parasites, fungi, and toxins. The immune system is comprised of cells in this like skin, the cells that are there in the skin, white blood cells, bone marrows, tissues, antibodies, the lymphatic system, the spleen, and the thymus. These protect our body against potential harmful pathogens like bacteria and viruses and limit damages from the non-infectious agents like they go for cancer are not infectious, but they also protect us from cancer and sunburn like a kind of thing. With a weak immune system, one should constantly fall ill from bacteria and viruses present in the environment. So the disease can arise when what is foreign cannot be eliminated quickly enough or not at all from our body. Then what happens? It manifests itself through immune reactions. The reactions are in the form of inflammation. So the different body parts inflates and we get pain and we are uncomfortable. So if we define the immune system, there are three types of immune system. One is called innate. We are born with this system, and it is basically when we are born, it is a function of the bone marrow. So it recognizes the foreign substance and just kills it from the cells. Okay, and then we have acquired and passive immunity. The acquired or adaptive, also it is called, immunity is characterized by immunological memory because our immune system remembers previous enemies. So in the form of antibodies, it gets memories for immunology. So, and how it is done, like when we are exposed to disease naturally, we develop antibodies produced by the immune system, and this is called naturally acquired immunity. And second one is when we are vaccinated, and then we develop antibodies produced by our immune system itself. This is artificially induced acquired immunity. And this way, when we get adult, by that time, what happens? We have many types of antibodies stored. There is a big library of antibodies to different pathogens which are there in our system. So in adulthood, we normally don't fall ill so easily. And our immunity system is stronger because of these antibodies. Okay, the third type is passive immunity that can be transferred from an immunized host to a person who can receive it. This kind of, for example, a baby receives antibodies from the mother. Before the birth, it will be the placenta, and after the birth, it will be through the milk of mother. So now let's understand how immunity protects our health. Put simply, it's our immune system's job to defend our body against illness and diseases. So this requires constant supply of energy and nutrients to maintain this optimal function and performance. Normally, microbes first hits the layer of skin, epithelial layer of skin, and they are the first barrier for taking care of the anything entering foreign entering in our body. So after that, there are also mucous membranes are also there in our nasal passages and all. So they are physical barriers. And now the second is the main type of immune cells are white blood cells. There are two types of white cells, blood cells, lymphocytes and phagocytes. There are two types of lymphocytes, B cells and T cells. They are I won't go in detail. I will be finishing it faster. So they are basically destroy, they are all the time going to different organs through the lymphocytic tunnels, and they destroy the any foreign bodies that enters infected cells, and they don't let them multiply. The immune system has a collection of billions of cells that travel through the bloodstream. They move into the tissues, they move into the organs, and they come out of it. So in a way, they are like, a guard moving all around in the body to search for foreign bodies or cancerous cells. So the main thing is lymphatic system. It has got lymph and there is a lymphatic vessel. So nodes and vessel. So vessel is carrying the different the T cells and all to the different organs, where they just find the foreign bodies and kill them. And similarly, lymph nodes are small bean-shaped clumps of immune system cells that are connected by lymphatic vessels. They contain white blood cells that trap viruses, bacteria, and other invaders, including cancer cells. So this is how the blood cells and especially white blood cells protects our works in the immune system. Okay, so now there is another thing the thymus, the spleen. So thymus is present in the chest, which makes hormone called thymosin. This stimulates the growth of immune cells called T cells. They trigger it. These cells attack virus and infected viruses and just kill them, as I have already told. But as we age, these start weakening. And so when we reach age of 65, the thymus is not working. In a way, it is dead by that time, unless we do some good, have a good lifestyle and do the yoga and meditation and everything, to keep our vital energy up and going. So that way it can go for longer, but normal cases is 65. So basically what weakens our immunity. So as we said that toxins in the environment, in the food, if we take poor diet, then also it is attacking us, and through breathing, it enters. So, and apart from this, lack of exercises, so that our organs are not that healthy, and stress. If we build stress, we'll talk about that, how stress is very, very dangerous for immune system. Stress can be adversely affect the immune system of our body. So what are the warning signs where we can find out what if our immune system is compromised, like, it's not working properly? So it is like, when we start getting frequent infections like chronic sinus infections, ear, skin infections, sometimes we get bronchitis, pneumonia, and if it is happening in cycle, in many times a year, or we get nausea, diarrhea, loss of appetite, and this is also prolonged because there are other reasons also for these things. So we have to be very careful. But these are the signs which, if it is for longer period or happening many a times, you should see a doctor or some Ayurveda doctor or some yoga therapist to understand why it is happening to you. So, or you are constantly fatigued, like, all the time tired, you get a mild fever all the time, constant headaches, skin rashes are there, then you have arthritis, like a joint rheumatic arthritis, like, joint swelling and paining. Sometimes there is called alopecia areata. This is a patchy hair loss. Some, like, hair patches are coming out. So this way, what happens? The immune system attacking the hair follicles. So it is like, falling. If you have trouble swelling, and also if there is unexpected weight change because of damage to thyroid gland, and from an autoimmune disease, this can happen. We may get white patches on our body. This is maybe also like, immune system, faulty immune system attacking the skin pigment making cells. In internal organs, if you feel blood disorders like low platelet or iron and other mineral deficiency, delayed growth and development in children, gut toxins, like, your digestive tract is toxic, and wounds are not healing, and the major thing is when you have high stress level. So what happens? The high stress level has a very bad impact on the immune system if it is prolonged. If it becomes your habit to be stressful, I mean, this is what happens to people working in different shifts. Like, I had this problem. I was working in many time zones because of my software being deployed in different countries. So that makes all the time you are in stress. So prolonged stress has got a very bad impact on the the immunity. So when there is stress, there is a hormone called cortisol, which is secreted to stop the immune system to act, because at that time body is in fight or flight mode. So it is trying to respond to the stress. So at that time, the hormone stops the immune system from working. Just think, if this continues, then immune system will be compromised, and this is very logical. So if this keeps happening to the body, like, if the body is in the continuous stress situation, it decreases the body's lymphocytes, that is the white blood cells that help fight off infection. Solomon scientists findings showed that stress affected thymus-deprived leukocytes, that is called T cells, and play a role in cell-cell interaction. It was low. So High stress level can also cause arthritis, fibromyalgia, lupus, psoriasis, and many other problems. So the stress is a main reason for our immune system, a compromise in immune system. And also the toxins in our body, sometimes it is called 70 to 80%, it is called 70 to 80% problems are because of our gut toxins. So, I mean, we'll talk about the yogic practices which takes care of all these things. I'm sure it is there in Ayurveda also. So what are the causes for low immunity or immune system disorder? One thing could be like you are born with this. So that is called a primary immune deficiency because of your birth, your parents' genes, your ancestral genes, you are born with a weak immune system. Second could be you get a disease that weakens your immune system. This is called acquired immune deficiency. And third is have an immune system that is too active. So immune system is, how will you know that the immune system is too active? When you start getting many allergic reactions. So everything which is not bad is also taken as bad. So if you are born with certain genes, your immune system may react to substances in the environment that are normally harmless. Having an allergic reaction in those substances are allergens, and having an allergic reactions is the most common example of overactive immune system. So normally this reacts to dust, pollen, and foods. Some some people cannot take cashews. Some people cannot take gluten. So there are allergies to some food also. So they are because of the overactive immune system. Then we get asthma, that is because of dust and pollen, eczema, because of some itchy rash, some dermatitis or something like in our gaddas, in our chair and bed, they accumulate sometimes. And then sneezing, runny nose, you have allergic rhinitis. So you keep squeezing. Some people they get bout of sneezing, so that is also because of some hyperactive immune system. Then comes the autoimmune system. That is also very, very dangerous thing. So autoimmune system, the body attacks there. It has nothing to do with the outside something coming or not. Normal, most normal things are taken as taken as the foreign bodies to be thrown out. Here in autoimmune disease, what happens? The body's normal tissues are considered by fault in the immune system. It is considered as the foreign body, and it attacks on the normal healthy tissues. And this is called the this is also because of genes, and sometimes it is also triggered by environment. So 3 common autoimmune diseases that we must be hearing all the time is type 1 diabetes, rheumatoid arthritis, and lupus. So there are some immune problem happening because of some medicine. Some medicine we take, and sometimes we get the immunity problem. So it may be permanent, or it could be temporary. Like if you get chemotherapy and drugs for treating cancer, you get your hair falls, sometimes your teeth also. I mean, your skin goes bad. So these are all because the immune system gets compromised in this treatment. And also, for a brief time, you can have flu and measles. So these are the immune systems. When it is compromised, we get these systems. Smoking, alcohol, and poor nutrition. Already talked about diet. So that is also bad for our healthy immune system. And many of us must be knowing this AIDS, HIV, which HIV is compromised bad immune system where the AIDS develops, with that destroyed important white blood cells and weakens the immune system. So how to keep the immune system healthy? So this is like eating healthy diet with vitamin like A, C, E, B2, B6. C is very important for the immunity. And it is the reason, it is the source for developing white blood cells. And also some some minerals like iron and zinc, they are selenium, they are very, very important for the immunity system.
So would you summarize into 3 minutes? Would you summarize in 2 minutes there?
Sir, sir, I'll take some more minutes. It's very
because
okay.
One more.
Yeah, I will go fast, but I have to talk about how to use yoga.
Yeah, please immediately. Okay, do it.
Okay. So apart from diet, enough sleep, managing stress, immune system is bad in old age. So you should be eating variety of diets during the old age, and your vaccines should be taken in time. And then finally, and most important, is to create your healthy lifestyle. Don't smoke. So that is also very important. So now, as yoga is the an ancient Indian culture where physical, mental, and spiritual it's used for spiritual, physical, mental, and spiritual development. It is very, very important for immune system health also. Ashtanga Yoga defines 8 limbs that we all know: Yam, Niyam, Asan, Pranayam, Pratyahar, Dharana, and Dhyana, and Samadhi. So 5 of them are Bahirang Yoga, 5 till Pratyahara are Bahirang Yoga. From Dharana, Dhyana, Samadhi, it is Antarang Yoga, and it is for the inner peace and blissfulness. So Bahirang Yoga is also very, very, it is something that we can practice. And this is we should practice as everyday lifestyle. Okay, so Yama helps in following our society and environmental helping. It's Yama helps us in peaceful coexistence with our society and environment, helping to reduce stress. Similarly, Niyama can be the rule on yourselves, how to keep yourself clean in and out, and do your tapa, do your everyday life work, karma, in a way so that you achieve your goal in time. Similarly, asanas are very good for health of the physical body. And also it leads to the pranic body and the mansic body. So it is good for mind as well. So there are Dharana, Dhyana, Samadhi that comes in the meditation and Raja Yoga. So effect of yoga is we can, although there are not many research in this area, but because of experience and observation, this has been found that it reduces stress, depression, and anxiety. And also it keeps our happy hormone up. It improves immunity, also sleep improvement. So everything that is important for the good immune system, the yoga practices are good for that. So it is for allergy, asthma, there are many asanas which are good for controlling asthma. It also reduces muscle tension, mind stress, everything. And it also slows the aging process. Research has shown that mindfulness meditation are good for immune functions, reduced blood pressure, and enhanced cognitive function. meditation techniques can improve our mood, calm our mind, and help relax us. So this is basically the baseline for the good immune system. So for the stress management, our heart rate comes down when we meditate. Our blood pressure is normalized. Oxygen is more, it's used more efficiently. And of course, the mind gets clearer and creatively increases its, okay. So then comes the Hatha Yoga. Hatha Yoga includes asan, pranayam, shatkarma, mudra, bandh. So basically, because we don't have time, I'll just say that there are asanas which are have different effects. Certain yoga position can help support balance and boost the immune system. And like Vipreet Karni, fish pose, Matsyasana, Sukhasana, they are very good for just keeping the immune system up and running. And Balasana, Paschimottanasana, Anand Balasana, Uttanasana, they are very good asanas. I'm going very fast. Then other than this, the pranayam.
Please summarize. Please summarize. Yeah. Please summarize. Yeah.
Yeah.
1 or 2 minutes, please.
Okay. So it relieves asthma also. There are many asanas. Apart from this, we have Shatkarma, where we have Dhoti, Basti, Neti, Noli. They are for Noli, Kapalbhati, and Trataka. They are all for cleansing inside of our body and mind. Then there are bandhas to make us strong. There are mudras, which are done on the fingers. So finally, what there are each finger in our hand represents in 5 elements. So these 5 elements controlling them is keeps a balance in our body organs and mind. Finally, yoga, we can say that yoga is a great practice to lower the stress hormones in our body. Stress is one of the biggest factors for weakening immune system. Although the absence of vast researches in yoga field so far is not there. So, but because of the observation and experiences, this is it has been found that yoga is very, very good for in terms of immune health. So I'll just end here because there is no time and I had prepared for a longer presentation. So I could have gone in details, but yes, the main thing is there are not many detailed researches in the yoga field. So we should be doing many researches to see the effect of yoga on something that is not tangible, intangible things like stress, depression, anxiety, and immunity. So thank you very much for giving me the time to present, and thank you so much for inviting me.
Thank you, Mr. Sarida Sharma. And we will have one day full program on yoga and other things. And now, because you have grounding on immunity, you have very wonderfully detailed explained how yoga can boost and protect our immune system. And this is very much enriching and enlightening. Thank you. So our principal is waiting for.
I'm so sorry. Thank you. I'm sorry for that.
No, it doesn't matter. Hope our concerned colleagues will introduce our principal. He is the moving spirit behind all the conference, and he's a very, enchanting personality. And I hope that others will introduce. He is known to all. He is such a wonderful personality, quite accommodative. Let others introduce the principal. Thank you.
To present the next session, we invite Dr. G. Nagabhushanam, Principal, Santhigiri Ayurveda Medical College, Palakkad, Kerala, about the challenges in mental health care and solutions in Ayurveda. We welcome you, sir.
I think I am audible, isn't it?
Yeah, audible, sir.
Yes, sir.
Audible.
Yes, sir.
Yes, sir. Slides also visible, isn't it? My screen is being
Yes, sir.
presented.
Visible, sir.
Okay, thank you. Om idam namah gurubhyah purvajebhyah purvebhyah pathikrudbyah. Pranams to all. Great legends are participating in this program, and I also got an opportunity to be part of this program. And in front of lotus feet of Guru, prostrating, let me start my presentation. And today's my presentation is changes in mental health care and the solutions in Ayurveda. In this session, I am going to talk on what is health, not in detail. Already many of the scholars talked on it, and what is mental health, particularly the challenges that we are facing and the possible solutions in Ayurveda. Of course, in this one also, I'm not going in depth. I wanted to present some, generate some awareness on the possible solutions in Ayurveda. We know very well, but WHO defined health. Health is a state of complex, complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. We know very well. That's why I'm not going to give any descriptions on that one. Next comes to the what is actually the mental health. WHO defines, and I think it is also one of the comprehensive definition given by WHO. If we understand in even Indian thoughts also, that is a state of well-being in which every individual realizes his or her own potential, can cope with the normal stress of life, can work productively and fruitfully, and is able to make a contribution to his or her community. I think it is very comprehensive, because that is realizing one's own potential. Of course, if we do commentary on that one, even if we, I don't know whether WHO thought of it or not, but we can comment even up to the Vedanta. And realizing our own self, that is the potential of all the beings, all the living beings, and can cope with the normal stress of life, because life is always stressful, because to sail in the time processes, and it is always there will be some stress, and to cope up these normal stress, we should have minimum mental capability, and can work productively and fruitfully. In these circumstances, in our day-to-day life, we have to work fruitfully and also able to make a contribution to his or her community. That's why I said it is one of the comprehensive definition. And when it comes to Ayurveda, that is Swastha, Sattva, and Prajna. Many scholars talked on it. We know very well what is Swastha. Swastha itself is, the word itself is Swastha, that is being in one's self. And the Swastha and Sattva are both very much related. Wherever there is Sattva in its normal normalcy, then only the Swastha can be maintained. And these are interrelated. And when this interrelation is harmonious, then only there exists Prajna. Prajna is a state, already Shashkumar sir explained it. Even he went beyond this Prajna and told Ritambara Prajna. And we know it, that is on the background of Satvika Manas, when the Dhriti Smriti are properly functioning, then only the Prajna can be possible. And for a normal persons who are living, for them, this Swastha, good Sattva is essential for Swastha, and good Swastha is essential for maintaining Sattva. But those who are realized personalities are there, for them these physical elements are not going to cause anything. So here what I said, Swastha and Sattva, the relation, only those persons who are still sadhakas. And what are the components of mental health? The three components are there: emotional well-being, psychological well-being, and social well-being. In this emotional well-being, that is how you feel yourself, example, interest in life, happiness, satisfaction, etc. And psychological well-being, how you think and react to yourself. like liking personality someone is having, good relations with others, being satisfied of our own life, managing responsibilities to daily life. And third component is social well-being, that is how you interact with outer world, where positive functioning, feeling part of community, able to contribute to society, all these factors come there. And I'm going to present some of the facts on mental health at presently we are having and going to have in near future. As per the WHO and World Economic Forum, it says mental diseases accounted for 13% of global disease burden. Of this, one third is due to the depression alone, and it is going to be the major contributor by 2030. And in terms of disability component, mental disorders account for 25 to 34% of all years lived with a disability. And when we measure it in terms of economic output due to these mental disorders, we are going to lose some 16 trillion US dollars by 2030. And some other factors, that is how much we are, so the condition is very grave, but how much we are putting our efforts from our side. It says that less than 2% of total budget on health for mental health is spent for it. And out of this less than 2% of total budget, 80% is spent for only mental hospitals. Mental hospitals are only tertiary centers, and very few patients get these services. At a grassroots level, primary, secondary level, only less than 20% of the that budget on is spent. So these are some of the policy matters, and I am not going into the depth of these policy matters. And other challenges are stigmatization, that is due to the lack of information, education, and communication among the common persons, people. There is stigmatization is there. When there is stigma, naturally what happens, those who have to seek the services, they won't come forward, and there will be problems in the society in a hidden condition. And the second one is expansion of services. We know health services are limited, and particularly this in mental health services, they are limited to only the hospitals, that to city areas. At the rural areas, it is not so far not reached. And third one is efficient use of scarce resources in promoting mental well-being, because we have very few persons available to manage, and they are also centered at somewhere. And next one is prevention of mental diseases, and it is a very big problem, because so far the contemporary science hasn't understood the root cause of all these mental disorders, how and when, how, what of these mental disorders. And whatever there is, contributing sciences are there, Indian sciences are there, they are neglected. And the last one is protecting rights of people suffering from mental diseases. It is one of the grave condition. And though there are some from government, there are some policies, there are some orders, but they are not being implemented properly. That's why there is violation of rights of the people suffering from mental disorders. And the last one, what I out of my experience, what I found is that is clinical understanding of mental disorders and practice, particularly compliance to the modern medication, because due to the many lacunas in understanding these mental disorders in a contemporary modern system, those who are taking this modern medication, they themselves come to the Ayurveda and yoga, they want to get rid of those medications, not the disease. They may be suffering from the disease, but the side effects of those medications are so grave that due to the extrapyramidal symptoms, etc., they want to get rid of these medications. So, and how we can help them, such type of persons, that is one of the great challenge in front of us. And in India, it is depression and anxiety disorders are the most, and it is predicted that 20% rise in between 2013 to 2025. And as a normal, lack of effective surveillance programs are there, understanding local context, because whatever the models we are having, these models and these protocols are related to some other countries, and we are adopting into our own society, and our society is something different, and we need something, and our workforce is different, our local needs are different, and but we are unable to adapt ourselves to the local needs. That is one of the problem in India. And early identification, effective treatment, and prevention, these are the challenges in India we are facing. And coming to the latest context, that is problems in a new age society, undue stress at all levels, like physical, social, financial, technological, psychological, wherever. Though we say that we are in a global era, we are progressing. Where we are progressing, we don't know, because the disorders, the whether it is physical or whatever types of many problems are there. Though physically it seems we are very comfortable, in society we are seeing that there are many suicides. Even the very rich persons are they themselves committing suicides. So there is some problem, and natural and man-made disorders, like whatever in Kerala, and recently there was flooding, and every year there is something natural calamity, and we cannot blame nature as such, because whatever nature is giving, whatever nature is reacting, it is due to the our own deeds, that is man-made disorders. I don't know, because even in this COVID pandemic, of course, all these are man-made disorders. And the most important one is terrorism and insecurity to children, women, elderly, and minority. And these are very grave conditions which are affecting on our psyche, because whether you are in home, otherwise out of the home, these are going to create very great and grave conditions, pathological conditions in our mind. Okay, and these are some of the. Now I'm going to concentrate on a clinical perspective. What are the challenges that we are having? The main problem is this modern medicine it is depending, its theories target biology, and its target is a minimum understanding of our bodily functions, and at a particular neurotransmitter, otherwise particular pathway it is targeting, because all major psychiatric disorders are heterogeneous in nature, and they are triggered by a complex pattern of genetic, epigenetic, developmental, and environmental. So unless until we understand all these factors, that is genetic, epigenetic, I think in understanding these epigenetic factors, it is Ayurveda and Indian sciences are more relevant than any other sciences. Okay, so it may be unreasonable to expect any drug that manipulates an individual neurotransmitter system to impact the complex pathological human brain to the point of delivering robust clinical effects. So in this area, only Ayurveda and yoga, our Indian sciences, darshanas, philosophy can do a lot. Because one of the example I can present here, that is in depression, in addition to correction of mood component, there are many other management demands, that is anxiety, insomnia, circadian desynchronization, cognitive impairment, motor retardation, pain, and sexual dysfunction. But whenever one patient goes to any psychiatrist with a problem of something, depression or something, he will be giving antidepressant, otherwise some mood stabilizers. But what about all these things that a patient is suffering from? There is no answer. Okay, and you see, current disease classification is not biological but symptom based, without a uniform presentation in space and time. That classification itself is having some lacuna. That's why if you give a person suffering from schizophrenia antipsychotics, there are other things which we have to understand, but we are unable, present psychiatry is not going to give any answer. And artificial grouping of heterogeneous syndromes with a different pathophysiological mechanisms into one disorder is not going to solve the problem. And we have to evolve from single disease entity to multiple domain pathology, as Ayurveda suggests. And treatment algorithm that can engage multi-targets has a better chance of showing efficacy in these complex disorders. This is one of the findings of modern scientists itself. And strengthening pharmacogenic research to facilitate personalized healthcare in psychiatry in order to maximize efficacy and minimize adverse effects and reduce trial and error prescribing. It is very vital sentence what I read. That is personalized healthcare in psychiatry. Such concept is not there in modern science because it works on some outside bacteria, virus, etc., and targets those things. Otherwise, if at all they understand any metabolism in our body, also it is also very limited. Whether it is brain or whatever the organ that we take, the potential of that organ is not so far fully understood. That's why personalized healthcare in psychiatry, what Ayurveda says, dosham dusham balam kalam prakriti manalam vayaha. So all the aspects of in Dashavidha Pariksha, all the aspects of a single person who is suffering from disease has to be have to be understood in order to maximize efficacy and also minimize adverse effects and reduce trial and error prescription. Because it is happening many times. Whenever patient first goes, they will be prescribing something. Next time, what is what patient shows after like that, many things are getting trial and error method practicing is there. And most psychiatric diseases are cured by a combination of genetic and environmental factors and their interaction. So this subject has to be understood in depth. And in this phenomena, in this case, what Ayurveda can do, whether Ayurveda we will see, that is the potential of Ayurveda. Ayurveda is comprehensive, holistic, and whole in understanding human being. That's why it is not my statement. Ayurveda's Acharya says that it is the Shashvataha. It is not just by a mere statement. Why it is Shashvata? In Sushruta Susatana, he explains very beautifully, because Ayurveda Acharyas understood the basic structure function of this universe in which we are existing, that is Andanda and Pindanda, and the same phenomena is there in our mind, body, and in depth also. So unless until we, that's why whatever the principles they understood, they are in synchronization with the environment in which we are living. That's why those principles are going to be eternal, because unless until this loka exists, till the time, these principles of Ayurveda are going to be there. That's why Ayurveda is having every answer for whatever the sufferings we are having, because the ultimate aim of Ayurveda is swastharakshanam atarasya vikara prashamanam. That's why shashvato nirdishyate anaditvat swabhava samsiddhi lakshanatvat bhava swabhava nityatvacha. I have no time. Otherwise, these are the beautiful sentences, statements from acharyas who are aptas. Aptas in the sense they are unbiased. They have no personal interest, nothing. They are unbiased. That's why whatever their statements are there, they are having some, not some, it is a reality. Okay. And driving principle of well-being of all beings and unbiased perceptors, and it served in the past, and available literature and documented clinical data dates back to some 5,000 years back, and still it is serving those principles of Ayurveda, and definitely it will serve to our needs in future also. And but I can if you ask me, then why all these problems are there, healthcare problems are there, why Ayurveda is unable to solve these problems? What I say is, theories and models are available, but we need the methodology to research and retest to understand in present terms. You know what we are lacking, because complete Ayurveda sense in depth we are unable to understand, because our educational reforms are like that, our system is like that. We have to get reforms in that one. One of the best example to say is the sevenfold classification of Sushrutacharya. You see how comprehensive that classification is there. Whatever the problems were there in the past and present, in future, definitely somewhere we can arrange that problem. So it is very comprehensive. You go through it in Sutrasana Sushya Samhita 24th chapter. It is described there. Okay. And mind and body are interdependent. I am not going in depth. Saptamatma Shariram Cha Trayameta Tridandavat. And they are paraspara. They are interdependent. And for mental well-being, other things are there, that is in Dharaniya Vegas, that is Kaika, Vachika, Manasika. It is not just only physical deeds, Kaika, Vachika, Manasika, they are having. That's why in Dharaniya Vegas, what Acharya says, we have to channelize them. It is not like by saying Dharaniya Vega, you have to suppress them. It is not suppressive, but we have to positively channelize them in order to get rid of that stress inside our mind. Right? And preventive measures like Sadvruta and Achara Rasayana, Arthi Madam told. And in Sadvruta also, it is very beautifully explained what to be done, what not to be done, and related to Kaika, Vachika, and Manasika again. That the three types of deeds, how we have to maintain this Sadvruta. Details are there. If we could able to understand them and practice in our own life and preach others to practice, then definitely whatever the mental disorders, unhealthy conditions are there, can be solved. You see, in Ayurveda, there is exclusive chapter on psychiatry, in which the etiological factors are described related to inappropriate food and social behavior, emotional disturbance, and physical behavior. Viruddha dushta shuchubhojanani, pradharshanam deva gurudvijanam, unmada hetu bhayharsha purvo, manobhigato, vishamasya chesta. So it is very comprehensive. The etiology factors described itself is very comprehensive. And those factors are classified into Nija and Agantu. Nija means our own metabolic changes. And Agantu are some external factors as well as our own psychological factors, which result in some pathological conditions. And when it comes to the management, there are preventive as well as curative measures are there. And Ayurveda, this is one disease. If, for example, one suffering from any one disease, there is for example, I say someone is suffering from Paithika disorder. Paithika disorder means we may have to do some Shodhana therapy, and later when the doshas are getting Shamana, and later we have to do many things. Avasthika chikitsa, we say. It is not like that for one disease, one medicine is there. It is not like that. Even one disease, there are many avasthas, many clinical conditions are there. As per that clinical condition, we have to give the treatment, manage the patient. That's why Ayurveda says pharmacological, behavioral, and socio-cultural measures. That is Yukti Vipashaya, Daiva Vipashaya Chikitsa, and Sattva Vajaya Chikitsa. Ayurveda never says that whatever in Ayurveda it is not described, you should not follow them, because there are many things. Ayurveda is having its own scope, though those Maharshis are beyond that scope, but Ayurveda is having its own scope, and in that scope itself, whatever the basic principles are there, they are described. If some like karmaja doshas are there, in karmaja vyadhis are there, in that case, we have to approach some other healers who are experts in their own field. So there, that's why I beyond the scope of this tridoshas and the Yukti Vipashaya, Sattva Vajaya Chikitsa, beyond also some management principles are there, we can apply. That broad-minded concepts are there in Ayurveda. Another example is modern diagnosis and Ayurvedic diagnosis. You see, Unmada definition, Unmada Puraha Mano Buddhi Sangnyagnana Smruti Bhakti Shila Chesta Achara Vibhramam Vidyat. So these 8 factors we have to understand before diagnosing any Unmada patient, that is psychiatric patient. For example, if any patient diagnosed with mania comes in front of me, I have to think whether it is Paitikon Vatajonmada, Daitegrahonmada, Yakshagrahonmada, Brahmarakshasa Rakshasa Nishada Grahonmada, Gandharva Grahonmada. For me, it is not just mania. Depending upon the etiological factors, the presentation of the symptomatology. So I have to diagnose this much very pinpointedly what is the cause and what is the symptoms and how we can manage. So Ayurveda is, that's why I said it is holistic. It imbibes everything, sociological, psychological, physical, physiological. So Ayurvedic psychiatry is not brain-centric. Still, it has importance. Example, like in Trimarmiya, it is very beautifully described. And when that is Hrudindriya Shira Koste Samshuddheva Manadibihi. So by giving treatment in psychiatric conditions, what Acharya says is this is not going to affect just brain or shiras. What he says is Hridindriya Shira Koste Samshuddheva Manadvihi Manaprasadam Apnoti, etc. etc. So this understanding is very holistic and in depth. In modern, what we are going to coin new words like psycho neuro immunology, psycho neuro immuno endocrinology, psycho neuro immuno endocrino cardio pulmonology. Like you may have to add another very systems to it. Otherwise, it going to be incomplete, it seems. And another one best example I'll present: neurotic and somatoform disorders. If someone goes to somatoform with somatoform disorders in front of a psychiatrist, they say they do many examinations and laboratory tests. They say you have no disease at all. Then patient is suffering. So understanding that patient in patient's circumstances, we have to evolve a lot, and we have to get the help of Ayurveda and our Indian sciences. That's why psychosomatic, another example is psychosomatic disorders. Ayurveda says if you do Padabhyanga, your vision is protected. What is the relation? Where is the physiology? If you apply something onto your eyes, mucosa, your liver problems is getting solved. So whatever the physiology that we understood so far, it is not sufficient to understand the human biology. And in yesterday also such presentations were there. Another example I say, like Kalyana Ghrita, which is described in psychiatric chapter, that is Unmada. Its indications are very far, very great range are there. Apart from psychiatric conditions, fever spectrum, soft tissue inflammation, neurological conditions, metabolic disorders, poisonous conditions, and it is good for progeny and bhutaja and many more conditions it is indicated. Like, so they are interrelated. Psychosomo, and these are interrelated. And whatever the treatment, whatever the management that we are getting, it should be holistic. For another example, Panchagavya, which is described in Apasmara, that is epileptic conditions. It is also indicated of fever, spectrum disorders, liver disorders. Another example is Tiktaka, which is described in Kushta, that is skin disorders, but it is also indicated for liver disorders, and also in Unmada. And Nilinyadhikrita, which is in Gulma, described, also indicated in Unmada. So the scope and the understanding, it is very wide. That's why whatever the problems today we are having, all these problems can be solved unless until we understand our own biology. And to understand this biology, this laboratory, otherwise any rat or pig or something like those examinations and those findings are not going to solve. We have to think ourselves what we are made up of, what our own problems are there. And to do that one, we should not be biased in our thinking. And our understanding of Ayurveda should be in depth. And for that one, we have to, that is, there are many challenges in maintaining mental well-being. And some are policy matters of governments, policymakers, and some are of science. And government has to take up those policy matters. And whatever the scientific defects are there, they have to be rectified with the help of the available sciences. And there should not be any bias. There should not be any stigma. Otherwise, there will be problems. And Ayurveda is total in its human understanding. Even the same principles of management are applicable other animals and plants. That is, Ashwa Ayurveda is, Gaja Ayurveda is there, Vriksha Ayurveda is there. The same Vata Pitta Kapha principles, the same principles are, we are able to apply even those other animate conditions also. And comprehensive Ayurvedic principles can be the ambrosia in maintaining the mental health. For this one, what we need is pure heart and clear mind. Unless until we have these two things, we cannot understand Ayurveda, we cannot understand ourselves, we cannot understand others. I think by the grace of all those preceptors, we will be able to reach, if not today, tomorrow, by conducting such type of webinars and discussions among the realized personalities, we will gain. And praying for those things, and thanking everyone, thanking all the listeners, viewers, my well wishes, let me conclude my words. Om Namah Shivaya. Sarve Bhadrani Pashyantu. Ma Kasyid Dukkha Bhag Bhavet. Om Namah Shivaya. Sadguru Sharanam.
Dr. Nagabhushan, you
Sir.
have given us a lot of insights into the various dimensions of mental health, because this mental health is a very greatest, one of the greatest challenges that modern man is facing. So at this juncture, such a comprehensive and very insightful and intuitive presentation, because a layman like me, we don't know much about, so this much depth and vastness is there embedded in Ayurveda science in approaching mental health, because it is going to be one of the greatest future challenges in our medical science. Therefore, we feel that if we expand or do more research in this area, I hope that Ayurveda can contribute, offer a great opening, a great solution to modern man. So it's a very wonderful. Thank you on my behalf and Santhigiri Research Foundation, Santhigiri Ashram, and so much thankful for your this because really it was highly illuminating, Professor Dr. Nagabhushan. So your students will appreciate you, wish you.
Thank you. Thank you, sir. Thank you all.
Thank you, sir. Mental health has a great role in building a strong nation. Thank you, sir, for enlightening us with the challenges as well as their effective remedies regarding mental health in Ayurveda. Thank you, sir.
Thank you.
With this, we have come to the end of the session. We thank all the delegates and speakers for sharing your valuable time and knowledge with us. We are indeed so pleased to have eminent persons from different parts of the world. Our next session will be commencing at 5:30 p.m. sharply. Renowned speakers including Geo Long Lee, Dr. M. Srinivasalu, Dr. Ram Manohar, and Professor Sumanapala Galmangoda will be joining with us with interesting topic. We expect the active participation of all of you. Thank you. Thank you all.
We welcome you, sir.
to
We welcome you, sir.
Acharya
जो जवान होगा।
Hello.
The sessions will begin at 5:30. So during that free time, we'll be playing the song.
Karma
Srinivasan sir, namaste sir.
Hello.
Sir, namaste sir. Welcome sir.
Namaste. Namaste. Right.
Exactly, we'll start at 5:30 sir.
Okay. The session will be of a Korean speaker or mine?
Yours sir.
Mine.
5:30. We'll have your session at 5:30 sir.
Okay.
Okay sir. Welcome sir.
Right. Thank you.
Good evening, all. Welcome to Pratna, the International Webinar on Ayurveda and Yoga, the role in addressing the emerging healthcare challenges, organized by Santhigiri Ayurveda Medical College, Palakkad, and Santhigiri Research Foundation, Thiruvananthapuram, in collaboration with the Indian Council of Philosophical Research, New Delhi, Universal Veda Research Institute, Thiruvannamalai, and Nagananda International Institute of Buddhist Studies, Colombo, Sri Lanka. Once again, we welcome you all to this webinar. The session will commence shortly. Let's have a brief look on today's sessions. We have Dr. M. Srinivasu on the topic, Concept of Karma in Managing Healthcare Challenges, followed by Dr. Rama about the Gaya Bhojam, its contemporary relevance in the light of Ayurveda and Yoga, followed by Professor Sunapala Galmangola on Ayurveda and Yoga challenges ahead, followed by Professor Gopinathan Pillai, Nana Ayurveda Dharma and alternative narrative on Ayurveda. Professor Rajesh Nair about emerging diseases and plurality of medical systems perspective, followed by Sri Nardan Manon about self-living, Guru, and finally, Guru has you about COVID as a catalyst for global health. And we have validatory function at 9 a.m. sharply.
Hello? Hello? Hello?
Sir, Srinivasu, sir.
Am I audible?
Yes, sir. You are audible, sir.
Okay.
And yes, sir. You try, sir. Your screen sharing.
Yes, screen sharing.
Sir, you open your PPT. You keep open your PPT.
Yes, it is already open. It's open.
Open. Then present now. It is there one present now button.
Yeah.
Just you click it, sir, and you will get full screen. That option is there.
Yes.
Yes, and now you minimize this Google Meet.
Okay.
Gautam?
No.
Gautam? Gautam, are you there?
Yes, sir.
Just assist, sir.
Okay. I'm trying.
Sir, please click on that present now, your entire screen.
Yes, that already done.
Okay, sir. Sir, it's not presenting. Yeah, it's now presenting.
Yeah.
So now minimize that Explorer. Chrome tab. Yes, sir, minimize that. Yeah.
Now, okay.
Yes, sir.
Now,
Yes, sir.
now you can click on that full screen button. The fourth button on the top left.
Slideshow, sir. Slideshow.
So slideshow is
So top left, there is a button. Sir.
Yes. Yeah. Now. Okay.
No, are you able to see? But my
Yes,
picture
sir, yes,
is not available.
It's there, sir.
You are there, sir. You will be viewing your screen, this PPT screen only.
But my picture is not visible to me.
Yes, sir. You are visible to us.
But I have to see my picture. Okay. Hello.
Yes, sir.
But in the screen, my photo should be visible to me. I am speaking this.
You are visible, sir, and audible. You can go ahead. And
my picture will be displayed at the corner, isn't it? Generally,
in Google Meet it is not there, sir.
Oh, okay.
In Google Meet it is not there. And as platform changes,
that I am seeing just like okay. Hello.
Sir. And it is a great pleasure for me also. Dr. Marri Srinivasu, sir. He was also guru for me during my UG days at Hyderabad. And whatever the basic principles of Ayurveda I am having, it is due to his blessings only. Okay? On this great occasion, it is a great satisfaction to see my guru in this platform, and wholeheartedly on behalf of everyone, I welcome you, sir, Srinivasan sir, and sir, you can continue, sir. We can start.
Okay. Okay. Thank you, Mr. Principal. And I'm very much thankful to this giving this opportunity for the Santhigiri Research Foundation and Santhigiri Ayurvedic Medical College, University Veda Research Institute, and Nagananda International Institute of Buddhist Studies, Colombo. Thank you for all the viewers also for viewing me on this occasion. So today my topic is the concept of pharma in managing healthcare challenges. So the topic given by the webinar is the healthcare challenges, but how to manage them with the concept of pharma available. I am mostly a clinician, and more about the concept of in the Ayachikicha aspect. Okay. So as everybody knows it, Ayurveda at a glance. Just I am giving for a few minutes regarding the Ayurveda, and then I will jump into my topic. So everybody knows Ayurveda is a science of life. It is not only for the to treat the disease, it is for the swasthya and as well as for roga, for the comfort as well as for the discomfort. But unfortunately, today what we are looking in this world, Ayurveda is treated as an herbal drug medicine or a herbal treatment, especially evolved in Indian subcontinent. In the Tibet, some with some name, in the Arab countries with the Indonesian, some names, and some other countries. But where everybody is confining the Ayurveda as a herbal drugs. So this is very unfortunate thing. But actually, the Ayurveda is not only herbal drug. Anybody gives in the herbal drug by any tribal or anybody anything. So that is not to be think as an it is an Ayurveda. Ayurveda is totally based on the Dosha Dhatu Mala theory. It is totally forgotten by everything. So first, we must be able to see Ayurveda is a system based on Dosha Dhatu Mala theory and Rasagunya Vidya Vipaka and Prabhava theory. This to be applied to understand the health, disease, and the treatment. In all the three aspects, these plays a vital role. We need not confine to the only plants or herbals or something. So that is the main mistake. So many of our physicians and even the external world also, they think Ayurveda means only herbal drugs. So that is not the case. But for that purpose only, a institutional trained doctor or the Ayurvedic physician is competent to understand all the things and he will administer the drug. So the basic concept here is health based on balance of Tridoshas, Saptadhatus, and Trimalas. So these should be normal conditions, just like as we are seeing in the modern laboratory investigations. So like these are the normal values. Heart rate should be 72, respiration should be 18 or 20, like that, everything normal. So Ayurveda purpose to calculate everything, either the health or the disease, Tridoshas, Saptadhatus, and Trimalas, these are to be enumerated. If imbalance of these three occurs, the condition is known as a disease. If everything is normal, so that is called. So basically, let us go to the Ayurveda. What are the modern things? Are there the biochemistry, biophysics, and all other things? So Ayurvedic basic elements are Panchamahabhutas. Though there may be 107 or 111, whatever may be enumerated by the present world, so everything should come under the categorization of the Panchamahabhutas only. So basically, Panchamahabhutas are the ultimate, so which includes all the classifications existing in the world and various systems, whatever they say. So it is a Panchamahabhuta moieties is basically. And basing on the Panchamahabhuta, this one, so we are having a Vimshati Gunas and the Rasas. These are the biophysical and these are the biochemical properties when we analyze. So these can be not only looking our imagination, we can show in the laboratory, we can show in every aspect. For example, a Prithvi component is more in the body. So certainly the serum calcium, what we are calculating. If Agni component is there, the serum copper will be increased. Serum potassium will be like that. We can interpret because this is not the time to explain all this thing in the conference. Just only part of introduction I am telling. So basically, the Ayurvedic concept, first, the three doshas are main. So what are the main physiological functions of these three? So Vata is enumerated body physiology, which looks after and manages. These are the only three factors. Actually, what they have done in the ancient seers, they have taken a one management. The body is there. To manage the body, there are certain things are required. So to manage entire the body, the Vata is the physiology, and the Pitta, metabolic all metabolic activities are looked by this one, and the Kapha, where the structural aspects of the body is tested. So actually, whether it is perceptible or imperceptible. So Britishers given is a humoral theory, but actually it is not any humoral theory. These are not all are not liquids, even water. So they are only imperceptible to our senses, but still forms the matter, and it is a conscious matter that makes up the body. So even we can analyze, even present day cell theory also, there are the things which we can analyze the three doshas in a nutshell. Because this is not my concern, just I am giving a glimpse for you. So you look after the cell, how it works. So the mitochondria, nucleus, protein, sequence, and various chloroplast and various items are shown in the cell. It is all are looking. But who is holding all these things? So that is the kapha. That is called, the definition of the kapha is also called as shleshma. Shlesha alingane. Shlesha alingane means holding together. All the factors are holding together. Whom it is holding? It is holded by the shleshma. That is called a kapha. This kapha is the one of the main important points. So this entire cellulose, this entire cytoplasmic matter is concerned with the kapha. So who is giving power to the entire cell? So it is generated in the mitochondria. So the mitochondria is the basic one. So that which is managed or organized by the Pitta dosha. This is the Kapha dosha. And who is administrating the entire cell? The nucleus. So which contains what you say, chromosomes, DNA, RNA, everything. So who is that fellow? This is in Vata dosha that is managing. This is in nutshell how the cell is functioning. The same thing in the whole in the body also. The similar functions are there. So now let me get into this subject. Actually, the concept ama is a core subject to be understood by the only the Ayurvedic trained people are more understood. But even though, for the sake of the health purpose, all the health preventive measures and all purpose, this is the general thing. Because the concept of ama located not only for a digestion system or parasitical bacterial viral disorders, is even non-communicable disorders, lifestyle disorders, all things are based on this one only. So actually the research not on the paper, the concept of ama is existing since the age-old thing. I am sincere working since 1981 as I am entered into the PG studies. So from there I am working, still it is going on, but it is never ending. It is to be added, and that's one. So just I am going to give you a glimpse of biophysical nature of ama, pathogenesis, and possible modes of how the ama produces. And in light of present day, how to understand it, and what are its parameters, and how we can prevent it. Because the ama condition, the ama rogas are 70% of all the disorders with whom the mankind is suffering is based upon the concept of ama. So the concept of ama is old as concept of Agni. So which is basic in Ayurvedic principles. First to understand the ama, we must know the Agni. So the concept of Agni is a physiological approach and the concept of ama is a pathological application. So before going to ama, let me go enter into the Agni in brief. So what is Agni? So Agni is fire. Everybody can translate in any dictionary. But in the body, where is the fire? So this is a different aspect, how it turns. So all the metabolic activities, whether it is in catabolic activity or anabolic activity, the entire thing are managed by the Agni. So this is, we can say in another terms, the biofire, you can say. So Agni is a prime and ultimate in the process of maintenance of life. So if this is not there, if Agni is not, Agni Mriyate Shantim. So if Agni is over, is pacified, totally Agni is removed from the body, it will be like a dead body. So because there will not be any exchange, anything, any process in the body. So that way, the concept of Agni is so important, is equated to the prana. It's a life, just like a life. So the concept of Agni, understand how the basic factor is, what is the predominant of Panchamahabhutas. In the predominance of Panchamahabhutas is the fire modalities. So Agni Mahabhuta is there. So how the Agni, what is the function, what is the thing? Nayati Parinama Ititi. Always makes the thing, the changes in an organism, in cell or tissue, organ, or in whole body, in entire thing. So Nayati Parinama Ititi. Always brings this in. A constant process of changing. If this is according to any theory or anything, even everything is Anitya and everything, whatever, that process is carried by this concept of Agni. So concept of Agni does not mean only fire. So it is a factor essential for the life. So, and another one important thing, this everybody must know, Agni Gunajanaka Mevacha, not Dravijanaka. Agni never produces a new substance, but what happens, it changes the properties of the substance. For example, you are cooking a rice. So the meal is ready, but meal is not a new item, is derived from the rice. Agni fire is not produced with the rice. So that is the basic thing you want. Energy is neither created nor destroyed. Similarly, the biofire is also same in the body. So where the main role of these things. So you see at a Jatragni level, that is at a gastrium, and another is Bhutagni. Bhutagni means this entire body, or body is made up of Panchamahabhutas, as I said. So every Panchamahabhuta factor will have one Agni to turn out, because all the endogenous substances to be turned, exogenous substances to be turned into endogenous. So for this conversion of the thing, the Bhutagni is one of the main thing. And another important, this enzymes, secretions, hormones, whatever the things are working for the development of the tissue, whether there is a catabolism of the tissue or anabolism of tissue. So that property goes on to Dhatu Agni, that is the tissue maker. So this Agni is basically in 4 states. That is one Tikshna Agni, this is hyperactivity of all the things. Mandagni, hypofunctioning, lowered functions, and Vishmagni, dysfunctioning. Samagni is absolute normal condition. So to avail the facility of health, so this is the main thing. Absolute normal condition of this Agni, that is called a Samagni, to be maintained in the body. So our topic is now related to the Mandagni. All the disorders are the Sama conditions, Samarogas are related to the Mandagni. If you keep this function or the biofire or the Agni to be in a prompt normal condition, then we will achieve the health. These are the important points. Okay. So now coming to the concept of Agni that I already do. This Agni in the body who is managed by the Pitta dosha. Pitta dosha is Agni actually, but it is regulated by Samanavata. That is the main thing, which is at the costum. In the gastrium, it is there. Okay. So let us come to the actual topic, the Ama. What is Ama? So Ama is a substance, whatever may be the particle, from the basic to become an end. There should be some process. If in that process, that item or the substance is an Ama substance, that is unformed. For example, rice is there or rice is there. So if the rice is cooked perfectly, that is called a perfect final product. If it is not cooked properly, it is called an unformed, uncooked, without cooking any raw material. For example, a mango is there, raw mango is there. It is a ripened mango. Ripened mango is the perfect thing, final product. Raw mango is the basic thing. So raw mango is called Ama. So whatever the changes it occurring till it's perfectly ripening, till that time, it is called an Ama condition. If it is perfectly ripened, no, there is no question of Ama. Ama has gone out of the body. So like that, in the digestion and metabolism, everywhere. So that means any substance which attains the finality. For example, you have taken a protein. A simple example, protein, you have taken a protein food that is digested and enter into the amino acid chain. So until it becomes an amino acid, so amino acid is the final product of the protein which you taken after digestion. So that is finality. If it is becoming before becoming the amino acid, if at any stage it is blocked or it is not turned properly, so then it is called a Ama substance. Similarly, a calcium product you have taken. So that calcium to become a part of the tissue in the body, bony part. If that is not become anywhere, if it is stopped that procedure, so then it is called an Ama condition. So Ama is the precursor state of a substance in transformation. Ama is a state of substance resulting in the process of Paka before attaining its finality. So this is the main. So this before attaining finality may be at various levels in the body. As I said to you, just like anything, whatever you consume, So that should be become the part and parcel of your body. If it is not, it should be excreted. So that is its a finality. If anywhere in between it stops, if it is not undergoes the process, then it is called as. So what are the ama as a features? Because biophysical feature as enumerated all like this. So because in the given time I may not explain able to explain all the things. At the digestion level, what are the things? At digestion level, proteins, amino acids. If it is that protein substance has to divide into amino acids, again this amino acid resynthesize the protein. If that is not happen, so that is called a disease. Similarly, fats, fatty acids, carbohydrates, for all it is to be applied. The role of Bhutagni here is, so exogenous factors which we consumed through the food. So there are three ways of consuming: ingestion, that is by eating the thing; inhalation, by taking respiration; and injection, by giving the, anything direct entering into the stream of circulation. So if anything is not in a proper way, is not suitable to the body, then the body gets the reaction. That what we are getting is somebody says, if I have taken the injection, some injection, I got an anaphylactic shock, I got a reaction. Why it is happening so? Because the molecule which you introduced into the circulation is not similar to the part of the body. So that is not undergone any process of Agni. Then it becomes the body wants to throw it out. That what you call in another way antigen or something or something. So that ama particle, that conversion from the exogenous material to endogenous material, if that is not done properly, so that it becomes a ama, it causes several disorders. So what are the things? So there is same thing. The molecule form and size is not accepted by tissue in the same sense that is the ama factor at Bhutagni level and at a tissue level also. In the digestion also, for example, something you have taken, it is not consumed, digested properly. Then what happens? The bowel movement comes as a diarrhea expels in the out of the body. That is also ama. Similarly, the radical, so the ama particle in circulation, it is also pre-radical theory, whatever the things are there, these are all comes under the ama factors only. So ama concept is in a wider one. So all the antigen factors entered into the circulation through GAT, and all parasite, bacteria, virus, any organism entered into the circulation, and any substance which is not equal to the molecules of Sukshma Ahar Rasa in the circulation. So these are radical group of things. These are all molecules are called ama. For example, parasite bacteria, how? Because the bacteria is live here. So if it is lively entered into your circulation, it is damaging the artery. So that means your Agni is not perfect enough to digest it. If your Agni is perfect, it would have killed at the digestion itself. Or if at all entered into circulation, there the enzymatic action should be killed. Or by phagocytic action or cytokinetic action, whatever it may be. So if that is not possible, it manifests the disease. That is called as Samaroga. Its condition is known as Samaroga. So in the Dhatvagni level also, tissue modification, there are several things are there. For nowadays, you are seeing the high uric acid substance. That uric acid to be eliminated. If it is not eliminated, that means it is the process of the protein metabolism is deriving. If that is prevented, if your Agni is perfect, if that is digested properly, so then there is no question of accumulation of in the metabolic end products more. So if it is beyond a normal level, then it manifests a disease. That is the ama. So basically, in brief, I am telling, I think you might have understood. So according to the present day knowledge, once again, I review it. Understanding of ama in light of present day science, non-communicable disorders, lifestyle disorders also, these are also one of the base cause for it. In the process of protein metabolism, these are the things. And these are all other things as well. So all autoimmune disorders, all antigen, Vijatiya Dravyas, the rheumatic disorders, HLA-B27, psoriasis, all these factors are the actually specific to the is the ama conditions. So you see 75% disorders of the ama factors: gastrointestinal, allergic, infective, metabolic, free radical, autoimmune, immunodeficiency, whatnot, lifestyle disorders, everything and comes under the concept of ama. If you understood the ama perfectly, so the 75% diseases we can take it down. So simply, I will explain just before briefly. These are the dietetic indiscretions. If you are not taking a proper diet, an opposite diet or a different diet. For example, nowadays the modern kitchen or modern chefs, what is the sweet and sour, milk and lemon putting it together. This is an incompatible food. What happens? It may be absorbed in circulation, it causes the disorders. Similarly, Vega Sandharana and all other things are there. So the basic underlying principle is all the causes which leads to the hypofunctioning or Mandagni, so then leads to a disease called Ama disease. Okay. So what are the instant features it produces in the body? These are the instant, this one. So you can look into the slide because the time shortage. And even these things, whether it is only hypothetical, no, it is not hypothetical. These can be demonstrated through the laboratory parameters. So in my various books published, this is also clearly mentioned in, by which factor and which AMA is there, how we can diagnose them, like by raising ESRA, SOT, RA factors, CRP, even everything, who can evaluate by the laboratory also, simply not this thing. Okay, so now with the application of this concept of AMA, we can easily treat the disorder. Why? How? Just simple. It's the concept of AMA. This AMA to be treated with the Langana, Shodhana, and Pachana, and Deepana karmas. So by applying these three, by improving Agni, you improve the biofire. Maybe a virus or corona or bacteria, whatever it may be, it digests it, kills it, but it acts in a virus cell. There's no antigen factor is allowed into the body. Then there is no question of disease manifestation like that. So like the autoimmune disorders and free radicals, everything comes under this one. Okay. So the basic thing is Achana, that is oxidizing or opsonizing or killing the substance which is entering into the body. And another thing is Deepana. So how this function is delivered? This function is delivered by activating the biofire. So this is the basic at all level, at gastrin level and at the Panchamahabhuta level, tissue level, and Tattvagni level also. These are the things. So without going for drugs like antibiotics, antiviral, steroids, or any drugs having more harmful side effects, we can treat the disorder with this one. So simply these are the certain examples I have given. For example, a Pratisha flu, we are saying it's a viral, but by simple giving the Trikatu Churna with milk, it is a Deepana Pachana Dravya, this will come. So whether Trikatu Churna can we say is an antiviral drug? No. If you test in the laboratory, it is not antiviral. Whether it is an antihistamine? No, it is not antihistamine. Whether it is a steroid? It is not steroid. But it is treating the disease. How? Because of it is getting Pachana of the AMA. Similarly, the skin allergies also. For all these things, you see the simple phenomenon. It doesn't require any antihistamine, antibacterial, and antistat. So like the autoimmune conditions also. Here also no steroid is required. So simple. Nowadays, this is experimentally studied. Acute rheumatic fever is there. So it is caused by the streptolytic hemococcus. So this one, hemolysis streptococcus, in this one, what we have done, simple Gandharvasthadikada. This is my PG research work I have done. So by treating it, so it is came to normal. So there is no antibiotic in it, no antihistamine in it, no steroids in the Gandharvasthadikada. It's a simple decoction. So like that, there are several reasons. Because of time, I'm skipping. So another one important thing is this is Yadambu Desh Bijani. If your body is with the AMA condition, it will become the culture media for all the bacteria and viral or all other things. So if your Agni is perfect, if there is no AMA in the body, there is no question of survival of anything, no virus, nothing is there. So that you should change the body, your blood into Nirama condition, not into AMA condition. So recent examples I have given the COVID-19. So intake of ginger juice, black pepper, cinnamon, a simple thing, twice a daily dose are successfully prevented. We have experimented in asymptomatic. Nowadays, the government is asking the asymptomatic cases to be at home quarantine. In home quarantine, we are giving the simple medicines with this one. But nobody is undergone any complications or anything and fully treated. After 3 weeks, it become negative. So I don't say these medicines are the antiviral drugs or anything, but they are simple Amapachana Dravyas. Like that, there are several Ayurvedic treatments are given for this one for COVID-19 also. And it is undergoing. The people who are interested in Ayurveda, they are following in the this home quarantine period. So the basic concept is if the AMA is taken out of the body, it will be Prakriti Vihatana. So opposite to the climate of the culture of the virus or bacteria, anything in the body. So that naturally it won't survive. So that is the thing. So what to do? So keeping the Agni in normal condition by maintenance, how the normal condition will prevail? By maintenance of food intake and activities and preventing the formation of AMA. So for that one, a few guidelines, the time permits, I will go. So this one thing concept everybody should know, the body is Deho Ahara Sambhava. It is made by the body, entire body from the womb to death, it is maintained by the food only. How this food derives from the external conditions. So for the balanced diet, what is in Ayurveda balanced diet? You do not go for the vitamins, zinc, and all the things calculated. It's a simple thing. Sarva rasa ahara. You should take these 6 tastes. Citrasa, madhura rasa, katu, kamla, tikta. All these should be 6 tastes should be there in your food. And similarly, all qualities should be balanced condition, ushna, shitala, and all the things. So naturally, there is no question of anything disease. It is balanced diet, not vitamins, not vitamin D, or not something or something. If you without this one, a simple laboratory can also this you can say. And another one thing is psychological desires, and another more important is desires. I will come back again. So the prakriti, the nature of food, heavy light, and the karana, the method of cooking also plays a role, and the combination with other items, rashi, quantity of the food in relation to local condition. You see the quantity of the food. If you take what the charka says, you make your stomach into 3 imaginary parts and fill with one solid, one with liquid, and then give to air. So similar fashion, if you maintain the agni in a proper condition, if you properly cooked material, if you do raw drugs, raw food you are taking. So how this you might be knowing the corona is basically origin from that country. How the people are taking the food, you know. So similarly, the kala, the time also most important in this season is coming, and the upabhoga samsa and another thing is there. So and upayakta, these are all these things. These are the taste, 60 tastes, how you can see, and these are the gunas. I do not want to. So another important one thing, desires. So what is the body desire is there? Always you must listen to the body desire. So psychological desire, you must keep quiet. You, for example, what is body desire? You are having hunger, you want a milk, you want a bread, you want a food, you take it. That's a body need. You got thirst, you take water. So like that, the body desire is there. So what is psychological desire? There's a chilling climate is there, you want Coca-Cola, you want ice cream. So how it is only psychological disorder. Your body is not required to it. So avoid this one and you just listen to your mental desire, psychic. It is better to listen body desire for better health. So naturally, the Ayurvedic concept is pratveshu, rudiheshu, viparita gunesesha. For example, already the body is having, if you are having more of one particular factor, it will have an aversion. So if you are not deficiency of this one, you will have a desire for it. For example, a pregnancy lady wants to eat the chalk piece or calcium chalk or something. Why? Because she is having calcium deficiency. She wants to take from the external. So similarly, when the body is having certain deficiency, it desires. You listen to this one, you fulfill it, then your body will be all right. And when the body is having, you have taken some sweet pieces, few pieces, but your friends in this insist you to take more sweets. So then what happens? So that is, you will have an aversion. So that is pradveshu, ruddhiheshu. And always in winter, having hot clothing and heat giving foods, this is desire, you fulfill it. In summer, cool clothing, cool giving foods, you desire, you fulfill it. So like that, you must listen to the body. So now, again I am coming back, health, balance and tridoshas and disease. So what are to be done, ama production, how to prevent it? You prevent it with the dietetic indiscretions and you must avoid dietetic incompatibilities. And similarly, Vegas and Dharana is one of the important things. You should not hold the natural urges. Whenever the urge comes, you allow it to come out. If you are holding for some time or some reason, or to the social obligations or something, this will lead to disorder. Similarly, Viruddha Chesta, like Ajirna Vyayama, this is one thing we have studied in the 1,000 healthy persons, all are lead to the these rheumatic disorders. What is Ajirna Vyayama? As soon as you are taking food, you are doing exercise, you are running, you are catching a bus, you are running like a machine. So that should not be done. So whenever you have taken food, you should allow some time to at least. So then your Agni will be in proper condition, it digests properly. And another sedentary habits, as everybody knows, I need not go into detail, unhygienic conditions, and another mental instability, emotions and anxiety and fear. So these are the most important things which causes the ama production. So to prevent, this all leads to the Mandagni. So to prevent this one, just insulin. And another disorders also, there are certain disorders, various other factors. For example, hypothyroidism is there, Mandagni condition. So it leads to disorder. So first you prevent this one. Like that. So in prevention of COVID-19, what are the final communication? Because the time is up. So in nutshell, I say, use mask, universally accepted, maintain social distance, universally proved, and by my side, So what I want to say, so keep your Agni to biofire active. So prevent formation of Ama state in the body. This is most important. Your Agni should be active. That means you don't load with all the junk food and all other foods to the body. You allow the body to take a light food and light maintenance. And even COVID period also, somebody says you take heavy food, heavy diet, good fruits and all these things. If you are saying allow the food, loading with fruits, or you are taking the protein diet, loading with the eggs and on this, that is always leads to the Ama condition, it increases more. So your Agni biofire should be active. And if you understood the concept of Ama, if you could meet the challenge of the future, not only this one, all lifestyle disorders, everything will be. So how to maintain it? Keeping Agni Dipti by proper diet, proper physical activity, and mental activities. But drugs are there, but in this session, I am not mentioning any drugs. So drugs is, maybe it may take more than. So my final appeal to this one, in conclusion, I want to say, instead of searching for the various things like pesticide or antibiotic or something thing. This is a concept I'm saying. So picking the weeds and pesticides, killing insects, instead of all the things, allow the soil to make the soil to perfect so as to it will not permit to grow such weeds and insects. So as the rainy season comes, all things comes up. So if it is dry, so nothing comes out. Maybe insect seeds may be there, and pesticide, all these things may be there in the soil, but it won't come. So apart from spending billions for finding antivirals, just you look into this concept. So you make your body not as a culture for the bacteria or anything, for any infections or the diseases. So you make your body as a perfect one, and like without Ama condition, you keep in Agni. So I appeal to all Ayurvedic physicians, that most of the physicians, these are not applying. Always we are behind the drugs. But the concept, Ayurvedic physicians and healthcare professionals just put some interest and have a practical approach in developing the age-old established evidence-based theory like concept Ama for healthcare challenges faced by mankind, by which I feel we get success by this one. Thank you for all, and especially for all the organization for giving me this opportunity.
Thank you, sir. Actually, 30 days live campus classes, that content he has gone through in 30 minutes. And he shared his knowledge. And we are very indebted to you, sir. You accepted our invitation.
Because our principal is warned me to, you must complete within 30 minutes, so that I tried to complete it. So always obey the orders of the organizer.
Thank you, sir. It is not orders. It is actually, that was my request. And thank you, sir. Wholeheartedly, we thank you.
It was very excellent, enlightening speech. Welcome you on behalf of Santhigiri Ashram, Dr. Srinivasulu.
Sir, thank you, sir.
It was so illuminating. Okay. Thank you.
Okay. Thank
so
you.
let me request Sumanapala. Professor Sumanapala, can you hear me? Sumanapala, can you hear me? Professor Sumanapala, can you hear me?
I can hear.
Yeah. So we would like to prepone your speech to 6:30.
Okay, thank you.
Okay. Get ready. 6:30.
Yeah, no problem. Yeah.
Okay, thank you. Good evening, David Lawrence. Good evening. Okay.
There is an announcement for the participants. Participants, please note, the link of the feedback form will be available in the chat box. All are requested to fill it without fail. It is mandatory to fill the feedback form to receive the e-certificate. I repeat, the link of the feedback form will be available in the chat box. All are requested to fill it without fail. It is mandatory to fill the feedback form to receive the e-certificate.
Okay.
To present,
Please invite her next.
Okay,
Ramon,
sir. To present the next section, we invite Dr. Ram Manohar, Research Director at Amrita School of Ayurveda, about Kalabochanam, its contemporary relevance in the light of Ayurveda and Yoga. We welcome you, sir.
So, namaste. I will be able to share my screen and the slide. Okay, yeah. So are you able to see my screen?
Yes, sir. Yes, sir. It is. It is coming. Yes. Yes.
Okay. Right. So namaste and thank you for this invitation. It's a great pleasure to be part of this seminar and to share my views on the topic Kala Bhojanam and its contemporary relevance. So Kala Bhojanam is a very important concept in Ayurveda when it comes to diet. And today I want to talk about it also in the light of some advancement of knowledge, through modern studies in nutrition. So first of all, it's a dictum in Ayurveda that diet is even more powerful than medicine. And it's very interesting that in recent times, there have been interesting studies that have revealed that a radical change in diet can even reverse, type 2 diabetes, which can only be managed with medications. So in this particular study, a low-calorie diet caused remission in 90% of trial patients who were able to lose 15 kilos or more, and even those who had been diabetic for 6 years. So this is really a very important finding and brings to the forefront this idea of diet also being an active therapeutic intervention. So this trial called Diabetes Remission Clinical Trial, direct trial, is still ongoing as I understand. And the 2 interim reports that were published are very, very encouraging. So this was also published in the Lancet. So what I wanted to at the outset point out is that, dietary interventions are beginning to gain attention, and their role in therapeutic management is becoming increasingly realized. So we know that in classical Ayurvedic texts, it's been clearly emphasized that vinapi bheshajair vyadhir pathyadeva nivartate, or pathye sati gadartasya kimaushadha nishevanai, pathye asati gadartasya kimaushadha nishevanai. So in that context, in Ayurveda, we have clearly emphasized this concept of calorie restriction and by the term mitahara. This is very fundamental in Ayurveda. In fact, we have looked into 2 aspects. Later, we'll come to the 3rd aspect also. Hita and mitahara, we are quite aware of this. Hita ahara deals with the quality of the food, whereas mita ahara deals with the quantity of the food that we must, consume. So quantity has to be moderated and quality has to be enhanced. I mean, put very simply, this is the clear message that Ayurveda gives. And then there's so many variables and, parameters that we need to consider before we can individualize a diet for not only for a healthy person, but also people who are suffering from diseases. In fact, there are textbooks in Ayurveda which many of us are aware of, like Pathya Vinishya, where specific diets have been formulated for specific diseases. So now I want to talk about a 3rd factor here today. Normally we talk about Hita Mita Bhuk, but there's a 3rd factor which is a focus of our discussion today, and this is the timing. Hita Mitashi Syad Kala Bhoji Jitendriya. So this is a very clear concept in Charaka Samhita that clearly indicates that for your diet to be balanced and to really be supportive of your health and to even have a therapeutic effect, these 3 things have to be fulfilled. The quality of the food is important, the quantity of the food is important, and also the timing. Unless all these 3 things are harmonized, you don't get the best outcome with your diet. So the quality has to be looked into, the quantity has to be fine-tuned, and the timings have to be adjusted. So today our discussion is specifically on the timings and how it can help to check the problems associated today, especially with overnutrition. So there are studies which have revealed that meal frequency and timing, not just the quality or quantity of food that you eat, but the way you time it is also having an impact on weight gain or loss, and also on metabolic risks, as you know, we refer to this in a modern scientific language. So a study by researchers from the Czech Republic has found that timing and frequency of meals really play a very important role in predicting weight loss or gain. So usually in diabetes, we talk about, multiple meals in a day, small meals, but there are also studies which have indicated that 2 meals a day could also be effective to treat type 2 diabetes. So there's a study which indicated that only eating breakfast and lunch may be more effective at managing type 2 diabetes than eating smaller, more regular meals. So we are beginning to understand today that timing is also crucial. And let's look at now what insights Ayurveda gives. So when you talk about timing, we need to consider both the physical time as well as the biological time. There's this inner biological clock, which has actually been given more importance in Ayurveda when we talk about Kala Bhojana. So if you look at the Ayurvedic definition of Bhojana Kala, it is based on the biological clock, the chronobiological aspect, rather than just physical time. So the Ayurvedic text doesn't tell you that you should have a breakfast at 8 o'clock or lunch at 1 o'clock or dinner, at 7 p.m. I mean, that's not the way Ayurveda has looked into it. I don't mean to say that we should ignore, physical time altogether, but we need to fundamentally look at biological time. I mean, in Ayurveda, the whole concept of healthy lifestyle and diet is based on the concept of becoming more and more aware of what's happening inside your body and how your body is actually even interacting, with the external environment. So if you look at the definition of Bhojana Kala, prasrishte vinmutre hridi suvimale doshe swapathage vishuddhe chodgare kshudupagamane vate nusarati tatha agna udrikte Vishadakarane dehe cha sulakhau prayunjidaharam vidhi niyamitam kala sahimata. So the Bhojana Kala in Ayurveda is based on certain physiological changes that happen inside the body. Your body should have excreted, should have completely processed the food that you have taken previously. And, your gastrointestinal tract must be ready. There should be a readiness to receive the next meal. The doshas should be balanced. Udgara should be vishuddha, which means that it's a sign that your digestive tract is functioning properly. You should have hunger, appetite, and a liking for food. Your digestive system. So this is actually, according to Ayurveda, the Bhojana Kala. So here we do not see any physical time indication. So the fundamental concept is that the best time to eat a meal is when your body really requires food. But then we come to this question, does this mean that Ayurveda advises that you should have a very haphazard way of eating? One day you eat at one time, another day at another time. No, that is not also the advice. So we'll get into that details a little later. So there is also an indication in Ayurveda. So the first, we have talked about the biological timing of when you should eat. And the second, Ayurveda also discusses about, of course, this is borrowed from the whole cultural tradition. In Ayurveda, it's not so explicitly stated, but if you really carefully read Dinacharya and Ritucharya, you can understand that there are only 2 meal timings. In fact, in Sushruta Samhita, there is also a discussion as to how many times a person should eat, and 1 time and 2 times are given as the options there. So we know this famous verse, Sayam Pratar Manushyanam Bhojanam Veda Sammadam Nandara Bhojanam Kuryat. So when it comes to timing, our classical traditions have advised that we must eat only twice in a day, once in the morning and the next in the evening. So it's very important to note here that the word Sayam is used, which means before it really becomes dark, before night advances. you must have your second meal in the day. So we'll have to, put a lot of pieces together. We will do that as we move forward. Of course, we have a very short time. So today we are talking about intermittent fasting. So with this inputs from Ayurveda, let's have a look at what is today being talked about, and then we will come back and, arrive at some conclusions and understanding. So we discussed two things so far. One is that Ayurveda talks about the biological time, Bhojana Kala, and then the physical time, the Sayam, the Pratah and Sayam, two moments. So now intermittent fasting is becoming very fashionable. There are many methods being proposed for intermittent fasting, alternate day fasting, whole day fasting, and there's also this concept of time restricted feeding. So the most studied form of intermittent fasting is alternate day fasting. This protocol involves alternating ad libitum feeding days with fasting days, which typically consist of one meal consumed at lunchtime that contains approximately 25% of the baseline caloric needs of the individual. We also have a whole day fasting concept, which involves 1 to 2 days per week of either complete food abstinence or severe calorie restriction, instead of alternating between higher and lower food intakes each day. These protocols can be as simple as observing one 24-hour fast per week, although some include multiple fasts each week, or sometimes the fast can last longer than 24 hours. Now, time-restricted feeding protocols involve adhering to a daily routine that requires fasting for a certain number of hours and feeding for the remaining hours in a 24-hour period, which means in every day we divide the day into two phases, the feeding phase and the fasting phase. So one popular time-restricted feeding program involves a 20-hour under-eating phase followed by a 4-hour over-eating phase during each 24-hour period. So no studies have specifically examined the popular 16-hour fasting to 8-hour feeding pattern. That's another, approach. So here we have different, variants of this kind of time-restricted feeding. And I want to point out that the Kala Bhojanam concept mentioned in Ayurveda, to some extent, is similar to this time-restricted feeding concept, where you eat only within a certain time frame and the rest of the time you're completely fasting. So which is the best way out? So this is quite the point that we need to focus in our discussion today. Should we eat when what would ideally be Kala Bhojana? How do we define Kala Bhojana? Should we eat when we have the signs of hunger and digestion is good? When the Bhojana Kala or the biological, time arrives, is that when we must eat? Should we have 2 meals a day protocol? Should we do alternate day fasting, whole day fasting, or a time restricted feeding? So this is the question, and this is what we will try to very quickly try and understand in the rest of our discussion. So there are some interesting studies: heavy breakfast and a light dinner with no snacking in between. This has been experimentally studied. This is the study I was talking about in the Czech Republic, which has found that timing and frequency of meals play a role in predicting weight loss or gain. So 50,000 participants, were part of this study, and eating only 1 or 2 meals per day, maintaining an overnight fast of up to 18 hours, eating breakfast instead of skipping it, and making breakfast or lunch the largest meal of the day. This is what they found to be, a very, very significant impact on reducing BMI. So especially if you have a heavy breakfast rather than a heavy lunch, then it has an even more significant impact on your BMI. So this is what I want to point out today. It's not just about, looking at the quality or quantity of the food alone. It's not just reducing the quantity. It's very, very important that we also time the meals properly for it to create a really holistic or, harmonious impact on your metabolism. So the two factors associated with higher BMI were eating more than 3 meals per day and even snacking. Making supper the largest meal of the day was associated with a higher BMI. So skipping breakfast but eating heavily in the night is associated, with poor impact on your metabolism. So eating only breakfast and lunch reduced body weight, HFC, fasting plasma glucose, C-peptide and glucagon, and increased OGIS more than the same caloric restriction split into 6 meals. So these results suggest that for diabetic patients on a hypoenergetic diet, eating large breakfasts and lunches may be more beneficial than 6 smaller meals, during a day. So there are different intermittent fasting protocols. So I just wanted to review what is already known, through empirical research before we come to the Ayurvedic concept of Kala Bhojana. So intermittent fasting protocols, as we said, can be classified. Alternative fasting into the 3 categories that we discussed. Alternative day fasting trials for 3 to 12 weeks in duration appear to be effective at reducing body weight, body fat, total cholesterol, and triglycerides in normal weight, overweight, and obese humans. Whereas whole day fasting trials lasting 12 to 24 weeks also reduced body weight, body fat, and favorably improved blood lipids. And there was 17 to 50% reduction in triglycerides. So, whereas the research on time-restricted feeding is limited and clear conclusions are not so easy at present, but there's an interesting study which I would also like to discuss about time-restricted feeding. So, fasted versus fed state exercise. Findings indicate that pre-exercise feeding enhanced prolonged but not shorter duration aerobic exercise performance. Fasted exercise increased post-exercise circulating FFAs compared to fed exercise. So this is a very important concept in Ayurveda. We say that we should not, exert or exercise after, eating. So pre-exercise feeding blunted signaling in skeletal muscle and adipose tissue implicated in regulating components of metabolism, including mitochondrial adaptation and substrate utilization. So these reviews support the hypothesis that the fasted and fed conditions can divergently influence exercise metabolism and performance. So there are differences in, pre-exercise feeding or, exercise in a fasting state. So this is still being studied. So this is very interesting. There are indications that there are some advantages of, exercising in a fasting state. So then this is a study which I will skip because this is something which we talked about in the beginning. But the whole point of, Kala Bhojanam, which I'm coming to from Ayurvedic point of view, is the logic behind the timing. The premise of a 2-meal day is that by eating 2 meals a day, either breakfast and lunch or lunch and dinner, thus you introduce a 16-hour fasting period where you can make your body to become fat adapted, meaning you burn stored body fat for energy rather than depend on sugars from food. So this seems to be the concept behind the Ayurvedic idea of Kala Bhojanam, where you eat only 2 meals a day in the morning and in the evening. And in the morning, the Ayurvedic timing again is based on the dosha, the dosha cycle, the cycle of the doshas. This is chronobiology. That in the morning, at the junction of Kapha and Pitta Kala, it is an Agni that is beginning to increase. So it's a blazing fire. So at the junction of Kapha and Pitta Kala is when it is most ideal. A very early breakfast is not recommended in Ayurveda. As the Kapha Kala comes to an end, before the Pitta Kala fully manifests, because you want the Pitta to be really increasing after you have consumed the food. So that a little late morning meal is actually the timing that Ayurveda recommends. And because Agni it's a blazing fire, an increasing fire, this is why Ayurveda says that the morning meal can be heavy. So there is a clear indication in Ayurvedic text that pradarashe tvajirnebi sayamasho na dushyate. That is, even if the food taken in the morning doesn't get digested, even if you eat a heavy meal, it doesn't affect the evening meal. But sayamashe pradishtetu pradarasho hi dushyati. But evening is a dying fire. So it's at the junction of, at the end of Vata Kala, that you are going to have the evening meal. So the purpose of the evening meal is to just preserve your digestive fire. So it should not be heavy. And an indigestion that is caused by food eaten in the evening can have, deleterious consequences on your system. I'm realizing that I am running out of time, so I will skip a few slides, which are only more detailed elaboration of, the fasted state, starving state, and intermittent fasting. So here is a words from the Mahabharata, which there is a question. Katham sadopavasi syad. So what I'm trying to come at is, in Ayurveda, we have identified different methods of fasting, different methods of, timing of the food, which may have to be customized according to the constitution of the individual, their lifestyle, their mental makeup. So as we found, all these methods of fasting do have benefits. So they may be relevant in different types of individuals and different contexts. So this is what I want to also come towards as the conclusion, that Ayurveda has given us a general approach to Kala Bhojana, which is based on the 2 times a meal concept, which is based on a clear understanding of the biological timing of eating, as well as the physical time and the chronobiological changes that happen in the environment. I mean, that are influenced by changes that happen in the environment. But in the ultimate analysis, Ayurveda tells that these advices can be flexible and adjusted to the needs of different individuals. So here in the Mahabharata, it has been said that who is a person who is always fasting? Katham sadopavasi syad. Here I want to point out that fasting is not a good translation for the Sanskrit word upavasa, and I'm not going into the detailed meaning of the word upavasa, but here the concept is antara pratarasham cha sayamasham tathaivacha sadopavasi cha bhaved yona bhungte kathanjana. So here is a clear concept, and this was part of our culture itself, that if you eat only 2 meals a day, then you don't need to fast at all. You don't need your weekly fasts. You don't need periodical fasting if you can eat only 2 meals a day. And if you can sustain on 1 meal a day, then that is what is the training in yoga, that eventually your food requirements are reduced to the minimum. When there is no mental stress, your food requirements can become really very minimal. But otherwise, if you are eating only 2 meals a day, then no further fasting is required. But if you eat more than 2 meals a day, then you need fasting once in a week or once in 15 days. And if you eat more than 3 meals a day, then you will need fasting even more frequently. So what we have in Ayurveda is a very flexible and a customizable and adaptive approach to Kala Bhojana, where you can gradually evolve and even cope with, because when you begin with, all of a sudden Ayurveda does not advise that you go to a very strict 1 meal a day program. The whole idea in Ayurveda is basically understanding yourself. Ayurveda is like a mirror. It helps you to understand who you are, why you are behaving in a particular way, what determines your cravings for food, which is, as mentioned by the previous speaker, coming both from physiological needs as well as, from your mind and the stressful state of your mind. So I find that it is 6:30, so I will take the liberty to take 1 more minute to just conclude with a final reference to a study which is interesting and which throws light on the importance of this Kala Bhojana in terms of, the 2 meals a day, Sayam Pradar concept. Animal studies on mice models have demonstrated that adjusting one's meal timing so as to extend the amount of time of fasting has definite health advantages. So if you have so one is the animal study, and this has also been replicated in humans in 2 meals a day protocol, where at the University of Surrey, they did a fasting where 2 groups, were given the same food, the same quality, same quantity, but one group was advised to eat only 2 meals a day, and especially eat an early evening meal. The other group could eat at any time they wished. And they found that the group that had eaten breakfast later and dinner earlier, which is exactly the concept of Kala Bhojana in Ayurveda, lost more body fat and had bigger falls in blood sugar levels and cholesterol. In fact, it has been found that if you eat a lot of heavy food in the night, then the body struggles to normalize cholesterol and blood sugar levels. So this study strongly suggests that having a breakfast a little late, which is what Ayurveda advises at the junction of Kapha Pitta Kala, and having an early evening meal before the digestive fire is completely weakened and the srotasas are actually constricted. This is also very explained. So I'll come to that. So this explanation of the changes in the body physiology in daytime and nighttime, and why we should not eat in the night, is also very well explained in Charaka Samhita and Ashtanga Sangraha. But I'm not going into those details because of lack of time. So late night meals, especially heavy meals, the how it affects your body physiology and leads to problems is also explained here. And in that study, it was clearly found that it is not just the quality or quantity of food that matters, but it is the timing of the food also, which really makes a big difference, because even 2 individuals eating the same quantity and the same quality of food will have different outcomes in terms of weight gain, in terms of controlling the metabolic profile. And so with this note, I would like to conclude by saying that in Ayurveda, Ahara Kala is based on consideration primarily of biological state of the individual, but then it is synchronized and harmonized with physical time, and also the impact of changes in the environment that happens on body physiology. Plus, it considers lifestyle, the place, constitution, and different protocols are advised to adjust to different situations. But on the whole, the 2 meals a day system is considered as the ideal. So I would like to conclude by saying that, in this aspect of Ayurveda we are learning about these things. We are rediscovering some of these insights from Ayurveda through modern studies. In Ayurveda, we are mostly focused on, drug studies, but it's really very, very important that we pay more attention to dietary interventions and look at such interesting concepts as Kala Bhojanam. So Hitashi Syad, Mitashi Syad, Kala Bhoji, Jitendriya. So that is very, very important. I thought that in this short discussion, I wanted to just, throw some thoughts for further thinking and, further exploration. So thank you very much. It was a great opportunity to participate in the seminar. I thank the organizers for this opportunity.
Thank you, sir. You have gone through the Vedas, Panchama Veda, Upaveda, and the contemporary research findings. It is really mind-blowing, sir. And I think you answered the metabolic syndrome that today's world is facing and lifestyle disorders. I think it is really, you touched everything. Though it is a Kala Bhojana, it is a simple one word, but the whole body in which we are living, what are the problems, you conveyed very well, sir. Thank you very much, sir. Over to Gopinathan Pillai, sir. Next, you can.
Yeah. Professor Sumanapala, next. Hello. Hello, Professor Sumanapala. Please. I can hear. Yeah. So next is your turn. We would like to welcome you, Professor Sumanapala. So Professor Sumanapala is a director and professor in the Nagananda International Institute of Buddhist Studies, Sri Lanka. And he was a professor for 30 years in the Kelaniya University, Colombo. And he was, since I understand that He was instrumental in setting up several universities in Sri Lanka. And his knowledge in Buddhism, because when I went to his institute on being invited, I found that they have a separate division in Buddhist Ayurveda and psychiatry and counseling. And they are doing wonderful research and studies in that institute. And in that way, he is fundamentally attached to Indian Ayurveda, and he has a very in-depth knowledge in Ayurveda Shastras. And therefore, he is always willing to associate with all our programs. And we invite Professor Sumanapala to make a presentation.
Thank you very much. First of all, I am very thankful to Santhigiri Research Foundation for inviting me to make this presentation, and all distinguished scholars. I am very happy to meet you and share our ideas. My topic is the challenges of the modern world and how to face with them through Ayurveda. Some ideas. Especially, I hope to present some facts of Ayurveda which will be used to do this task. Then I hope to explain the practical approach, how to develop the practical approach as in the academic context. And first of all, I would like to say that Ayurveda also should have, according to the modern way of structures, the good mission and vision and mission concept. Because, you know, if Ayurveda is confined to several regions or several cults or religions, then it has no global level. Therefore, I think our vision and our mission should be in a global concept. That means theory and practice, and both should be in a global context, because in modern world we have many challenges. Therefore, we have to prepare the vision and mission first. That means vision should be holistic, I think, because Ayurveda also emphasizes the fact that the Ayurvedic approach to diseases is holistic. For example, Ayurveda recommends 3 kinds of treatments: Yukti Vyapasraya Chikitsa, Daiva Vyapasraya Chikitsa, Sattvava Jaya Chikitsa. Then Yukti Vyapasraya Chikitsa means the drugs and others according to the Ayurveda we prescribe for various diseases. And Daiva means karma, Purva Janma Krutang Karma, Tat Daivamiti Kathyate. The Daiva means the karma. And for that purpose, we have to follow religious, ethical, and other ritualistic practices. And Sattvavaja Chikitsa means actually psychological. Therefore, the practices, meditation, yoga, etc., we have to follow. Yoga also emphasizes the fact that yoga, chitta vritti nirodha. Therefore, samadhi is emphasized in yoga also. Therefore, meditational or psychological practices should be performed for that. Then out of the 3 ways of treatment, 2 are holistic. Actually, it is related to many aspects of the culture. Therefore, I think our vision should be holistic. Ayurveda treatment, and also it is acceptable to everyone. And mission also should not be extremist. as Buddhism also emphasizes the middle path, Majjhima Patipada, Ayurveda also emphasizes the same fact. For example, Vagbhata in Ashtanga Hridaya, he emphasizes Anuyayat Pratipadam Sarva Dharmesu Madhyamam. Then Madhyama, that means Na Pidayed Indriyani Nachaitan Nyatilalayed. We should not make painful practices, and also we should not be over-enjoy it. Without going to those two extremes, the middle path should be the mission of the Ayurveda. Therefore, my first idea is that Ayurvedic theory or vision should be holistic, and also Ayurvedic mission should be middle path. Then middle path means, holistic means, in the world, if everything happens due to many causes and conditions, the Buddhism also rejects the two theories, one cause theory and causeless theory, Ekahetuvada and Ahetuvada, because some say that everything happens due to one cause. It is also not acceptable. It is rejected. And also some say, materialists say, everything happens without causes and conditions. It is also another extreme. This extreme also should be avoided. Then what is the correct path is middle path. Therefore, holistic vision and middle way, middle path, middle mission is, I think, very appropriate for Ayurveda to face with the modern challenges in the modern world. Then, for this purpose, in academic level, we can do many things. There are many ways, many methods, but as an academic scholar, I have to say that in academic level, we have to introduce new courses which are very attractive and job-oriented. And those courses should have theoretical and practical aspect. For example, as Professor Gopinath mentioned, I have introduced a course, Buddhist Ayurvedic Psychiatry and Counseling, postgraduate diploma and master level. And some students have done even PhDs in this area. Then there are thousands, more than thousands of students who have completed this. And I can say one student, to name his name is Matthew Eldridge from England, who followed this course, Buddhist Ayurvedic Psychiatry and Counseling. He has established already in London a center for Buddhist Ayurvedic counseling. It is called Manasa, you can see in the internet. And now there is another step that he has taken. Now he has applied to a university in England to do a PhD research in this area. Then they also have accepted it. Therefore, I think if we introduce new courses, we can popularize, we can increase the usefulness of this Ayurveda, because Ayurveda, when we say Ayurveda, there are in Indian Ayurveda originated in India and Sri Lanka. Sri Lanka also they have developed, and in Myanmar, in Thailand, in Korea, in Tibet, in many other lands, they have developed this science. They have added many things in the context of their cultural context. Therefore, I think there should be a center, there should be a research center for coordinating all these traditions, and should launch researchers in the holistic context. And new courses, new drugs should be produced. Then only we can challenge the world challenges, because nowadays we are facing with a big problem, COVID-19. But we know that in our rural areas in Sri Lanka, people daily use coriander, ginger, etc. They boil it and drink every day. Then therefore, I think they have effects. And some researches also have been done in this area. You know that in Hinduism, in Sri Lanka, in Buddhism, etc., we use the banana trees as a sign of welcome. In the wedding ceremonies, banana trees are placed in front of the house as a sign of welcome. And also we use the banana leaves. Then some experiments have been done, not by me. Dr. Uragoda has done such an experiment. You know, he says he is the president of Medical Association in Sri Lanka in Western medicine, and he says that banana leaves has more space, is very big, and also they can we can maintain them alive several days. Then when people are gathered, more carbon dioxide released to the air. Then these banana leaves have the ability to absorb the carbon dioxide and release oxygen. Therefore, now in these days we are very much concerned of the air pollution. No? Then such things, and also we in Hinduism as well as in Sri Lankan tradition, we sprinkle tamarind, turmeric water. No? Then it is a very good practice, and many researches have been done in that area. Therefore, I think although Ayurvedic formulas and all the things are based on experience, actually, therefore, no need experiments. But however, they do not accept it if we don't follow the scientific methods. Therefore, by following the Western medical system, we have to do researches. But however, we should emphasize the fact that although Ayurvedic teachings are based on experience, even the modern productions, especially drugs, we can see in the internet the list of withdrawn drugs. Even after following the scientific methods and after clinical tests, they recommend many medicines. But after using it, after 2-3 years, they withdraw them as maybe side effects, maybe not fruitful, like that. Therefore, experience is more important than the scientific method, because even we follow the scientific method, but when we use it, if we don't get the results, or if we get bad side effects, then we have to reject it. Therefore, experience, Ayurvedic science is based on experience. Otherwise, although we believe that they are given through divine knowledge, but however, they have been used thousands of years throughout the society in Asia. Therefore, we no need any experiments. But however, in order to face with the modern challenges, we have to follow the research methodology and produce the new products. And also, I can remember in Charaka Samhita, under the term Janapadodvangsa, actually these pandemic situations are called Janapadodvangsa. Then the main reason for is adharma. It mentions. That means righteous living. When the righteous living is absent, then everything is polluted. And jala, vata, and desha, and kala, all these are polluted. Then the deities leave the attraction, right? They have no sympathy for the human beings. Then what happens? The seasons becomes imbalanced, and we don't get the rain. Then what happens? Everything is polluted. Then Janapadodvangsa. Actually, in our Buddhist tradition, there is a term called ahivataka roga, but some interpret it as the air released by serpents make some diseases. But in Bombay University, Professor Talima, I think, she has published the work Science and Surgery in Buddhist India, Science of Surgery and Medicine in Buddhist India. There she translates the term as ahita vata, unsuitable air. Therefore, air pollution, environment pollution is very important, because people, when they neglect the traditional ethical framework, spiritual aspect, that you see that in Ayurveda also it is mentioned that samadosa, samagnicca, samadhatu malakriya, prasanna atma indriya mana. Then atma, soul should be pleasant, sense faculties should be pleasant, and mind also should be pleasant. This includes the psychological, ethical and spiritual aspect. Then we cannot separate Ayurveda from spiritual and ethical aspect. It also should be there. And also the prevention is better than cure, we say, because when something happened already, there is no way of getting rid of them. Krutasya karanang nasti. When what is done, it done cannot be undone. That is why before 1,000 years before the English saying prevention is better than cure, in Indian tradition it is emphasized that prakshalanadhi pankasya dura dasparsanam varam. Therefore, we have to prevent it before it happens. I think for that purpose, we need the long-term process of life science. Otherwise, although we have many insights, many theories, if they are not put into practice, they are useless. Jnanam bhara kriyang vina. If there is no action, then only the knowledge is a burden. But Western people say, they also say, technique without theory is blind, and theory without technique is empty. Therefore, all the ethical teachings, that Daiva Vyapasre Chikissa, Sattva Vajayate Chitta, out of the three methods, two are related to ethical and spiritual aspect. Therefore, if we neglect that part, and now if we see in the modern society, although we have very deep philosophical and theoretical practical aspects in our tradition, but what we follow is the modern world system based on technology. Then we have many problems. Therefore, I think modern, but the problem is that our tradition is not acceptable to the common world. Why? They are sometimes sectarian, bias. That is why I mentioned at the beginning, our vision and mission should be holistic. Even we should include the allopathic system, because it is also holistic. It also should be accompanied with Ayurveda. And otherwise, it is not acceptable. Acceptability and sustainability. These two things are very important. Our system that I introduced, Buddhist Ayurvedic Psychiatry and Counseling System, I presented to the World Health Organization Southeast Asia Center. They also recommended it because of two facts. Because we use in our course Buddhism, Ayurveda, astrology, and rituals, and also all kinds of medical systems. Then it is acceptable to all. And sustainability, because if any particular kind of system of treatment is not applicable to any society, they don't accept it. because of their culture. Actually, culture also should be taken as a fact. In modern psychiatry, also they take cultural aspect as a fact that influences for the mentality. Therefore, I think our cultural aspect also should be taken into consideration, and also other sciences like in ancient India, music and dancing, singing, etc. All these things should be accompanied with this in the ritualistic system. In the ritualistic system, they are also included. That is why holistic approach. Without this approach, we cannot popularize our traditional systems all over the world. I think if we organize, the Santhigiri has all resources. It has a research foundation, and also in India there are many research centers. I think they can be coordinated and launch some researchers on this aspect. I think then it will be accepted by all, because now there is a trend in the modern world. They have many side effects because of Western medicine, but it also has many benefits. We should not forget that. But there are disadvantages also in the modern medicine. Therefore, we have to fill up the gap, not as an alternative medicine system, but as a major system of medicine. Because nowadays they always term this Ayurveda, etc., as alternative medicine. It is not alternative. Throughout 1,000 years in Asia, this has been the major tradition of medicine. Therefore, we don't think that it is an alternative system, because there are some diseases, some problems. For example, COVID-19, no way, no method, no remedy. Therefore, I think nowadays we know that even, neem, coriander, ginger, and also turmeric, all these are used by the people. And even we can use the Indian tradition of Vastu Vidya. In Vastu Vidya it is said, Aswatta Mekam, pig tree, Puchimanda Mekam, neem tree, Aswatta Mekam, Puchimanda Mekam, Kapitha, wood apple, Bilwa, Whale, Amalakancha, the Amalaka, right? Amalakancha. Then these trees, and also Panchamravapi, 5 mango trees, Dasa Chinchinikam, the 10 tamarind trees should be grown in our own land. Then you see why these are recommended. Actually, they have healthy environment, healthy effect. Because if we use those fruits, and if we are living under those trees, environment, neem tree and neem leaves, we are using all the time as antiseptic. And if we popularize these things among the common people, I think they will use it. But we have to do counseling or psychiatry for these purposes. In the schools, we have to, in the universities, we have to introduce short-time courses or some units in the course unit system under these subjects. Then, step by step, these subjects will be popularized. It is natural that any tradition, any method, in the course of time, they will be declined. But however, if we time to time, that as in Bhagavad Gita it is said that Paritranaya cha sadhunam vinasaya cha duskrutam dharma sansthapanarthaya sambhavami yuge yuge. The God says, I appear in the world time to time in order to protect the dharma, good people, and punish the bad people, and also establish dharma. Therefore, we also have to introduce time to time new researchers, new courses, new approaches. Then only we can popularize this tradition. Otherwise, the people will destroy our land, the earth. Now they have destroyed half of it. Environmental pollution and food, as the former scholars mentioned about the armor, and also the food time. You know that the food science, that for example, there is no in any science how much food we should take. There is no measurement. We don't know how much food we need, but only in Ayurveda it is mentioned. It should be, matrashi. Matrashi means the likeness. We have to depend on the likeness. If we get four portions of most nutritious food, we have to take only half. Like that. According to the likeness, we have to select the amount of food. Therefore, very, very important factors are there in Ayurveda. I think these are confined to, it seems to me, I don't know whether I am right or wrong, but it seems that they are confined to some confined context. Therefore, we have to open these barriers, limitations, and we should go together with the modern world by doing researches, by introducing new courses. I think they will be accepted. That is the way that at academics that we have to do. There are many other factors that we should emphasize. Even the Santhigiri is doing that, making various kinds of productions. And also I should emphasize that in epidemic seasons, Janapadodvangsa, Charaka Sanghita emphasizes the Panchakarma and Rasayana. The Rasayana is very important. In Siddha system also, Rasayana is given the highest place, I think. Rasayana, as all of you know, Alpamatropayogitvat Aruche Raprasangata Chipramarogya Dayitvat Rasayana is best. Even, when the disease is asadhya, incurable, we do not give medicine. But it says that asadhye pidatavyu. Even in the incurable diseases, Rasayana should be given. Therefore, I think Rasayana can match with the modern Western medicine. They are natural animal products and minerals, etc. But we can use small amounts because nowadays busy life, people like to take very small portion of medicine. The Rasayana has that aspect, and also Alpama Aruchera Prasangata. And also, coction, etc. may be unpleasant to have. But, if we take a small amount of Rasayana, we don't feel taste or untaste. Therefore, it can be taken very easily. And Shipramarogya then the Rasayana become active very, very, very soon, very quickly. Because the other Ayurvedic medicines, it takes time to digest it and make effects. But Rasayana is more important. Charaka Samhita emphasizes the fact and also it says Brahmachari, celibacy. Celibacy is the controlling factor of the life, because Ayurveda is a life for science of life, Then if we want to endure for a long period of time, celibacy or ethical life is very important. It is emphasized. And also, ethical aspect is also emphasized in Charaka Samhita, especially, the restrainment of the senses and the kindness, etc. I should mention that in one of the ancient Indian texts, it is mentioned, Slokardhena Pravakshyami. I will state in half stanza, Yaduktam Grantha Kotisu, what has been said in millions books, right? Slokardhena Pravaksyami Yaduktam Grantha Kotisu. Paropakarah Punyaya. Helping others is meritorious. Paropakarah Papaya Parapidanam. If we are hurting others, it is sin. Like that, Therefore, we should be very kind, compassionate, and also we should follow our ethical system. And also at the same time, we should be able to use those drugs as well as especially the rasayana and panchakarma. Panchakarma means actually in yoga. I think in yoga, although it is said that yoga chitta vritti nirodha, Patanjali Sutra says the concentration is the yoga. But however, it includes the physical exercises also. Then in Ayurveda, I think for the first time in the history, Ayurveda emphasizes the importance of exercise. Vyayamo hi sadapatya, nrunang snigdha bhojanam. If we take nutritious food, exercise is essential. Then also the measurement also is given in Ayurveda. Because people don't know the limit of exercise. That is why over-exercise has created many problems in the society, over-exercise. But Ayurveda advises, well, what is that? Kukshav lalate grivayang yada dharma pravartate. When the sweating occurs on the forehead, on the neck, and on the stomach, you have to understand half of your strength is over. Therefore, you have to stop the exercise when such symptoms arise on the body. Then no harm with the over-exercise. But today, they have no limit in exercise. They are exercising all the life. Then when they come to the 50 or 55, they are suffering from the joint problems, etc. Because over-exercise. But if we follow, and also social context also is emphasized in Ayurveda because of Vyayama. Vyayama means exercise. Na pravisan terayo balat. If we are exercising, if you do exercise, the enemies will not approach you immediately because they get fear. That is why. Even the social aspect also is emphasized. And also in one of the festival in India in Sanchi, I was invited to give a lecture on cricket play games. I said that Krida, then there is a term in Indian context, Deva. Deva means deity, but it has been derived from the root Div. Then the root Div has 10 meanings. Div Krida, Vijigisa, Vyavahara, Dyuti, Istuti, Moda, Mada, Swapna, Kanti, Gati. Then the first meaning is Krida, game. Then actually the deities in the heaven, they are playing, playful, no? Then Krida is given a highest place in Indian tradition. Therefore, I think exercise is also very important nowadays because people are busy morning and evening. They go morning and come back in the evening and have a heavy food like that the former scholar emphasized. Then cholesterol and every problem arises. Therefore, this lifestyle should be adjusted according to Ayurveda. We have neglected that fact. That is why we are facing with actually modern world is full of diseases. Because arogya means without diseases we have to live. But while taking medicine, we cannot say that we are healthy. Because if we are taking medicine, that means we are patients. But the Gilana Pratyaya in Indian context is recommended, ghee, etc. for the healthy persons. They are called Gilana Pache means actually they are taken after getting cure of the disease, right? Therefore, in order to maintain. Actually, in Buddhism, there is the concept of medicine food system. That means our food also is a medicine. Medicine and food, there is no difference. Nowadays, what medicine is totally different from food, no? But in Indian context, both were the same. Panchagorasa, Dadi, Sappi, Navanita, these are recommended because they are food as well as medicine. Then we don't want to take medicine separately. If we take the food recommended in Ayurveda in our tradition, I think no need anything else, because the same food becomes the medicine. Therefore, I think I have made some suggestions. In Ayurveda, we have a wealth of information to create a vision or theory, good vision, good theory, acceptable to all, and also good mission based on middle path. We have many information and advices. We have three methods: direct perception, indirect perception, pratyaksha and anumana. And also we have sabda. Sabda means aptopadesha. We have millions of aptopadesas in Indian tradition. We can take advice from them, and we can verify them in the two methods, pratyaksha and anumana, direct and indirect perception. And we have to do many researches, and we have to introduce new attractive and useful and job-oriented courses. Then I think Ayurveda will be perfect to cure all the diseases, to prevent all the diseases, not like this, because prevention is better than cure. And prakshanala kasya duradah parsanam varam. When we touch the mud, we have to wash. Therefore, we should not touch the mud. That is the good saying. Therefore, I think I conclude, because my time is over. I am very grateful to the Santhigiri and all the leaders of the Santhigiri. I am very familiar with that institute, and we have a link with Nagananda University, and we have signed an MOU. And in the future, I hope to work with Nagananda and all other scholars, and also especially for Professor Gopinath, one of my Kalyana Mitra, and also for inviting me to give this lecture, participate in this seminar. Thank you all for spending your valuable time for my presentation. Thank you very much.
Hello, Professor Thiruvannamalai, thank you for your presentation, and you have rightly pointed out the essentiality of ethics, spirituality, and the middle paths. So these are highly missing in these days. Therefore, you have surveyed all the practical issues, and you have addressed all the practical issues. And this instead of going to Western paradigms, your suggestion that we should put on the very tradition of indigenous medical systems. It is a very vital point that you have suggested, and you introduced before the participants the Buddhist psychiatry and Ayurveda, how it works and how it can contribute, further contribute. And we are thankful to you, Professor Thiruvannamalai, for your enlightened presentation. Thank you.
Thank you very much. Namaste.
Yeah. So let me. So, Sri Dr. Karthikeyan sir, are you present? Dr. Karthikeyan sir. Hello. Hello, dear Karthikeyan sir.
It seems sir is not there, sir.
Yeah.
Shall we have another resource person?
Yeah. So, Karthikeyan sir, are you online? So then let me invite Professor K. Rajasekaran Nair. Professor Rajasekaran Nair is at present the Chief Fellow in Santhigiri Research Foundation. Formerly, he was Professor in Department of Public Health and social medicine in Jawaharlal Nehru University for 30 years. And currently, several articles have appeared on different various international and national journals published by K.R. Nair. And I think he's a very right person to enlighten us on the present situation faced by humanity, especially in this pandemic context. So I invite Professor Rajshekhar Nair to make presentation.
Thank you very much, Professor Gopinath Pillai. My presentation is of a different type. I mean, I don't know whether it will gel with the kind of presentations which have gone before me, but I will try to relate many of the issues that we are facing at the moment. And it's entitled Emerging Disease Trends and Plurality of Medical Systems, a Perspective. Now, I will relate it to the kind of situation that we are facing in Kerala, the present disease trends. We are witnessing a wave of non-communicable diseases coupled with communicable diseases. It's a very, very difficult kind of situation that we are facing. 1/3 of the population has hypertension. 1/5 of the population has diabetes, and especially it is very high among the 45 to 69 age group. It's almost 3/4. There is another trend which is a concern for many public health scholars. Many public health scholars in Kerala. We have written so much about it. It's the question of alcoholism, the addiction, which is over 30%. I mean, you can see if you come to Kerala, I mean, many of us are familiar with the long queues in front of those outlets. And even during this COVID pandemic lockdown period, many of the people were concerned about how to open these outlets, and that was a major concern. Now, the other issue is tobacco use. Due to constant campaigns over the media as well as many other ways through the health services as well, the tobacco use has come down. And however, there is a kind of a conflict, and there is a what we call as an epidemiological epiphany, which is which means that lung cancer is more than 50%. Although tobacco use is very low, the lung cancer rate is very high, while the Indian average is only 7%. And this 15% is comparable to many Western countries where this has been observed long back. So these are the problems that Kerala is facing at the moment. It's against this scenario that we have to examine what are the probabilities, I mean, what are the possibilities that exist before humanity to control these complex epidemiological situation. And we have many of there are possibilities and probabilities, because humanity is actually, I mean, it's looking forward to finding new vaccines. And of course, we may succeed or not succeed. That's a different issue. It's an overclaim in our view, because normally a vaccine takes a number of years to be perfect. But many companies are claiming that it will come in 2 months or 3 months. So anyway, that I'm not going to that issue because of shortage of time. But now what we are facing at the moment is the new pandemic, because it's a virus. It's a new virus. It's a regenerated kind of H1N1 kind of virus. It just measures 80 billions of a meter in diameter. I mean, that's the size of that virus, and it could humble the superpowers of the world, including in Europe and in the US. I mean, so that is the question that we are facing now. The past, I mean, I am presenting this in the form of a past, present, and a future scenario. We had gone through many communicable diseases, infectious diseases. There are slight differences between communicable and infectious. This is not the forum to discuss that. But we have gone through many of these communicable diseases. Almost all of us are familiar with this: leprosy, plague, and cholera. Of course, Kerala claims that cholera has been eliminated, eradicated, but we have still, when we have seen two cholera cases 2 years back. I wrote about this in one of the journals, public health journal. And of course, tuberculosis, syphilis, and smallpox we have succeeded in eradicating. Tuberculosis and syphilis even had affected well-known personalities in the world. Like syphilis, Dostoevsky, Keats, and Oscar Wilde, they were affected by syphilis because of their living style. And tuberculosis, we know Nelson Mandela was affected, Roosevelt was affected. So we know, well-known personalities were affected by some of these diseases, like the present COVID-19, which affected the prime ministers and, of course, even film actors like Amitabh Bachchan. So this is the kind of scenario that we have gone through in the past 1 century or so. And among these, the 1918 pandemic, influenza pandemic, it's also known as the Spanish flu. Although erroneously it's called as Spanish because Spain had nothing to do with this pandemic. The warring countries, the countries of Europe which were in wars, blamed Spain for the influenza pandemic. It seems the virus also originated from China or maybe from Africa. But anyway, the death rate was quite high. It was considerable also in the United States. We have also gone through, the present generation, some of us might have witnessed this, but we did not notice this much. 1957 influenza pandemic, then 1968 another pandemic. 2009 there was another H1N1 virus which did not affect the elderly population, but it affected children because of older people had immunity against this kind of a virus. Now, one of the interesting factor which Kerala witnessed in the last 2 or 3 years is considerable incidence of fever, of unknown kind of fever. We have examined the Kerala legislative proceedings between January to July, and we found that there were about 19 lakhs cases in Kerala, which was extraordinary, which is an epidemic situation, but we do not declare it as an epidemic or something. But what influenced this kind of an epidemic, which was largely harmless, we didn't go through any high levels of mortality from this fever epidemic. Some of the institutions even had cure. They had developed drugs, especially Ayurveda. They had immunity boosting kind of drugs, which were quite, effective also, and I should say. Now, this is the kind of background in which I have to present the future scenario. So from a public health point of view, what we see is the impacts are multidimensional. It had considerable impact on livelihood and education. What we see now in educational scenario, we are all familiar with the children who are going through these online courses. Even now, mothers are learning more than the children, I should say. And of course, livelihood, all this migrant population. We are actually doing a study on the migrant workers, also healthcare workers. We are actually in the process of doing this field work. And its impact on the economy is considerable. And that impact will be known much more seriously after this, during the post-COVID scenario. One issue that I want to focus here is unmentioned or maybe not given so much attention is the issue of fear. And this is an unusual behavioral or emotional response. Normally, we express this during abnormal situations like emergencies, floods, of course. I mean, now Kerala is going through this kind of a flood scenario. And of course, when tragedies happen in society. But this is not given so much attention at the moment. It's also, I call it as a pandemic of fear. And it's also an emergence of fear of infection and death, and the sudden changes in the routine activities. Now, this is a situation which neither the modern systems or medicine, or maybe neither, I mean, even the Ayurveda and other systems of medicine has really handled, because most of these systems of medicine were involved in more on cure than on prevention. I mean, that's something which maybe, I mean, it's an observation, it's an outward observation, not anyway, I mean, based on real facts, but my own inward gazing shows that, I mean, this is something which both allopathy and other systems of medicine should handle, given the kind of situation, because we have gone through some of major instances of suicides, well-known personalities, even children, or maybe younger persons. We have witnessed so many such cases in the past 3 or 4 months. Against such a background, what I observe is, as a public health scholar, also as a person who is used to this inward gazing, I mean, my own reflections that there is a new health orientation, and especially this new health orientation has surfaced after the fever epidemic in Kerala. I mean, we witnessed, it was always there. I mean, kind of a new orientation. It may be a genuine acceptance of plurality of medical systems. Now, as the previous speaker also said, it's not a negation of any systems of medicine. Neither, I mean, it's a total rejection of allopathy against another system of medicine. But we should, I mean, the people themselves have seen this plurality, and they are adopted this, I mean, as part of their health culture. I mean, this is it's an acceptance of alternate ways of thinking by the people, not by any experts or some of us like medical theoreticians like me or philosophers, medical philosophers. But it's a recognition that there are different ways of dealing with the disease, and people certainly has adopted this new health orientation. And this is also, I mean, another phenomenon that I have observed is it has strengthened oral culture. I mean, normally we speak of oral culture as a tribal kind of phenomenon, but what we have seen is that oral culture has strengthened during the past, especially after the fever epidemic, and also now at the present context. It's an exchange of information and action, not just on related to COVID-19. I mean, that's a new issue, but many other diseases as well. We have seen this when people exchange information, and of course, this social media has strengthened this kind of a oral culture. It is actually an interpersonal and inter-household communication. I mean, exchanging information, experiences, different ways of cure. I mean, although and this is an area where some of these systems of medicine has to intervene to actually make it more positive. And also, I mean, there are possible errors. I mean, also it can lead to wrong notions. So this is an area where I would recommend that we should, as a system, different systems of medicine has to intervene. So from a highly optimistic, I mean, I'm an optimist, but therefore I would say that a change towards a more positive popular perspective is what is visible at the moment, rather than some kind of a physician-centered, expert-driven kind of an approach. So this is what we have observed as a public scholar at the moment. Now, it is in this context that I would argue that knowledge traditions cannot be stagnant. I mean, any knowledge systems. Now, allopathy is facing this terrible kind of incompetency. I mean, because they are not able to even handle the virus. I mean, they don't know that kind of a knowledge. And every day they are changing. The day before yesterday, WHO has come out with another kind of an approach to surveillance. So every week people are changing. I mean, the experts are changing. New symptoms are being added to COVID, and new ways of dealing with the disease are also being sort of integrated into this whole system. So therefore, it cannot be stagnant, because if it is stagnant, then the progress will be sort of arrested. So that is the point I want to make and argue, that not just related to the medical subjects also, but it's also equally applicable to spiritual kind of subjects. Now, so new challenges are emerging, new problems are emerging, and always medical systems have evolved responding to these challenges, and that's how we see the present kind of knowledge system that we have in the form of Ayurveda or allopathy or whatever system. So, and many people, contributions of many people have gone into the to developing this kind of a system that we see now. And so we cannot only cite the past and then argue that this was the past, therefore this should be the present. I mean, so that is kind of an argument is not valid. Any knowledge system, any knowledge tradition has to respond to the new problems, and it's not a compromise, as some speaker said earlier. It's not a compromise. It's actually a challenge. And, if Ayurveda has to deal with the kind of problems that we face, it's a challenge. I mean, not a compromise that we have to make. And because all systems are struggling at the moment to deal with the current crisis, philosophically as well as operationally. I mean, so this is a point, the argument that I want to place before you. Because, I mean, you see what allopathy has suggested to control this COVID-19. It's nothing new. I mean, wearing the mask or any kind of physical distancing. It started with social distancing. Then we argued that social is not a very ideal word for this, because it also means some other. It's a different nomenclature. So therefore, social has to be avoided. Then WHO changed to physical distancing, because social means it is strengthening the earlier kind of inequalities that we have, and it has a very deleterious consequences. So therefore, social has been cut down, and we now no more use that word, WHO and some of us, because we argued for changing this kind of a word. You see that some of these strategies that being advocated by different governments here, it is already there. It's an 18th century John Hagart's kind of rules of prevention. When smallpox struck the world, they suggested this kind of these three strategies. So you see, I mean, it has to take up the challenge, because we cannot still live in the past, and I mean, we have to find ways of dealing with this problem. Now, it is in this context that I would argue that the future is going to be a new syncretic kind of an approach, joining together. It should be people-centered and popular kind of orientation. Then only some of these systems will develop. The moment Ayurveda or other systems of medicine take the model of allopathy, it will die. I mean, so because now it has already gone into that kind of a clinical, mechanical orientation. It has lost touch with, because they are copying, even education is being copied on the model of allopathy. So this is the kind of situation that we have to take up. And what earlier speakers have also suggested, this integrated approach. It's not just a holistic approach. It should be an integrated approach with a transdisciplinary orientation. Transdisciplinary is a very complex word. It is not an easy kind of situation, because transdisciplinary means taking together many aspects of the situation and evolving a new integrated philosophy. And of course, the typical transdisciplinary concept is very, very common, very popularly known. It's contained in the WHO definition of health. It's a complete state of physical, social, and mental well-being. That well-being is actually a kind of a transdisciplinary concept, because that word itself has integrated the different modalities and the different structures. Now, this is in conclusion, therefore, I would say that it's not just past. We can always cite because knowledge was generated at that point of time, but we have to also worry about the present. And also, we have to also look forward to the future. What are the possibilities that exist in the future? And this is an analytical unification that we should try to develop for the time. So thank you very much for giving me this opportunity, Professor Govindanath and other people for listening to this presentation. Thank you very much.
So thank you, Professor K.R. Nair. So being a renowned public health expert in India and being actively involved in the research of data analysis of this COVID pandemic, and you have rightly pointed out several valid points, and you have rightly pointed out the limitations of modern medical system in addressing this pandemic, as well as several social issues you have raised. So we are quite thankful to you. Thankful to you, Professor K.R. Nair.
Thank you very much.
Next, may I invite Sri D.R. Karthikeyan. Karthikeyan sir, please unmute your mic. Karthikeyan sir, please unmute your mic. Karthikeyan sir, please unmute your mic.
Yes.
Yeah. So we have today Sri D.R. Karthikeyan. We all are familiar with Karthikeyan sir because he was the former director of Central Bureau of Investigation. He was the Director General of National Human Rights Commission. And at present, he is the president of the Foundation for Peace, Harmony, and Good Governance. I know personally that every now and then this prestigious foundation organizes programs of multidisciplinary, interdisciplinary approach, and they discuss and debate, and they have several action programs also in Delhi and around Delhi. And therefore, Karthikeyan sir is always actively engaged in his social issues, and he is on the board of several prestigious institutions and government committees. He has been ambassador of India in the last government's time to several nations, and in all fields he is widely accepted, known, highly energetic, dynamic personality, totally involved in social service, and he has been a well-wisher of Santhigiri. Always he has been a well-wisher, even at this time. I did something wrong that I thought that I mailed him everything, but somehow or other I missed mailing the link and etc. I apologized. And even then, half an hour back only I contacted. In the midst of postponing other programs, he joined because he loves Santhigiri that much. Sir, thank you, sir. Thank you. Please make your presentation.
Thank you, Professor Gopinath Pillai. I am, of course, the greatest admirer of Santhigiri Ashram, Karunakara Guru, and all those wonderful people doing a great service to humanity in many ways. Siddha College, Ayurvedic College, you are training so many of the therapists, they are there all over the world. Can you hear me? Can you hear me? Yes.
Yes, yes.
Okay. It's a great organization, and I am always willing to support them in every possible way. And I had the privilege of listening to the Professor Samarapala and also the presentation of Mr. K.R. Nair. Very powerful. You're all experts already. I think many experts have spoken. I am a layman actually, that point of view. So, being a layman, I was surprised. Then in the year 2008, the Medicina Alternativa called me to Colombo and gave me a doctorate. I said, what for? I know nothing. He said, no, you have been promoting all forms of alternate systems of medicine for decades. And which is true. And in fact, my conviction is more strengthened by what's happening now and also by what we heard today also. And so I will only be a few words only on Ayurveda and Yoga, and I will go back to that, which is already known. These are all global health issues, require global cooperation in response, planning, prevention, preparedness, and care that reflects health equity issues among nations, and within the nations also among the various people, the rich and the poor and all. Only thing is coronavirus has brought everybody equal, whether the presidents, kings, commoners, big mega stars or ordinary people, everybody is treated alike by this virus. I know Ayurveda therapies have varied and evolved over more than 2,000 years. Therapies are typically based on complex herbal compounds, minerals, and all that. Ayurvedic doctors regard physical existence, mental existence, and personality, everybody all in an integrated manner. Another part of Ayurveda treatment is there are channels, srotas, which transport fluids, and the channels can be opened up by massage treatment using oil and Shedana, what they do in Panchakarma famous in Santhigiri hospitals and all that. So contemporary Ayurveda tends to stress attaining vitality by building a healthy metabolic system and maintaining good digestion and excretion, etc. Of course, the Beijing Declaration on Traditional Medicine, the WHO has established a traditional medicine strategy which involves, among other complementary health issues, Ayurveda also. The WTO mentions Ayurveda in its intellectual property strategy. Traditional medicine, including Ayurveda, contributes significantly to the health status of many communities. In fact, it's told even today, bulk of the population all over the world depend on the natural traditional systems like Ayurveda or naturopathy or their own local systems, because this modern allopathic system is unaffordable, unreasonable to a lot of people, bulk of the population in the world. No doubt about it. The WHO paper asks to integrate traditional and complementary medicine services where appropriate into healthcare service delivery. According to some sources, up to 80% of the people in India use Ayurveda exclusively or combined with conventional Western medicine and also. Yoga therapy, of course, provides the harmony and balance of physical and mental therapies, using the tools taught over 2,000 years ago. Today, of course, we have been promoting yoga, to be observed by the whole world for the last 20 years, but ultimately only when our Prime Minister went to address the United Nations, it came to be accepted by the whole world. Today, International Yoga Day is observed. There is no country, no society which is not practicing yoga. It's for fitness and also as a therapy. Yoga as a therapy is the use of yoga as exercise, consisting of mainly postures called asanas, as a gentle form of exercise and relaxation. And all that. Yoga and mental health, how it helps depression and 4 other conditions. Today, Mr. Nair mentioned about this pandemic of fear, more than the pandemic of the virus and all that. So yoga therapy can promote general emotional balance and assist with good regulation. The holistic focus of yoga therapy encourages the integration of mind, body, and spirit. Modern yoga therapy covers a broad range of therapeutic modalities and all that. Global health issues require, as we mentioned earlier, global approach. Of course, the whole world is struggling to find a remedy against this invisible enemy to whole of humanity, unprecedented and all that. Now, ladies and gentlemen, I would like to recall we had an international seminar in Whitefield, sponsored by the College of Medicine, London, and many other organizations here. Dr. Dean Ornish also, the famous, he was also there. They passed a resolution telling the modern medicine has come to its end. There is nothing beyond. Even the potential medicines are also becoming not effective. So we have to go back to the ancient systems and all that. So ultimately, a resolution was passed about the need for integral system of medicine. So, for example, total healthcare, genuine healing is possible. You need to provide for the human spirit as well as the mind and the body. That's a total healing. So, meditation elicits a specific set of physiological changes. We know cases where meditation has brought about total healing, particularly in mental health issues and all that. Despite medical establishments bias to the contrary, religion and spirituality are playing a very, very important role even today, bulk of the population. Faith, of course, heals, not blind faith, but faith plus certain following certain rituals. Increasing evidence that faith and prayer are powerful healing resources in more conventional medical settings. Then, of course, I know friends now using medical ozone and vitamin C in a large measure to heal even cancer. And they also claim that they can even prevent virus and then heal. And we get reports from many parts of the world, authentic doctors, professor established people, I have seen them. They say where even ventilators could not be used. They have used only medical ozone and total recovery is made possible. And my friends in the south tells me they have seen Siddha medicine, Siddha prevention, so curing people from coronavirus and all that. But what I want to say is that don't reject any system because they have not been able to get created data. The need is, of course, for data to be created. Now, food is medicine is a term which was originally coined by no less a person than Hippocrates, the father of Western medicine. It was his belief that eating wholesome food is the basis for good health. He said almost 2000 years ago, I quote, "Leave your drugs in the chemist's pot if you can heal the patient with the food." Using food as medicine starts by changing your approach to food from that of restriction to introduction of an abundance of the right foods. Take on the role of a scientist and become an expert on the study of your own body and find out what makes it tick. Most of us are conditioned to think that taking a pill out of a bottle will make us feel better. We don't generally think that fresh vegetables and fruits count towards healing. But it is true. Food is the most powerful drug we have. I'm quoting a great man, Parcelus Pick. If you make no other health changes in your life, revisiting the way you eat can absolutely turn your health around, both as a preventive and curative also. Tell me, they say, what you eat, and I will tell you what you are, what is your status of health. The words of the 18th century French epicure Zine, brilliant, hold even today in more ways than one. So from our psychology to history, from how we perceive ourselves to our class, caste and preferred identities, food has a great capacity to unravel all of these. Take a look at a man's plate and you know where exactly where he is and who he is going to be. Amidst all this, of course, also lies the physicality of it all. Food is the basis of life. What we eat makes our physical, emotional, and social selves. I have no hesitation in sharing my experiences with you. I am a diabetic. I was declared diabetic 30 years back. I was investigating Rajiv Gandhi assassination case. Tension, 20 hours a day. Full of tension all the time, traveling all the time, facing the terrorist groups, dealing with the politicians, trying to manipulate. All that created a lot of tension. When we filed the charge sheet, I was declared diabetic 30 years back, exactly 30 years back. Ladies and gentlemen, I continue to work two heavy jobs at a time. Maybe for a few years I was on medication. For a few years I was on insulin. But 2 years back I stopped all that. I make a declaration. Only a Ayurvedic herbal medicine, 1 spoon powder in the morning, 1 in the night, yogasanas. Okay, diet control and all that. Today I'm telling you, particularly thanks to this coronavirus, I'm on very old system of meditation. It's called Anapanasati meditation, breath mindful meditation, morning and evening. I tell you, my condition is what it was 40 years back. Normal, super normal. I eat all fruits. Alternate days banana and they have mango. They say don't eat. I'm 80 plus, working almost, mostly before sitting on this chair for about 10 hours a day and all that. I am making a declaration. It works. The right thought, the right food, and you are healing yourself, bringing peace of mind to your thinking, pranayama, meditation, and positive attitude thinking. I tell you, gentlemen, it can heal us. Integrated system, you can say yes, no need for any prejudice against this system. There is a need for integrated medicine. They gave me a degree 20 years back, but I can tell you, I am more convinced about it today, but much more on Ayurveda, yoga, naturopathy, pranayama, and meditation. So when diet is wrong, medicine is of no use. When diet is correct, medicine is of no need. So living creatures are nourished by food, and food is nourished by rain. And rain itself is the water of life, which comes from selfless worship and service. I'm quoting Bhagavad Gita. Again, to quote Hippocrates before I conclude, the wise man should consider that health is the greatest of human blessings. Let food be thy medicine shall be thy food. And quoting another great man, Mayo, the aim of medicine is to prevent disease and prolong life. The ideal of medicine is to eliminate the need of a physician. I am not against doctors. I'm just telling you. I think we have heard enough yesterday and today, and I compliment Gopinath Das and all the organizers, and my salutation to the great master, Karunakar Guru, who established Santhigiri Ashram. They have been doing great service for over 100 years. Salutations, namaskar to all of you. Thank you.
So thank you, Karthien sir, because so I am again thankful to you because in the midst of that much preoccupations, you joined us, and your experience, your vast experience is found in your presentation, because very practical things you have experienced during various occasions regarding yoga as well as Ayurveda, and moreover how proper diet. So the concept of diet also you explain. So how through a balanced living, a way of life, how a man can be healthy without going to medicine. And so this is more important in the present day world, because now everybody is looking for solutions. How one can be healthy, how one can boost his immune system. So these are all the wild discussions that are going on globally. So in this context, your valid, not only suggestions, your suggestions or advice on your experience, out of your experience, make us quite enlightened. And we are so much thankful to you, Karthien sir, and the whole Santhigiri fraternity. On behalf of Santhigiri fraternity, let me extend my thanks to Karthien sir. Thank you. Thank you. Namaskar.
Namaskar.
So may I, Professor Nagabhushan sir, Dr. Nagabhushan sir?
Yes, sir. Yes, sir.
So next is?
Next is, sir, I think you can do it.
My turn?
Yeah, you can do it.
Okay. So I also would like to make a humble presentation. Though I was, preoccupied with all these arrangements, if I don't make a presentation representing Santhigiri, it would not be fair. So therefore, may I make this humble presentation before you. It is on Navarogya Dharma Siddhanta, an alternative narrative by Navajyotishi Karunagara Guru on Athura 7. So Karthik sir also, all those who are visited Santhigiri knows that. So Guru has always propounded his teaching in three dictums. Annadanam, Adura Sevanam, and Atma Bodhanam. So Annadanam, everybody knows what is meant by Annadanam. So next is Guru gave importance to Adura Sevanam. So Adura Sevanam means providing service, medical service in all its dimensions to the needy. So only after that comes Atma Bodhanam. Therefore, Adura Sevanam has been the hallmark of Santhigiri since its inception. And as we find today, there are more than 90 Ayurveda Siddha hospitals, humble hospitals across India. So in this respect, Guru has propounded a new concept. This is Nava Arogya Dharma Siddhanta. So let me come down to that concept. So we all know that in the beginning of modern medical science, humanity cherished the fond hope that it would liberate humans from the manifold health hazards that they had been subjected to over centuries. But when we take stock of the advantages and disadvantages of modern medical system has bestowed upon humanity over the past 300 years, one finds that despite its remarkable contributions, its ill effects have created diverse, unseen health hazards. A little ago, Karthik sir rightly pointed out the ill effects of modern medicine. And several reports and studies have come out with valid findings how modern medical system impact upon human health. Medicine-induced diseases and deaths are increasing, especially in Western countries. It is unaffordable to the largest majority of common man across the world. Moreover, in the light of the wisdom accumulated over the last 300 years, teaches that modern medical science is unsustainable. It will not sustain. So it is here the merits and eminence of holistic and whole person approach of India's indigenous medical systems like Ayurveda and Siddha draw added attention against the organ-based approach of modern medicine. The unfoldment of human consciousness and the faculty of spiritual wisdom into such an amazing height as exemplified by the knowledge system of Ayurveda may be incredible to modern man who is caught in the vicious cycle of materialistic worldview and instrumental rationality. The examination and diagnosis of diseases, identification of medicinal properties of innumerable herbs, and the complex process of preparations are all a puzzle to modern man who is devoid of basic awareness of spiritual science. Different from modern medical system, the genesis and development of Ayurveda had its origin in the Atmajnana Marga of ancient Indian seers. The founder Guru of Santhigiri Ashram, Navajoti Sri Karunagara Guru, pertinently noted that the knowledge systems originated and evolved in ancient India by the Atmajnana Guru Paramparas were dynamic during the Vedic age or during the Vedic period of Jnana Marga. However, with the eclipse and disappearance of Jnana Marga, at some point of time, the development and evolution of those knowledge systems, including Ayurveda, were arrested. Thus, the disappearance of Jnana Marga and the deviation in Yuga Dharma explains the absence of another Charaka, Susuda, Vagbada, and Dhanvantari since their time. The Guru noted that Siddhantas that emerged since the eclipse of Jnana Marga have not been in conformity with the Dharma of the present Yuga. Therefore, not only ancient, but the modern knowledge system also could not bring about peace, happiness, and virtues in human life and society, the Guru observed. The Guru said, Ayurveda is the science in which the life secret
Not
is...
audible, sir.
Pardon? Can you hear me?
Yes, sir. Continue, sir. Continue, please.
So the Guru said, Ayurveda is the science in which the life's secret is preserved. Our ancestors have given directions to us to overcome the difficulties as well. The time-old methods are still prevalent, but it is not enough for this Yuga. Why? Let us imagine that a person meditates and makes a Devan or a Devi or even the sage Dhanvantari appear, who is considered as the final word in Ayurveda Shastra. The person might even get the secret of few medicines revealed by them. He must use it to treat diseases depending on his spiritual power and the doctrines he believes in. The diseases might be cured. But does it mean, Guru asks, all the diseases of the world are taken care of? So this is a very valid and pertinent point to be pondered over. I doubt how many people will understand the underpinning of what Guru has stated, because we all believe that so some sort of invoking some powers, invoking some mantras, doing some pujas, some this or that, we can get rid of some illness, or we can bring in fortunes in life, or we can get over the miseries in life, etc., etc. This conviction, this belief is being challenged by, not only challenged, Guru denounces it, because this way, over centuries, thousands of years, humanity's great saints, great gurus and rishis have come, and they all have given us their teaching, their paths. People have been following them differently, but now we find that despite all such strivings, despite all such followings, despite having done all such pujas, karmas, astrological solutions, this and that, what is the present situation of humanity? So today I heard from very learned speakers in the morning and the evening session on the amazing knowledge system of Ayurveda. So in Ayurveda, everything is narrated. Everything means a modern man will amaze if he goes through the Ayurveda knowledge system in such a minute, in such a subtle way, all the cause and effect of human illness, ailments, and the necessity of spirituality, in observing spirituality, all such things are being elaborately, wonderfully narrated in Ayurveda Shastras. But where Ayurveda stands, despite all these things, we have wonderful Vaidyas, wonderful doctors, wonderful medicines we claim. We want to propagate Ayurveda across the world. But where do we stand? How far Ayurveda can address in providing immediate cure, immediate solution to multifarious ailments that humanity is subjected to? Do we think that we all will switch over to a different, a very magnanimous, a very natural way of life, and we will abide by the natural laws of, or the laws of Mother Nature, the cosmic order, and that we will lead such a sublime way of life? No, because over thousands of years, our mindset, our way of life have been derailed, and we are under the spell of modern Western civilization and all the advantages that it is giving us. We cannot change. Then, so we find that Ayurveda, despite all its magnificent, remarkable contributions, as I suggested, this point, no Ayurveda Acharya or Vaidyas or students take it seriously. What is Ayurveda? Its evolution and development was arrested. Thousands of years back, the evolution and development of Ayurveda was arrested. With the eclipse of because it was sprouted and developed in the Atmajnana of great seers. It is the source of origin, just like modern medicine has its root in modern science and technology. You cannot marry, there cannot be a marriage between modern science and ancient Ayurveda system, because both are rooted in a very opposite philosophical foundations. We think that once we validate Ayurveda medicines, once we certify Ayurveda medicines, we can export it to foreign countries and earn the acclaim to Ayurveda and earn revenue and glory to Ayurveda. These are all false assumptions. No doubt, Ayurveda can address to some extent, even now, chronic diseases. We know that while we fail with the modern medicine, we go to Ayurveda as a last resort. Now we go to Ayurveda. Several people get solace from Ayurveda treatment. There is no doubt, but it is not enough for Ayurveda, because it is a science, as Dr. T.P. Shashimar said, not in modern medical nomenclature. It is a Shastra. It is a great Shastra, but it has to evolve further. So in this present climate, with validation and scientific experiment, Ayurveda will not evolve to address the emerging healthcare challenges. Because as Guru pertinently noted, only the retrieval and rediscovery of India's lost Atmajnana Marga. One may wonder, is it possible to restore India's lost Atmajnana Marga? Just like in science, we find that several utopias, several theories once people considered as utopias, imaginations. Now we find that all such theories gradually are coming into reality in modern science. We find that. Same way as I tell you, it is not an utopia. All modern world developments are cornering us. If we are not practical, the world will make us practical. All these developments, all these calamities that we face, or the wisdom accumulated over the past more than 300 centuries, will make us to resort to the ancient way, not the ancient, a natural way of life. It is not envy, it is everlasting, it is eternal, it is sanadana. It is that sanadana way of life. Man will definitely today or tomorrow, they will relocate, rediscover. That is why Guru says that this lost Atmajnana Marga is to be restored. Only then the lost wisdom of Ayurveda and all indigenous medical systems will start rediscovering its lost root. And Guru notes that therefore the rejuvenation and restoration of the lost moment of Ayurveda in the present age is possible only with the restoration of Jnana Marga and Guru disciple order. It is in this context the doctrine of Nava Arogya Dharma Siddhanta propounded by the Guru assumes relevance. The concept of Nava Arogya Dharma Siddhanta propounded by the Guru confirms the Dharma of the present Yuga, constitutes an integral part of his teaching and the vision of a new humane world order. The pursuit of material and spiritual life in accordance with the Guru Marga, based on Guru disciple order and the worship of only one universal God, constitute the base of the Dharma of the present Yuga. Both the spiritual and material life have to be reoriented under the guidance of a fully realized Guru ordained by Supreme Light of Brahman. If not, human deeds will bring in misfortunes, calamities, and peacelessness in the world, the Guru observed. The new health science propounded by the Guru has its basis in the Jnana Marga and Guru disciple order that the Guru has established through Santhigiri Guru Parampara. The Guru noted that children born and brought up in this lineage, adhering to dharmic way of life, will put into practice the new health doctrine. Nava Arogya Dharma Siddhanta is the fusion and synthesis of all existing medical systems. It respects and values the health systems existing in all human habitats, in all human societies. It seeks to synthesize the truth in all other medical systems and their positive elements of the Dharma doctrine propounded by the Guru. Since the Atmajnani Guru is the source of all forms of wisdom, the new health doctrine that evolves through the Guru disciple order and the Jnana Marga founded by the Guru marks a new paradigm shift in our healthcare system. So one instance is coming to my mind when I said Guru, a Purna Guru is the source of all forms of wisdom. Once I was standing in the abode of Guru, once Guru was in body. So there was Dr. Thiruvananthapuram, the director of Central Health Siddha Research Institute. Guru was talking to him several fundamental things. At a particular point, Guru told him, look, now we can call which is saint? Agastya. Now we can call Agastya. Since I am here, we can call Agastya and we can ask him, what are the medicines that are being cursed upon? Because in Siddha, several medicines had the curse. Because when that system deviated from the path of Dharma, it got curse from great saints. Guru was telling him, since I am here, we can call Agastya and ask him how it can be resolved. I wondered how Agastya can be summoned and called. So it is a living reality in Santhigiri. I have witnessed a spiritually evolved disciple of Guru. On Guru's word can summon or call any saint and any power, any great or dark power in this universe will appear. It is my experience of large number of devotees in Santhigiri. They will appear before this disciple, not even before Guru. And whatever this disciple asks to this power will be rewarded and obliged with. This is not a public, because in Santhigiri it is never publicized, because it is a knowledge system, it is a parampara where a new way of life and a new path is being put into practice through the children born in this parampara. It is not for publicity. Guru said, you need not to publicize this in course of time. When the whole world is enmeshed in peacelessness, violence, wars, the humanity will clamor for peace, then they will find that Dharma is founded in some parts of this world. They will look upon Santhigiri for solution. You need not to publicize, because this is a new parampara. This is a parampara. This is an Atmajnana Marga which doesn't have any affiliation. Guru never subscribed to any Vedas or scriptures or any existing spiritual stream. Guru subscribed to, because everything got revealed from the source of origin, from the Brahma Prakasha, from where all the revealed wisdom got the seers, all the revealed wisdom in Vedas, Upanishads, because they all received from the source of origin or Brahma Prakasha. Guru got everything revealed from Brahma Prakasha, and Guru's mission is premised on the revelation that Guru's advent is for the restoration of lost Atmajnana Marga and to guide humanity to a new civilization or to a new way of life or to a new righteous life, for which all the past acharyas, all the past rishis, all the past prophets strived for. So therefore, this
Gopinathan sir?
Yeah.
Yes, sir. Dr. Lori is joined.
Has she joined?
Yeah, she joined, sir. And another.
It is good that she has joined. Welcome, Lori Fasya. Okay. So, Nava Arogya Dharma Siddhanta has two dimensions. Firstly, it visualizes a way of life conforming to Dharma by which physical, mental, and spiritual health and well-being of people is nurtured and nourished. Secondly, the Vaidya, being a spiritually evolved person, he treats the cause of the disease in the physical, mental, spiritual level. Medicines are provided considering the time and climate. drawing attention to the irrelevance of modern Western civilization to achieve a righteous life and human sustainability, Navajyoti Sri Karunagara Guru noted the modern knowledge systems and the existing lifestyle and life vision have evolved contrary to the dharma of the present yuga and therefore to the laws of Mother Nature and the cosmic order. That is why, in spite of scientific advancement and socio-economic development, there was no respite in violence and conflicts in human societies. So therefore, my submission is that a new health doctrine, this health doctrine, unifies, synthesizes, because it seeks the evolution and development of Ayurveda in accordance with the changing needs of environment, cosmic order, and everything. In conformity with the changing times, Ayurveda has to evolve further. Then Ayurveda will be 100% capable to address, to provide immediate health care, because Ayurveda will be under the guidance of the Atmajnani Guru, the evolved disciples, who will discern the cost-effective dimensions, who can discern the subtle process, because we know that this subtle environment always influences. Because once I have heard from Guru, we know of Muhurta or Yama. In every Yama, in cosmos, in cosmic plane, the powers that are live are different. I wondered. Then Guru said, a Guru who can catch the karma of this Yama alone can guide people. Because in every Yama, the astral powers that are active in subtle plane are different. Accordingly, the influences of these astral powers will be on human thought system, human activities, etc., etc. Therefore, in prescribing medicine also, it is according to Muhurta, it is according to the influence of astral powers, the Pidrus, and the powers that humans worshipped as gods over centuries, thousands of years. All these influences are, because all these are in Ayurveda. Only thing is that Ayurveda could not, or our spiritual masters could not, spiritual gurus could not identify and locate the significance of Yuga Dharma, because Dharma means the order that hold the human nature, hold the mother nature and the cosmos. This Dharma changes according to Yuga. This, our great saints, our great masters, great gurus could not address, because they all preached and they all put forward their teachings in accordance with the Dharma of Treta Yuga and Dwapara Yuga. Still Hindus worship all these Devi Devas deities. They invoke their mantras. When war was lost, when Arjuna was asked by Krishna to take these people to mainland, Jarasandha came and encountered Arjuna. Arjuna could not do anything. Arjuna lost before Jarasandha. Then Vyasa told Arjuna, Kali Yuga has started. Now all your Varadanas, all these weapons which were given by you, by the Devi Devas through their mantras, will not work. Go and have liberation to your soul according to Dharma. There are hundreds of such instances.
Gopinathan, sir?
Yeah.
So, two resource persons are waiting, sir. We have to complete. Please.
There are such abundant instances. Therefore, this what I presented before you is not for the sake of presentation. I know that it will be very difficult to because this software The software which Guru has brought in is totally absent in the present generations, because the software in us is the software of past yugas, past karmagati, past vasanas, past impulses. Therefore, I am just putting forward before you, there is such a truth, it is to be addressed. Then only we can address in a sustainable manner human calamities, human violence, wars and problems of humanity. Thank you for your patient hearing and patient hearing. Thank you. Thank you. Let me invite Dr. Sri Janardhan Menon to make his presentation, and welcome Lori Fascio. Your 10 will be next. Mr. Menon will make a 15 minutes presentation. After that, we would like to listen to Lori Fascio, and we have been waiting for you. Thank you. Thank you. Please, Mr. Menon, make your presentation and finish it in 15 minutes. Thank you.
At a belated stage and age, I'm coming to talk about the healthy living exposed by Navajyoti Sri Karunagara Guru, founder of Santhigiri Ashram. And at the first and foremost, my humble salutations at the feet of my Guru, to the bhaktas of the Guru, and of the very directions in where the bhaktas stay, and all the people listening to me. And with that, particularly Dr. Karthikeyan, I hope he's around. I missed him. I have seen him after quite a long time. How are you, sir? Now, we'll go to what we came for, the Ayurveda. I will make a slight difference. That is, Ayurveda, we talked about mind, body and spirit, but we will talk about the thing, mind, body and soul. Only as Guru has, Dr. Gopi has made my task easier by giving a very long introduction for it, only when one acts as per the Guru dicta. Ayurveda very clearly says, Purva Janma Kritam Pavam Vyadi Rubena Jayade. Well, if it is Purva Janma Kritam Pavam, how is a Ayurvedic physician supposed to know that? Well, we saw in the morning that the Jyotisham is possible, etc., but that will not suffice. Yesterday, Janani Reme Prabha Tavasini talked about Indra Shuddhi. She echoed the sentiments of the Tirukural, where Tenpulatar Devam Tan, Tirundokal, for all these people, that is 5 dharmas, Dharma, Deva Dharma, Dana Dharma, Graha Dharma, Atma Dharma. All these things have to be got done by a household and not a sannyasi. If that is the case, if that is to be got done, who will do it? To amplify what Dr. Gopi said, I will quote an anecdote which is there in the UNESCO. As they are saying, what you have learnt is a drop. What is yet to be learnt is an ocean. It is a translation of a word, a couplet of Avayar in Tamil Nadu. That has been taken from there. What she says is, Katrathu Kaiman Alavu, Alladadu Olagalavu, Endru, Utra Kalaimadandai Odugiral. That means the last part of it was lost. That was not depicted. The last part is that, so says the goddess of education, Sakshat Saraswati says that. If that is the case of Saraswati, you invoke Saraswati for your education, you invoke other deities for treating them, treating your patient, how will it suffice? That is, he has given the answer that a guru, a learned guru, who was control over the universe, at least one solar system. Guru said that a guru who is capable of controlling at least one solar system, only he can control all these things and do that. Is there anybody who did that? Well, we talked about Paravidya and Aparavidya. No need an introduction is necessary. Aurobindo talks about it. When the disease comes, he says the body is enshrouded by the halo. When the halo is pierced by something, that is an evil spirit, that halo is pierced and the body is pierced. That time the diseases take place. When the body is there, when the halo is there, before piercing the body, it can be treated by, our guru also used to say, it has, you can give them vibhuti or dhustam, it will be over. But when it touches the body, he says, no, you will have to give medication because of that. Now, how are they going to do that? When the body, mind, soul, perfect coordination was there, Purvajanma Kritam Pabam we have talked about, ingress of evil into the aura and the body, and Sri Aurobindo and Navajaloji Sri Karnagara Guru said all these things. I will quote the incident in the life of mother of Auroville, who had mother of Auroville, who said that. And she was in Japan, and the same endemic was there. People were afraid, all with the masks and all that. And someone asked her, why don't you help them? She thought of it, meditated on that, and came to know this meditation became mananam in our system. When the mananam came, she fell unconscious. She was attacked by the same disease. After getting attacked by this disease, she went in a swoon. She saw an evil force, that of an army person with a lot of medals, etc., without his head, falling on her and trying to suffocate her to death. He threw him away, literally threw him away, and at last he got up. And that day, people were asked, the person who asked her to do something, he said, well, I realize now, yesterday onwards you were sick, and yesterday onwards there was nobody to die. And this lady has refused medicine, and of her own Atma Bala, she had to overcome that. This was the case, but the problem was that the complete karma seshi, we call it, the potency has been taken over by her alone. Here, Guru has done it. Navajyothi Sri Karnagara Guru has done one thing. He has universalized the karma giri. He made everyone in the ashram to be responsible, to be the path bearers, to be the pathfinders for this thing, who are equipped with his karma seshi on that. Now, we will talk about the problems which we had, rather the Ayurveda and Siddha systems, how the seers and saints were thinking about and how did they try to overcome. The world is not uniform in size and stature, etc., all over the world. It has got geo-specific areas, And the geospecific areas have geospecific occupations. And this geospecific occupation had its related ergonomic diseases. Ergonomy is a new term, but in the pretty old day itself, they were knowing about it. Any person who's, for example, if there are fishermen, what do? They go in the sea, take out the fish, and what happens is that their body above the hip is fully strengthened. It is strong enough, but the body parts below that will not be, because they were not used. So when these things are there, the diseases will creep in there. And Ayurveda, etc., had found what the herbs, etc., necessary to remedy these evils, these diseases, are kept by the Mother Nature in the very vicinity itself. So you can say there are 8 million species. As per our standard, if for one virus we are taking time for bringing out a vaccine, so many days, so many months, etc., what would have happened if there is a combination of 80 medicines, 80 lakh medicines? Was it possible for a person to find out a remedial methodology? Well, the saints and seers of those days went to the plants and sought their help, asking them what they are capable of, and this thing, through their Paravidya, they asked and got the answer as to how and why the medicine should be used. These Paravidya-based findings only are there in the Ashtanga Hridaya, etc., etc. They have been compiled into a thing of Aparavidya. It's Aparavidya only is being practiced for ordinary folks like us. Now, another problem comes in this, as Dr. Gopi has elaborated. The efficacy has dwindled now. In this change in Yuga, efficacy has dwindled due to ecological and ergonomic changes. And lunar and solar orbit, global warming, Earth losing nutritional value due to overuse of chemical fertilizers and pesticides. Well, when this has come about, how to bring about changes? The Guru said that the changes, the Ayurveda system is apparently not effective now because of these things. Now we have to do, through Paravidya, add or modify the way of preparation. Preparations. He did so, and this through the Paravidya, what he has got, people brought it down through Aparavidya. He brought it out with Paravidya, and he used to add just one single medicine or make one single modification. In that, what he did, he made a contribution usable for the entire lot of people, and the beneficiaries are not only himself, he involved the whole lot of people, because the people who came with their Aparavidya and told him about this were not doctors. Of course, there were two doctors. Others were engineers. Others are workers in the pharmacy.
So, Mr. Janardhan Menu, sir, will you summarize?
Yes. That I would only say this has to be gone. Every person was led like a sannyasi. And ideally found such people did work. No profit motive, only with the prayer. Guru has given them a sankalpa. You'll be surprised to know. You will spread this Ayurveda, the message of this system all over the world as allopathy was spread. But you will not be selfish like them. You will use 1/3 of the profit in that country where the medicines are sold. 1/3 of the profit for flowing back, and 1/3 of the profit for R&D. This was a system. This was a thing which was told to us, and with that we made us. I was also fortunate to compile the detailed project report for the Siddha College and Siddha Medicine System, and with that I remember and I quote the words of the Guru only for the people to know what it is. It's not just simply words of Santhigiri, it is deeds. It is the self-abnegation which was propagated by the Guru and which you have taken up. Thank you very much.
So thank you, Sri Janardana Menon, for your enlightening, presentation on Navajyoti Sri Karunaguru Guru's basic tenets. And I hope that the participants might have, received some points, some valid ideas on this new teachings of the Guru. Thank you, thank you. So let me invite. So Professor Lori Fascio, unmute your mic.
Yes, can you hear me?
Yeah. I can hear you. So Professor Lori Fascio is a clinical professor of yoga and health, Los Angeles, and she has earned her doctorate in physical therapy from Massachusetts General Hospital Institute of Health Professions. Her Master of Applied Science from the University of South Australia and her Bachelor of Science from Boston University. She is a certified yoga therapist through the International Association of Yoga Therapists and is a frequent speaker at professional conferences. Her research interests focus on the subtle body in pain management and the intersection and application of the philosophical science of yoga with the clinical science of modern medicine for improving eudaimonic well-being. She pioneered the first yoga therapy internship at the Simsman Venice Family Clinic in Los Angeles, where interns from LMU gained individualized yoga therapy within an integrative medicine clinic for patients suffering from chronic pain. Her mission is to expand this model into other healthcare and educational settings. So in this context, I understand that she was thoroughly preoccupied and I pestered her. Only then she consented to be with us on this occasion. And Professor Christopher Chappell also told me she's a very good scholar. And on behalf of Santhigiri fraternity, I welcome you, Lori Fascio. And our David Lawrence is very much with us. Professor Christopher Chappell is very much with us to listen to you. Lori Fasio. Thank you. Thank you.
Thank you. Namaste. Thank you for the honor to speak with you and to all of the esteemed speakers whose talks I've been enjoying and for your posting onto YouTube. So I will go ahead and get started. I'm going to share a screen here. Okay, are you able to see my screen?
Yeah.
And you can hear me?
Yeah, please.
Okay. So the lens I'll be sharing from, as you heard, I am a yoga therapist, so I will primarily be speaking from the perspective of yoga. And the context of yoga as a catalyst for global health is this one health is what I'm referring to as global health, which includes our human health and the intersection between our relationship between the environment and animals. And I think the past two speakers' talks were very symbiotic with what I'm speaking to from the Ayurvedic perspective, which is that for our human health, we have to be looking at our relationship with the rest of the planet. This article came out in March at the beginning, towards the beginning of the pandemic. And this was written, it's from Italy, and it speaks to the cause of this pandemic and other pandemics, which we know are yet to come if we don't deal with the root cause. And they identified that human behavior is the cause of these pandemics. And there's three aspects: the destruction of our ecosystems, as we just heard, the trade of wild species, and the unhygienic wild and domestic animal markets. And that in order to preserve our health and well-being, we need to conserve and maintain nature. Professor Chappell spoke to this quite a bit yesterday as to how we can apply the science of the Vedic studies, the studies of Vedic science for this goal. And I believe that this crisis of COVID is an opportunity for integrating yoga and Ayurveda more into standard care. This is a Chinese character for the word crisis. And as you can see, it's made up of two characters. This character represents danger, and this character represents opportunity. So I'm going to focus on this opportunity. So here's a few factors with COVID, why this could be an opportunity. One is that it's a global crisis. While other health crises could be considered to be focused on a specific population, COVID affects our entire global population, and it presents with multiple problems. And modern Western medicine lacks an effective treatment. So there are global efforts seeking solutions, and they're thinking outside of the box because it's a need right now. So I believe it's an opportune time to incorporate the wisdom of Ayurveda and yoga into standard care. And I want to highlight that I'm writing the wisdom of Ayurveda and yoga, not just extracting the practices. There was an article that came out in June from the Journal of Alternative and Complementary Medicine. And this article was written by MIT, Harvard, University of California, San Diego, and the Chopra Institute. So these are all highly respected, more Western medicine organizations. And one of the points that they brought out was that the COVID is rekindling this interest in looking at the role of the host in disease process versus just the disease. And that's where I think as a yoga therapist, I look at supporting the host, looking at the human being and how we can support the human towards well-being versus a pathogenic approach of treating the disease. Interestingly, the same article was primarily focused on practices of yoga for effective treatments and prevention of COVID. And so I just want to highlight the definitions I'm working from. I would call that yogapathy, as one of my teachers, Dr. Ananda Bhavanani, terms, and distinguishing yogapathy from yoga and from yoga therapy. So the context that I'm speaking from is yogapathy would be what is the practice for the symptom. And there's certainly a role for this, although I would call this a smaller role. So this could be the example of when a doctor might ask if I could provide practices for somebody with hypertension so they can do a pranayama that will help lower their blood pressure. So that would fit into this category of yogapathy. And then I will distinguish yoga from yoga therapy, as I think of yoga as a spiritual discipline for kaivalya versus yoga therapy as applying the philosophy of yoga for well-being. And within that is salutogenesis versus pathogenesis. So in the allopathic model, we look at pathogenesis, so looking at what's the disease and how do we combat the disease, versus in yoga therapy, we're looking at moving towards well-being versus treating the disease. So first, I'll just share a little bit about what we might call yogapathy, or some of these evidence-based results of yoga practices that can support people during this time of COVID. And I'll briefly go through these. As you heard yesterday, there is a need for research and quality research for these therapies to be integrated into standard Western care. And so one is that COVID has systemic effects. It affects pretty much every organ in the body. And we know that yoga can have broad psychoneuroimmune effects. There's also an association of the hyperimmune response is the primary cause of death. And all of these are aspects that help to modulate the immune response. So increasing vagal tone, downregulating gene expression, increasing our natural anti-inflammatory glucocorticoid activity, and decreasing stress hormones. So there's evidence of yoga with all of these activities to help modulate that immune response and improve outcomes. It's also, there's some evidence to help reduce viral replication. And then we know that COVID impairs the respiratory function and cardiovascular function, and there's applications of practices for that. For example, when a patient is ventilated from COVID, they have learned that if they put the patient in a prone position, they have improved perfusion in their lungs. And when I work with client in yoga therapy who has lung disease, we also use various asana with breath and different pranayamas to help improve perfusion. Then we have some of the social isolation and caregiving effects on the mental health. And I would add in here financial stresses, occupational stresses. We know there's been an increase in domestic abuse and suicides because of the effects of the pandemic. And yoga can have positive implications for improving mental health, improved mood, improved neurotransmitters, things like that. There's also positive neuroplastic effects and cognition. This is very important when we think about seniors, particularly in the United States, where seniors are oftentimes living alone. And so they're quite isolated and at high risk. And this isolation, they're seeing trends in reduced cognition, which some of these changes, if this goes on for quite a while, can be very difficult to reverse. And this ties directly into physical activity, which, for example, gluteal strength, so the muscles of the buttocks, in seniors is correlated with cognition.